Hello, all my doctor friends. Welcome to another session. It's been a while now. So, what we're going to do, FMG exam is nearby, January 2025. So, it means you must be studying and revising a lot. So, now what we are going to do is 100 important question, new question, brand new question from your previous pattern and everything on important topics. Only important topics I've taken here. So it's going to be like a question answer session and also discussing that particular topic very briefly and important point to point, which you expect, like what we did in 2024 and how you it was really helpful. Most of the doctors said that was very helpful. So same way, we are going to do that one now. Okay. So now we'll start with the first question. So this is the question for FMG Jan 2025. Okay, so let's start our topic. So here, a child after consuming pastry ice cream, okay, and then in a party complains of diarrhea within 1 to 5 hours. Within 1 to 5 hours, there was diarrhea. What is the causative agent and toxin? So what we're going to do now? Look at this. So here they said food poisoning within 1 to 5 hours. 1 to 5 hours food poisoning, only two bacteria can cause this. One is your Staphylococcus aureus, very well, and other one is your Bacillus cereus. Both are within 1 hour food poisoning. So we are talking about food poisoning here, right? Food poisoning or food poisoning. Okay. So staph aureus. Now, what is important? You should know the food. Food is very, very important. What is causing staph aureus? Typically, this one, right? The pastries, one thing, and ice cream, pastry, ice cream, all one thing. Another important thing is potato salad. Potato salad. You know that potato, we call it as aloo. I'll tell you why aloo. Okay. Now, one is pastry. So you already got the question pastry and ice cream. So it's staphylococcus aureus. You know that. So Sirius is out, so only Staphylococcus aureus, this or this. But they have asked enterotoxin F or A. So already there's a clue here. Alu, Staphylococcus is alu. Okay. So alu salad, just put it A for A. So it is your enterotoxin A. Okay. So this is your answer. Staphylococcus aureus, enterotoxin A. So what about F? We'll come to the HEF. Before come to the HEF, B series. B series, the answer for Bacillus series also important question. For that, there should be what is the history? The food history should be a fried rice, Chinese fried rice. In fact, it is Chinese fried rice. It should be Chinese fried rice. So Chinese fried rice is the reheated Chinese fried rice. It's not there. So we are ruling out. We are going with the Staphylococcus enterotoxin A. What about enterotoxin HEF? So this is enterotoxin A. Okay, but enterotoxin HEF. If you remember, enterotoxin HEF means female. Female fatal. So you know that the word fatal comes itself. It is which syndrome? Toxic shock syndrome. It goes toxic. That is the toxin name is called TSST. Toxic shock syndrome. Another T is tampons. If they give the female with history of unhygienic tampon and she got shock-like syndrome, then you will be choosing what tampons? You will be choosing enterotoxin F. That is also Staphylococcus aureus ka enterotoxin F. Staph aureus enterotoxin F. Okay, very, very easy. And one more toxin of Staphylococcus aureus, you know that is one which is causing Staphylococcus scarlet skin syndrome, and that toxin is otherwise called epidermolytic. Skin, no, so epidermolytic. Or we call it as also exfoliative also. It's right. Both are right. But epidermolytic is the right toxin. You call it as epidermolytic toxin. Very simple. And that is safe one. Okay. So this one question surely from this part. Either B series or Staph aureus or enterotoxin F, enterotoxin A, to confuse you, they'll ask. And these toxins, if you remember, enterotoxin A, F, and SS are super toxins. So they're super antigens. Okay. That's all. So this one question, sure, expected, you will know that. Now, let's go to the next question. Look at the next question. See the next question. Here it is given. Here, this 30-year-old beautiful female is on antibiotics with a prolonged IV cannulation. IV cannula. One bacteria should already click in your mind. But before that, she has spikes of fever. It means she already got sepsis. She has sepsis. Fever spikes means it's sepsis. So now a gram stain of the blood culture was given, which showed this picture. Now identify. So you can see here. I'm going to enlarge it for you. If you see here, what is this you're seeing? This is a gram positive because I'm going to change the color here because it's a gram positive means, it's a purple color. So I'm going with the violet color. So this is a gram positive cocci. Gram positive cocci in clusters, right? Cluster. What cluster? Grape-like cluster. Whenever there's a grape, you have to remember what? Staph. I told you always, I tell all my students to remember that whenever grapes comes, you have to remember one thing, staphs. Staff means Staphylococcus staff. Which of any staffs? Malayali staff, Mallu staffs, you want nursing staffs, whatever you want to think. Okay. So you remember the staff's two favorite thing. One is they like a cat because catalase enzyme positive, and every staff, Malayali staff, they like to eat grapes. You see every time they eat grapes. Okay, so remember like that. So one is a cat, another one is a grapes. So grapes because grape-like cluster, cat because catalase enzyme is mandatory positive. But now for us, the clue is IV cannula. Whenever you hear the word IV cannula, anything related with IV cannula or any catheter related or any shunt, most important is the prosthetic valve. If there is the word prosthetic valve, you have to think about which bacteria, which staphylococcus, that is your staphylococcus, that is basically cons, that is basically cons. In cons, which one? You have to think about staphylococcus epidermidis. So see in the option, do you have a staphylococcus epidermidis? No. What is there? Coagulase negative, that is basically cons. Coagulase negative staphylococcus is basically cons. So answer is staphylococcus epidermidis. Okay, very simple. Anything outside, IV cannula, catheter, stent, anything artificial you're putting inside your body, you expect staphylococcus epidermidis infection. That is otherwise called cons. So cons is two. One is epidermis, and another one is a staphylococcus saprophyticus. So now you can expect one question from this point also. In Staphylococcus, apart from Staph aureus, epidermis and saprophyticus is an important topic, every examiner's favorite topic. So you can expect Staph, epidermis. Only one thing to differentiate. One is novobiosine. Novobiosine is epidermis sensitive. His skin is sensitive. Nova skin is sensitive. Epidermidis, saprophyticus negative. But epidermidis causes this. What is the important disease? So here, apart from sepsis, we told the sepsis is one thing. Yes, it can cause. Another important disease is your, remember, subacute infective endocarditis. Especially the word prosthetic valve, when this comes, you have to choose Staph epidermidis. That is must. Okay, important question. Saprophyticus is when, you know, Sapra is this young, beautiful girl. She's a young female, okay, with UTI or honeymoon cystitis. The word honeymoon cystitis. This type of word come, you think about Sapra, the girl Sapra, okay, the beautiful girl Sapra. But when you talk about IV cannula, catheter, everything with skin. So it is epidermidis. Epidermidis means skin. So you think about this thing. Subacute infective endocarditis is an expected question. You can expect if they give you, the patient is having a prosthetic valve and then he developed all this sepsis symptom or a new murmur valve thing, anything comes like that, anything with the heart valve, think about subacute infective endocarditis caused by staphylococcus epidermidis. Okay, but then here is a clutch. Overall, if they ask you acute infective endocarditis, most common cause, okay, or IV drug users, IV drug users, the most common cause is which one? You know very well. If you're saying Staphylococcus aureus, you're right. Overall, it's not. But for subacute, it is epidermidis. Please remember that. Okay. Overall, it is Staph aureus, the king of infection, right? Okay. That's all. We're done with those two questions. So very easy. You're not going to make any mistake here. Be careful and you're going to easily get it. Okay. Everything is easy and simple. You have revised it. It's just here and there you have to get it. Okay. Yes. This is the same question. We already did it. It's just repeated here. The printing, something is available printing. Okay. Now, oh, it has come again. Sorry. I'm very sorry. Yes. Now the third question. Third question is Landsfield classification. Now this one you have to know. Now, in Landsfield classification is done for which bacteria based on which structure. Okay. Very nice question. So first of all here, Landsfield classification. So there are two important classification in Streptococcus. If you remember, what are they? They are basically, I'm just going to write it here. Probably there's a picture here. Okay, no problem. I'll write it here. It's fine. So what you're going to do here is, if you remember, there's one bacteria that is a Streptococcus pyogenes. Right? Streptococcus pyogenes. So for this, we have some classification. How? What is the classification? Let's do like this. Let's start with, what I'm going to do. Let's start with complete Streptococcus classification. It'll be very useful for you. Okay. So when you go with the hemolysis, let's go here down. This is a Streptococcus. Streptococcus means it will be what? It is gram positive, same. It's a gram positive cocci in chains. Strep means chain. Staphs grape like clusters. But Streptococcus gram positive cocci in chains. You can see this chains, yeah, like this chains. Okay, chains. Now, we are going to classify the streptococcus based on the three types of hemolysis. You know that they are beta hemolysis, and then other one is your alpha hemolysis, and other one is your gamma hemolysis. In beta hemolysis, you know there are two important bacteria. It's very important to know. Beta means complete, okay, complete, okay, complete. How to remember? See, beta, remember, like a beta is like a money, so somebody is having lot of money, he will be complete, because you're going to confuse with alpha and beta, which is complete. Don't get confused. When you have beta, Jada beta paisa, if you have money, you're complete. So complete hemolysis. So complete, when your life is complete, everything is in order. You will classify it a group A and group B, like it will be in order. Okay. Alpha men. People say alpha man, I'm macho man, alpha man, macho man. But unfortunately, what? They are partial. They are not really macho when it comes for other activities. Yeah. You know what I'm talking. So it is partial hemolysis. So it is partial. 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 Okay. Gamma is nothing. Nothing is there. No hemolysis at all. That's gamma. Okay, you throw it out. Now, complete hemolysis beta, group A and group B. So in group B, you know the group A is otherwise called Streptococcus pyogenes. Streptococcus pyogenes. Other B is Streptococcus agalactiae. Okay, agalactiae. This is not A for A. Not always A is apple. Okay, remember A is pyogens. Group B is agalactiae. That's important. Partial, there are two. One is Streptococcus viridans. Viridans is our Virat Kohli, right? He's a macho man, but he's partial, alpha. Okay, remember like this. He's alpha, partial. Okay, partial hemolysis. And other one is what? Other one is your Streptococcus pneumoniae. Poor Viru has pneumonia also, right? Poor Viru, he got pneumonia. Okay, what we can do? And alpha, gamma is your enterococcus. Gamma is your enterococcus. Finished. This is a basic classification you've done. Now let's come to a question. Here they said, Lancefield classification done for what? Lancefield classification. Now there are two streptococcus, or two classification. One is based on C carbohydrate. C carbohydrate. Other one is based on the M protein. Both are important. So you have to tell me the name. When they talk about carbohydrate, there is a clue. Lan, C field. See, you already got a clue. You don't have to use your brain. Micros, easy is your top 5 easiest subject if you want to remember the easy way. Funny way. Okay, so C carbohydrate, Lancifil, you got it. M protein. You know, these days MG motors are very popular in India. MG cars, right? MG cars are very, very popular in India. So M protein means G for Griffith. Okay, that's all. These two classification you must know. So in Lancifil classification, what you do, you classify them from A to V, except in between I and J will not be there. Okay, they will not be there, but A to V is there. It's not that important. When M protein Griffith, he classified this group A, Streptococcus, that is Streptococcus pyogen, into more than 100 subgroups. Okay, 100 subgroups. Not important. For us, important MG motor, Griffith is M protein, Lancefield C, I see a big C. So it's based on C carbohydrate of the cell wall. That's it. Now you're going to answer me this question. So Lancefield, so I'm seeing a C here. So I got a C carbohydrate. Excellent. You got a C carbohydrate. So these or this, we don't know. Now, which is that one? Not aureus, Streptococcus. It is for Streptococcus. Okay, it's for Streptococcus pyogenes. So your answer is number 1. Very simple. This much only. Okay, so you're not going to make any mistake in this question now. Okay, 2 classification. Never forget it. It could be an easy mark. Okay, micro should be very easy for you guys. That is the point of this discussion. Okay, now let's go to the next question. Look at this question now. You see here, the patient with a history of a damaged heart wall. He got a damaged heart wall, that's very important. And he developed fever for months and a new heart murmur. A blood culture showed gram-positive coca in chain. So exactly the picture was like this. There's a chain. This is the picture. This is okay. This is the thing you're seeing. So everything you see, it's a chain. There is a chain. And what are the characteristics of this bacteria? So what do you have to think? There is a very nice clue here. So I'm not going to think too much, because whenever I have a damaged heart, I would say when there is a clue damaged heart, the only thing which will come into mind is Virat Kohli. Okay, it will come into mind is Streptococcus viridans. I'm going to think only Streptococcus viridans. I'll think only Virat Kohli, right? Our Viru, I'm going to think he has a damaged heart because of Anushka Sharma. Whatever we don't, he has a damaged heart. That's all. So whenever he has a damaged heart, what happened? The damaged Streptococcus viru, what he causes? He causes subacute infective endocarditis. Be very careful. When the damaged heart, Streptococcus viridans, when the word is prosthetic valve. When the word is prosthetic valve, then it is your streptococcus epidermidis, that is what I'm talking, cones, right? You got it? Epidermidis. That's it. These are two important things. Never ever forget. And both. This also causes subacute infective endocarditis. The clue is only prosthetic means epidermidis nova bison sensitive, and viru means viru has a damaged heart and has pneumonia, also streptococcus pneumonia, because he's a alpha. He's a alpha guy, alpha hemolysis. Okay. So now let's see the characteristic now here. So beta hemolysis out. Beta means, I told, beta is beta. You have a lot of beta, so you have group A, group B, organized, very organized. But now you're coming to alpha. Alpha is a viru. Viru has a step pneumonia. So two bacteria are possible. When I say so beta is out. So either alpha, I'm guessing. So as I told you, once again, we're coming here now to this beautiful alpha. So if you go to alpha, in virulence group, the difference, how do you classify? Viro, nothing is there. Viro, everything is negative, negative, negative. But your streptococcus pneumonia has beautiful 3 tests, which is very important, strep pneumonia. You know what? We all studied in a +2 biology group. Everybody studied about pneumonia, streptococcus pneumonia, that is pneumococcus biogroup. Why did I say biogroup? B for bile solubility, not bile esculin. Bile solubility. Okay. Bile esculin is for enterococcus. Don't mix the two things. Similar words will confuse you. You should be 100% clear. Though it's very easy, that easy thing you have to remember 100%. Okay. I for inulin. Another important question. Inulin fermentation. I would not be surprised if these are the questions. If you get in upcoming exam, I will not be surprised. These are the expected questions. O for optochin sensitivity. Okay, this much only. Very, very simple. So this test is there or not, you have to see. Now let's go back to a question. So what is the question here? Alpha hemolysis is the right answer with bile solubility positive or negative. Bile solubility should be negative because it's a viru. For viru, everything is negative. For viru, all are negative. All negative. Viru is such a damaged heart. He has a damaged heart, acute, subacute infective endocarditis, and he also is all negative. So I'm going to choose, this is a which bacteria? This is an alpha hemolysis with a bile solubility negative. So its option is C. C is the right option with bile solubility negative. If it is positive, then that would be streptococcus pneumonia. There is no link with infective endocarditis at all. Step pneumonia, rule it out. Okay. Now, what about the first one? Beta hemolysis with bacitracin sensitivity. Bacitracin is streptococcus pyogenes. So, okay, if you're good, then we'll finish this also. We'll revise this also. Expected one biochemical from these 4 bacteria, one biochemical 100% guaranteed. So, in streptococcus pyogenes, you know there is only 2 tests. Bacitracin, pyogenes pus. Okay, bacitracin positive, sensitivity positive. Another one is PYR test, pyrrolidine. PYR is easy because it's PY only, so PY. So no any confusion. Okay. But what about Agalatia? Agalatia, I always give a very easy word. Not to confuse, you know what? Agalatia, remember Agartala boys. Okay. Agartala boy. Why I say boy? Because it's group B. Agartala boy likes 2 things. Only 2 things Agartala boy likes. What? You can remember anything? Camp. He loves to do a camping. He loves camping. He loves to do a camping, but with whom he like to do a camping? With an hippopotamus. Can you imagine how crazy he is? Instead of a girlfriend, he's taking hippopotamus for his camping, right? Like this, how crazy he is, yeah? So when I say hippo, it is hippurate hydrolysis. Hippurate hydrolysis positive. Hippurate hydrolysis positive. Very, very simple. So you got it. Expected question. Expect 100% guaranteed one biochemical from here for your FMG exam. Please, I told you very easily and shortly, put it inside your mind. Okay, that's all. Now. So we did the 4th question is over. Now we the next question, 5th question. In 5th question, the PDF of all the file will be given to you. So don't worry. Yes. So now go to the next question. So it's another very easy question, very easy and beautiful question. I'm sure you guys will not make mistake here also. A patient was diagnosed with a painful urination, pus discharge. Oh, painful urination, pus discharge. Something looks like something he has sex, something. So it looks like a urethral discharge. The gram stain was done and the following picture was given. Okay, let's go to the following picture and see. So in this picture, what we can see here, you see in the picture, what are you seeing? This something. Okay, I'm sorry. I had to put the pen here. Yes. So what are you seeing inside? Inside the PMN cell, you're seeing inside the PMN cell, I'm seeing something very strange. A gram negative sort of, coccobacilli like this. Coccobacilli inside, gram-negative this side. Okay, this is what you're seeing, a kidney-shaped diplococci I'm seeing, right? Diplococci I'm seeing. So now when I'm seeing this, so this is clue for me. When I say painful urination and pus discharge, it is basically urethral discharge. Urethral discharge. Urethral discharge is a STD, right? It is a sexually transmitted disease. You know that very well. So in STD, I'm going to write here, STD, urethral discharge, you know that the most common cause of urethral discharge is your gonococcus. Gonococcus, or we also call it as gonococcus or Neisseria gonorrhea. Neisseria gonorrhea. They are same, so don't need to confuse. The first most common cause, followed by is chlamydia. Okay, chlamydia, gram stain is useless. You will not say anything. Only gonococcus you can see. So because I'm seeing intracellular like this, so it is what shaped? You know very well. It is a kidney shaped. Okay, so your gonococcus, the G itself, if you want to write gonococcus, it's like this. It's G. So G, if you tilt, it will look like a kidney bean. So kidney or bean shaped. Kidney or bean. Or kidney bean simply. Shape diplococci. And it's a diplococcus. Diplococcus. Okay. Diplococcus. Now let's see. What are important in our gonococcus? You know very well. Ferments maltose and glucose? No, that is for your meningococcus, because in meningo, MENINGOCCUS, meningococcus. So you have M maltose, G glucose. Very simple. But in gonococcus, we have only G. So only glucose is fermented, right? So it's out. So this is out. This is for meningococcus. Capsule is the main volume, not at all. Capsule is for your meningococcus. That's what it's causing meningitis. Important question. When encapsulated organism, brain, if meningitis, you think about meningococcus. So this is also out. Not. This is not. Complication is Waterhouse-Friderichsen syndrome. Again, not. Waterhouse-Friderichsen syndrome also is for your meningococcus. That is Neisseria meningitidis. Meningococcus or Neisseria meningitis. Same thing. All same. So there, what happened when a complication occurs, you know very well what happened in your meningococcus. You will have adrenal gland hemorrhage. Repeated question. Adrenal gland, when there is sepsis, when already your meningococcus is spreading all through the body, one thing get purpura fulminans. Other one is your adrenal gland hemorrhage, which is called Waterhouse-Friderichsen syndrome. Okay, then what about this one? Here in gonorrhea, the complication, if you remember, two important complications. One is the water can perineum, because lot of discharge perineum, it can cause fistula under the skin. It's like a water can perineum, very rare, but it can. Other one is your, if you remember, Fitch-Hugh-Curtis syndrome, that is the perihepatitis, right? These are the two common complications. So that's out. So now only thing is that Stroud and Amy's media can be used as transport. Absolutely right. Absolutely right. So for that, how to remember, sir? It's confusing. Lot of transport media. You have to remember very easy. Nisa is Nisha. Neisseria is Nisha. Nisha, she starts to aim a boyfriend. She want to aim a boyfriend from where you know, from she want a boyfriend from a chocolate boyfriend, a chocolate boyfriend from chocolate. I have tried somewhere here. Chocolate boyfriend from where? From New York, and his name is Martin, the chocolate guy Martin. Now everything is clear here. So what you have to remember here, Nisa is Neisseria, this girl. Strouds and Emmys. Okay, these are the transport media which we are talking now. Strouds and Emmys. Yeah. Why did I say chocolate? Because chocolate agar. Why did I say New York? New York agar. Modified New York agar. Tire Martin. Tire Martin. They are the selective media. So these are the medias for your Neisseria gonorrhoeae. Very, very simple. That's all. So it's easy. So these are for transport media and these are selective medias. You finish, you're going to get easily score in this thing. Okay, that's all. This much about Neisseria. So we finished Neisseria meningitis also and gonococcus also. Very, very simple. And if you don't forget, meningococcus, the most dangerous one is group the B. The serogroup B is the most dangerous one. Okay, we have to know that also. I'm sorry. Yeah. So don't forget that one. Now, yes, excuse me. Yeah. Okay. Now the next question. Sixth question. Look at this. This is again interesting question here. The following statement about meningococcal meningitis are true except. Okay, now again meningococcus coming because one either meningitis or gonococcus or both you will have one question. So meningococcal meningitis means again what? It is basically we're talking about the Neisseria meningitis. No, we are talking about Neisseria Meningitis, Neisseria, meningitis. Okay, Neisseria, that is a meningococcus, same. So now look at the options. So the source of infection is mainly clinical cases. Something is, they said except, which is a false statement. They asked about the false statement. So what is a false statement? We're going to see. So except. So mainly clinical cases? No, I don't think mainly clinical cases. Something is wrong here. Let's wait. The disease is more common in dry and cold month of the year? Definitely yes. And the chemoprophylaxis is in close contact of the case recommend? Definitely yes. Okay, previously rifampicin, now it's ceftriaxone. Chemoprophylaxis is given, definitely. The vaccine is not effective in children below 2 years of age? Yes, definitely it's not effective for children below 2 years here. So only thing here is the clinical case is wrong because the carrier is basically who are the source of infection is basically the carriers. So it is carrier. The answer here should be carrier, but it's not here. So that's the wrong answer. Okay. Otherwise, we already spoke about Neisseria. Don't forget water Rose syndrome. The purpura fulminans complication. It's a capsulated organism. Okay. And M and G. So maltose plus glucose. Maltose, M for maltose, G for glucose. Positive, positive. Very simple. We already discussed. So I'm going to skip this part now. We're going to next question. Now look at this question. A patient with is very important. They expect this question. Seventh question is very expected. So try to guess before I'm answering. Just read. Let's go to question. Patient with history of antibiotic. I already got it. I read only this question and I know what bacteria it is. History of you have taken an antibiotic and then you're getting a diarrhea. So which bacteria it is? Okay, let's come 1 minute. The following picture was in, and now you see this picture. What I'm seeing all these patches. You see all these white patches. So much. It's like a membrane. It's like a membrane. Some membrane is there. Okay, some membrane. You're seeing some beautiful membranes here. Membrane. We don't know what membrane, but I'm seeing membrane. Okay. So which of the following is wrong? So based on the antibiotic intake and diarrhea and everything, what is the organism you're thinking? You're thinking about Clostridium difficile diarrhea, which causes diarrhea, especially it causes the antibiotic diarrhea. Okay, Clostridium difficile causing antibiotic diarrhea. So what is this membrane? I'm saying pseudomembrane. That's what it is also called a pseudomembrane colitis or colitis or antibiotic associated diarrhea. Simply it's called antibiotic associated diarrhea. So that's the thing. Exactly, they've given here diarrhea, antibiotic associated diarrhea. Now look at this. It is caused by a spore forming bacteria? Definitely yes, because all the Clostridium are spore bearers. All Clostridium are spore bearers, definitely. It's a normal commensal of the gut? Of course, yes. Due to the production of phospholipase A, let's come there. And the treatment, can you give vancomycin? Yes, this is also right. Due to the production of phospholipase A, not at all. Phospholipase A will be going to which one? To your Clostridium perfringens. Okay, perfringens. Though there your phospholipase C is more important than A, but still it is more for Clostridium perfringens, gas gangrene, not for this. Here it is basically which one? Here it is caused by, we have exotoxin A and B. A and B. They are the most important factors here. Moreover, what are the question asked is the ATO. Which are the antibiotics causing it? The antibiotic causing is basically starting with CC. One is your clindamycin, other one is a cephalosporin. Cephalosporins, most common. Apart from that, anything can cause. Amoxicillin, amox, ampicillin, everything can cause. But these two are the most common one. Clindamycin and cephalosporin. Now, for the treatment, we have to give some other antibiotics. So what you will treat? For treating this, you can go with your metronidazole or vancomycin but oral. Okay, oral vancomycin you can go, and oral not IV. Oral is the best. Oral, not IV. That can be a question. And other one is your fidaxomicin. Okay, this is a new one. Fidaxomicin also is given. So at least metro and vancomycin, please don't forget fidaxomicin. I think. Okay, this all Clostridium or spore bearers, except few that X we don't want, and the exotoxin A and B and this thing. That's all. Okay. So your answer here, wrong answer is C. C is your wrong answer. That's all. Okay, got it. I hope I marked the previous answer. Yes, exactly. So we are marked. Now we are going to the next question. Look at the other question. Next question, eighth question. Gas gangrene. Wow. When you get a gas gangrene, you should be like so happy because you know gas gangrene very well. You studied 1,000 times, right? Yes. Now gas gangrene. Excuse me. So I'm going to highlight it. Gas gangrene, which is an incorrect statement. What is incorrect statement? That's the question now. Yes. Okay. Now let's start. So when you go to the glass, so before going to the maybe a little bit, we'll just brief it up. That'd be more easier for you to answer the question. So when I go to gas gangrene, I think about only one guy. Who is. Wait. Do I have the picture here? Yes, we have picture here also. Fine, that's okay. I'll show you the picture also soon. Let's go like this. It's better. So let's say Clostridium perfringens. When I say Clostridium perfringens, I think only one guy, Mr. Perfect. Mr. Perfect. Who is Mr. Perfect? Perfringens perfect. You know who? Mr. Nagarjun. Nagarjun. I remember the actor Nagarjun. Okay, I'll tell you why. Nagarjun, first of all. And second one, he has lots of car. He has a lot of cars and he has a lot of car in his home. Little bit lazy, non-motile. He doesn't move his ass at all. He doesn't move. Okay. He simply sits because so much money he has, so much money he has. So he has cars, he is non-motile, he simply sits at one place, doesn't do anything, and he's bit crazy. You know why? He does camping in a reverse camp. He usually does a reverse camping. And of course, he's a very handsome actor. So what he drinks litmus milk. His favorite is to drink litmus milk. Okay. And believe me, whatever crazy he is, he always has a great target in the movies, which movie to attack, which one to do business. A very good target. He has very good target. Okay. Yes. And then what else? Yes, very good target. Yeah, unfortunately, in movie set, he fell down. He fell and met a very bad road accident. And then what happened? He met a road accident. He got a gas gangrene. Okay. What is this, sir? What is where the story is taking me? Yes, I'll tell you where the story is taking you. So, first of all, remember when I say Nagarjun, there is only one thing you remember Nagler's reaction. Nagler's, we made it Nagarjun. Nagler's reaction. Number one, car, because frequently asked question, box car appearance is Nagarjuna only. I mean, Mr. Perfect. When I say Nagarjuna, it is Mr. Perfect. So it is per fringes. Okay. When I say Nagarjuna, it's Mr. Perfect. So it is okay. Again, box car appearance in gram stain. Okay, that is also your Nagarjuna only. Non-motile, why did I say non-motile? Because it is only non. Usually Clostridium is statally motility. Here it is not motile at all. Yes. Okay. Next point. This is a question. This is a question. This is a question. And reverse cam. Yes, that reverse cam. Another, it's not a normal camp, it's a reverse camp. I'll tell you what is reverse camp soon. Okay. And litmus milk fermentation. Yes, we have litmus milk fermentation. Litmus milk fermentation positive. And what? He has a target. Yes, because why target? We have double zone of hemolysis. I'll show you that picture. Double zone. Double zone hemolysis. Why I say rat accident? Because when you have a road accident, you end up with gas gangrene. Okay, look at the pictures now. So this is the boxcar appearance. Are you seeing? Maybe the picture is a bit hazy. You see here, it looks like a box only. It looks like a box car. Okay, center like this. Okay, so boxcar. And then this is a litmus milk fermentation. And this is a when I say target lesion, you have double zone of hemolysis. Okay, double zone hemolysis is called as the like this. You see, you central colony, and then surrounding you have two layers like a target, like a target. You're going to hit with target like this. Okay, double zone. And then look, this is a gas gangrene you have, and this is your Naegler's test. Naegler's test is to detect the toxigenicity. So if the toxinic strain in egg yolk agar, you see the opalescence. You see this opalescence in egg yolk agar. That is because of that enzyme lecithinase. Okay, lecithinase. That's what you can say it as Naegler's reaction. This is because of lecithinase enzyme. The lecithinase enzyme. Okay, that's like a gun, lecithin gun. You can say. So this is your camp, reverse camp, because in central you instead of streaking Staph aureus, you're streaking which one? You're streaking the Clostridium perfringens itself. In normal camp in central, you will be using Staph aureus here, but in your reverse camp, you're using Clostridium perfringens. That's the reason. So everything you got. So now you see, you're very clear with the gas gangrene. Gas gangrene means Nagarjun, Naegler's reaction. Okay. Now look at this question now. Now it's caused by an aerobic spore wave? Definitely not. Every Clostridium, all the Clostridium closed, so no oxygen means anaerobes. They all are anaerobes. Okay, so first question, that is the answer actually. Okay, what about reverse camp positive? Definitely, we just spoke, he's a bit crazy, so he does the camping reverse. Okay, and clinical feature, release of lecithinase. Yes, that's what I said, lecithin gun. He's very good, Nagarjun, so of course he'll have a gun. He has a lecithin gun, and that's what the Naegler's reactions and all the all the edema, gas gangrene, everything comes because of that. Gas is invariably present in, of course, when you say gas gangrene, definitely it has to be, gas gangrene. Okay. That's basically cause myonecrosis. You have myonecrosis or malignant edema. They call not pustule, malignant edema. Malignant edema. These are the characteristic for the your Clostridium perfringens or sometimes Clostridium welchi. They say Clostridium welchi. Nowadays they stick to perfringens only, so you don't have to worry about it. Okay, gas gangrene is that much only. Very very simple and easy. So you're going to get mark easily in this question also. Okay, right. Now we'll go to next question. Look at this another beautiful question. A child with no history of childhood vaccination. Oh, he didn't get vaccination. Whenever someone talk about vaccination, please remember it's DPT only. They will talk about DPT or polio vaccine only. Okay. So this is one thing. So they're present with a difficulty on breathing. So this child has difficulty in breathing. On throat examination, a membrane bleeding was a membrane bleeding on removal. Okay. I got the clue already. I don't have to think anything. So now, based on this information, what do you think? A membrane bleeding on removal. See, this is the membrane you're seeing here. This is the membrane. So definitely my answer is Corynebacterium diphtheria. This is Corynebacterium diphtheria. Corynebacterium diphtheria. So which type of membrane they are talking here? Whenever something is bleeding, you call it as a pseudo membrane. You call it as a pseudo membrane. Okay, pseudomembrane, that's what it bleeds. The true membrane in your Streptococcus pyogenes causing pharyngitis will not bleed, but here Corynebacterium, it will bleed. That's what it's dangerous. It can go on, cause obstruction, cause this thing. So now Corynebacterium diphtheria. Now when you talk about Corynebacterium diphtheria, you know the main thing is the toxin. The toxin is exotoxin, right? You have exotoxin. Exotoxin A, that is the diphtheria toxin. So diphtheria toxin, it blocks the elongation factor. Definitely, yes, it blocks the EF2 factor. We'll talk about the toxin mechanism later. But yes, it does this, right? And special stain shows metachromatic granule. Yes, the special stains. What are the special stains? If you remember the special stains, that is your, remember pan, some people say plan, everything is fine. So they are basically Ponder, Neezer, as Albert, Pan. The shortcut is Pan. Okay, pan. Diphtheria is Pan. Okay, Albert, and then your N for Neezer. Okay, fine. Iron is critical for toxin? Definitely yes. Antibiotic is the main treatment of this condition? Not at all, because this is a toxin mediator. This is exotoxin A mediator. So that is what happened. There is, you have to give the treatment. We have to give anti-diphtheritic serum, anti-diphtheritic toxin, or we call it as anti-diphtheritic serum is the right option. Okay, antibiotics just to decrease the bacteria. It's not significant. So this is your right answer. Rest all are right. Okay, metachromatic granules, otherwise also called as volutin granule. Volutin granule, and we're going to talk about the stains also. Volutin or Babes earnest granule. We also call it as Babes earnest granule. Babes earnest granule also. Okay, so don't confuse with those things. That's important. Okay, now look at the next one. Next question, again related to this. You guys have to tell me now. So identify the below median, which is incorrect. Okay, now what is the media you're thinking? What is the media given here? This media, this looks like somewhat serum. So I'm going to think what? This is a low-flux serum slope. Low-flux serum slope. We talked many, I mean, this is should be like in your fingertips, right? So low-flux serum slope. So what is important here? This is low-flux serum soap. You know that we use it for diphtheria. In diphtheria, this is the okay, let's go in order. Let's finish the question, then we'll come here. Low-flux serum, yes, right. Sterilized by inspiration, definitely yes, definitely yes. Celtimedia TB, no. This is for TB, which media we use? LJ media, Levenstein Jensen media. I'll show you the picture in a while. Okay, this one you remember. The bacteria grows for 6 to 8 hours, definitely yes, definitely yes. That's true. Because remember, two media is important in your diphtheria. You know what? How to remember? I'll tell you what. You always tell, okay, tell interns or doctors who was new to the ward, in pediatrics ward, tell interns not to loaf around, not to loaf around. You know, these days they will make social media thing, they'll make videos here and there and they'll putting in the word. That is strictly prohibited in diphtheria. So tell interns not to loaf around. When I say this tell is tellurite media. Tellurite, that is potassium tellurite agar. And other one is, when I say loaf, it is your low-flux media. So this is for your diphtheria media, Corynebacterium diphtheriae medias, two important medias. Potassium tellurite media and low-flux, what is important? Means potassium tellurite agar, the growth is fast. You will get the growth within 6 to 8 hours, the growth is positive. You will get the result. In sorry, excuse me, I just Ulta ho gaya. One second. Yes. This one, in your Loeffler's, Hef is there fast. Fast means you get the growth in 6 to 8 hours. You're ready. It's ready. It's ready. It's there. But potassium telluride, see, big name, potassium. This is POT or potassium. Okay. See the potassium telluride, the name itself looks big. Also, it is a selective media. Selective media. Selective media. So, it will take at least 48 hours. That's what. Okay. So this is Loeffler's is the faster one compared to this one. That's all. That's what I want to say. Okay. So if you see here, this is the potassium telluride, the black color. This is the potassium telluride agar, potassium telluride agar. The previous picture which I showed is LSS media. You can get this question or that picture, or you will get this picture. This picture you will get. So this is the Albert stain. This is the Albert stain. So what you see this beautiful what pattern? You must be knowing. One is the Chinese fried rice. It's for be serious when you're eating Chinese fried rice. That you know very well. Be serious when you eat Chinese fried rice. Another Chinese letter pattern. Chinese letter, or you call it as cuneiform pattern. This is for your Corynebacterium diphtheria. Okay, and these are the metachromatic granules. We already spoke about it. These granules we call it as volutin, or we call Babes Ernest, volutin or Babes Ernest, or it's also called as storage or phosphate, metaphosphate granules. So many names are this. Don't confuse this thing. And stained by panda. Pan is important. Okay, that is, Ponders, Albert and Neeser. Pan. Okay, pan. That's all. So Chinese children have diphtheria. That's all. If you forget also, Chinese little have diphtheria. This much only. Okay. So you know very well. So we are done with this now. So your diphtheria is almost revised. So I hope you'll not make any mistake here. Okay. That's all. Now, which of the every point I said is a question. Every point, whatever I wrote there, it's a question. Expect it and you will get it. You will easily get through the FMG for sure. Okay. If you know this, then this is like, it's going to be awesome. You know it. Okay. Next question. Which of the following bacteria acts by increasing cyclic AMP? Sorry. Okay. Cyclic AMP. So we have the toxin mechanism. We have a lot of exotoxins mechanism. So let's say exotoxin mechanism. First one is the CAMP mechanism. First, some bacteria act through CAMP. Okay. And some bacteria act through cyclic GMP. And some bacteria cause decrease protein synthesis. Simply DPS. Okay. Now, cyclic AMP mechanism, you already have a clue. CAMP. C for cholera. A for anthrax. You can make it like ulta. M, if you turn, it becomes like E. So E. coli. Okay, E. coli. And E. coli especially labile toxin. E. coli, labile toxin. And P for pertussis. Finished. Okay. Very simple. You will have definitely 100% one question from this exotoxin mechanism. Okay. So these are the exotoxins of cholera toxin, anthrax, E. coli, work like this. Cyclic GMP, G is gala. Gala, in Hindi, gala is throat. So gala, so what do you do? Vomit. So vomiting. So again, be serious. Emetic type works through this one, whereas your B series, I'm not going to write it, I'm going to have understanding. B series, diarrhea is through anal, no? So cyclic AMP, A for anal, so cyclic AMP or AC. Okay, when I say cyclic AMP is adenylate cyclase, guanylate cyclase, they are same meaning only. This is adenylate cyclase, this is guanylate cyclase. Okay, that is the meaning is same. Okay, fine. And also don't forget your E. coli ka stable. Good people are stable. G for good, stable. Good people are always stable. Okay, stable toxin. Right? Got it. Now our next, decreased protein synthesis. So decreased protein synthesis, we have three bacteria. What are they? One is your diphtheria. Other one is your Pseudomonas toxin. Right? Both are exotoxin A. Both are having exotoxin A. Similar toxins. They have exotoxin A. Doesn't matter. All are exotoxin only. Yes, is Shigella anti. Okay. Now how they work? You already know that diphtheria and Pseudomonas, just before only we solved even a question. It is inhibiting the EF2 factor, elongation factor, and decrease the protein synthesis. Shigella, I told you Sheila anti is always 60. C is in her 60s. Okay. Inhibit 60S unit in the ribosome. That's all. This is basically when you talk about the Giardia exotoxin, this is the mechanism. And of course, tetanotoxin, tetanospasmin that, inhibiting that we have a question, we'll go there. Okay. But now for these three, cyclic AMP unit. Now see the question. So decreasing the cyclic AMP mechanism. So my answer is Vibrio cholera. I have C here. I got a C. So I'm going to Vibrio cholera. Finished. Okay. So that's the answer. So if it's a heat stable, cyclic GMP, stable people are good people. So that also you got it. Now, Salmonella, we're not that important. Salmonella is got a different mechanism. M cell, it attaches to M cell and cause the mechanism. Pseudomonas, just we told, EF2 factor. Diphtheria and Pseudomonas are buddies. So they work same mechanism. Okay, very, very simple. So this question, expect one question, please, you'll get one. Now the next one. Now when you go to the next question, look at this question now. Another very interesting and beautiful question, I would say. A patient present with a profuse watery stool. Okay, this patient got a profuse watery stool. Okay. No signs of fever. Then what I'm going to think? There is he has watery diarrhea. The patient is child is saying what? Child could be child only, mostly child, adult also. And there's no signs of it. No signs of fever, no inflammation. A non-inflammatory diarrhea, pure watery diarrhea. One should think about what? Your non-inflammatory, painless, profuse diarrhea means this is basically, they want to say this is a rice water stool. This is basically rice water stool. When you think about rice water stool, the only thing which comes into my mind is Vibrio cholera. Vibrio cholerae. That is cholera. Basically, it's a cholera. Vibrio cholerae. The one which has which motility, darting or shooting star. Darting or shooting star motility. Shooting star. I'm writing it because question is expected from there. Okay, fine. Now let's go to the topic. Infected doses except, they said which is except. Infected doses 10 to the power 3, 10 power 6. No, somewhere it's mistake here. I want to think about it again. So wait. Cultural media is TC-based media? Of course, yes. You know that. Vibrio dolramis, I say Viba is a darling, darting. Okay, Viba. So Viba, this girl Viba is a darling. First of all, she is beautiful. She's a slim beauty. Slime, no, it's very slim. It's very curved bacilli. We call curved bacilli. She's a slim and she's a darling star. She's a darling girl and she's star. Okay, that's Viba's story. You remember where she works? She works in TCS company. She works in TCS company. That is a selective media. So this is right. TCBS, taurocolate, citrate, bile salt, agar. That's fine. And then transport media, I think, I don't want to talk those things yet. Transport, they might ask you. Transport Kelly, you know that her car driver is Venkat Ramanan. And she always carries a carry bag with her, Carry Blair's media. And Venkatraman Ramakrishnan, carry bag she carries. And another one, what she does? Autoclave seawater. Her favorite choice during transport is autoclave seawater. Seawater. Okay, that's fine. Then no, something is missing. This is a selective media. Selective media. This is a transport media. Then what about enrichment? So only one is left. No, enrichment, which is frequently at this time, you can expect enrichment media. So enrichment media, the beauty secret of Viba is alkaline peptone water. Alkaline peptone water. Anything alkaline she loves. Seawater, alkaline peptone, these are the things she likes. Everything is a question. Okay. So this is for clue. I'm just going like this. Okay. So now. So TCBS is right. Produces the indole and reduces it? Definitely, yes. Indole is catalytic. Vibrio. The name itself, if you forgot also, Vibrio. O is like a ring. So indole ring. Okay. Indole forms indole ring, reduce nitrate. Fine. String test positive, definitely yes. String test is a special test. You put you mix the colony with the bile. You try to lift it up. You'll see a string shape thing. See, one string is here. Another string will come in your giardia. You put a capsule with a string and then you take it. Okay, that was the question is there. Another string is Viba. Viba has a string. At the end, what happened? This poor girl Viba, she's died herself because of so many other problems. She died herself hanging using a string. Okay. Hey, this is just for remembrance, nothing, this thing, okay? So string, suicide with string. That is this poor girl's, she did this Viva, no? Unfortunately, she did like this, okay? So remember like that for exam purpose, okay? So string test. So what is wrong here? 10 power 3, 10 power is very wrong. Why? Because I'll tell you. Salmonella, Shigella, their infective dose is very, very bad. The one is Vibrio cholera. So you know that Shigella is highly, highly, highly dangerous. So 10 to 100 is bacilli per ml is enough. 10 to 100 bacilli per ml is enough to cause the infection. Whereas Salmonella, 10 to the power 3 to 10 to the power 6, Salmonji. where Vibha needs more than 10 to the power 6. Okay, that means only when acidity has become, you have a lot of the acidity, you're taking medicine, you converted your acid environment in your stomach into an alkaline environment, then only Vibrio can cause the infection. Otherwise, no. Okay, so simple, simple, simple. Okay, the motility, you know, darting motility, shooting star motility. Okay, the changes the path here and there, and this is a string test positive. That's all. This is for your Vibrio cholera. Very, very easy and simple. You are going to shine in that question. Not going to make any mistake. Now, this question nowadays, examiner's favorite question. Please be careful. Continuously, I'm seeing Neet exam they asked, and INICT they asked, and also in your one more exam, I forgot. They asked in that also 2-3 exams continuously related to this one. This is basically mycetoma. So let's talk about it now. So look at this beautiful question here. What happened? A farmer presented with a swelling and discharge. First of all, it's a farmer swelling and discharge in the foot. He was working barefoot on anaerobic culture. There is a click. Anaerobic culture. There was a filamentous gram positive bacilli. Filamentous gram positive bacilli. Now you have to identify which is the false statement. Identify which is the false statement. Do we have a space here? Let me see. Oh, no. Okay, no problem. So we'll go to here only. So now what? Okay. So now look at this. So whenever this picture comes, this is the picture given. This is a anaerobic, first of all. Filamentous, let's go to purple only. Filamentous gram-positive bacilli, it looks exactly like this, okay? It is a purple color, but it's very filamentous like this. See, it's like filamentous like this. So this type of bacilli comes, you have thinking only about two things. What are they? One is your actinomyces, actinomyces israeli, and other one is your nocardia, nocardia. Okay, nocardia, no actinomyces and nocardia. Now, if you see here, the difference main, it can be this or this. So it is causing, first of all, the clinical symptom here. This one. This is they have the picture was not given. They might give this also. This is a typical mycetoma. This is a typical mycetoma. You can see there is a exactly swelling plus discharge is there. Swelling plus discharge is there. Okay. Agnomesis. Now, these two are given. Now, we have to identify which is exactly. I'm going to write now. Actinomyces is an anaerobe. If you remember the shortcut, I always say, remember anaerobe cab. Cab has no oxygen. C for Clostridium, A for actinomyces, this one, and B for bacteroid is not Bacillus anthrax. Bacillus is a pure oxygen. Okay, this is the thing. What about nocardia? Nocardia is aerobe. So how to remember, sir? Very simple. Nocardia is our Nora Fateh. Nora Fateh, you know, everybody know the actress Nora Fateh, the best dancer. She likes pure oxygen. She can't live in an anaerobic environment. She lives in a pure oxygen environment. So she's aerobe. Second one, she is super fast dancer. You look at her dance, she can do beautiful dance. So she's fast, acid fast. How simple it is. Everybody in this world, they want Nora. Everybody wants Nora as a girlfriend. So everybody put what? They put bait on her. They put bait on her, right? Nora gets baited. So what is that bait? Paraffin bait. See how easy you made. No. This become very easy. Even lifelong until you become big surgeon or whatever, medicine, cardio, you will not forget Nora Fateh. You will not forget no cardia. Only these three are the golden points for no cardia. So that means everything is opposite here. So this is not acid fast. There is no paraffin bait. Instead, it causes some other, we have other, it's a spidery colony, molar tooth colony, spidery appearance. I'll write, okay, I can write splendor. There's something called splendor, Hopley phenomena, and there's spidery colony, molar tooth colony. Those things and all, I'm not going to stress too much on that. No, you will not expect that much thing. So basically, they have mycetoma. Mycetomas, basically, they have a granules called sulfur granules. You have, if you see here, there's a sulfur granule, and inside the sulfur granule, you will see the bacteria will be there. Either actinomyces anaerobe. So now let's see. So because the word anaerobe is already given, so I am thinking what? Actinomyces. So my diagnosis is actinomyces because not Nora Fateh, not nocardia. I'm going to think only actinomyces because this cab A for anaerobe, actinomyces. I got it. Very simple. Now what is the answer? The sulfur granules with organism is cat. Of course, yes. There's very cat. This discharge will be there. You will have granules. Right. Is a type of mycetoma? Absolutely. This is a mycetoma. This is a type of mycetoma. Okay. We have mycetoma caused by fungus also. That's called eumycetoma. This is bacteria actinomycetoma. They will talk in fungi about that. Now, acid first is negative. Definitely it's negative because positive for Nora Fateh took it. Paraffin bait is positive? No. So whenever the word bait comes, you are baiting only neuropathy, not actinomyces. Baiting neuropathy, nocardia. So your answer is D, 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 D. Very simple. Expect this question. Please, please, please don't forget this. You will have one question for here. Sure. Guaranteed question. Okay. So I mean, if you don't get, don't fight with me. But these are the questions. Accordingly, examiners love to give these questions. So just learn these things. Okay. Whatever, if you missed also, no problem. It's all like a revision only for you now. Okay. Now look at this next beautiful question. A splenectomized patient developed pneumonia. Okay, what's the most likely constitution? So very, very simple, not to think too much. Whenever there's a splenectomy, which type of splenectomy, which are the bacteria you have to think commonly, which is the problem? There is increased risk of capsulated bacteria. Capsule bacteria risk is very, very high. Okay, so you already got the answer here. Yes, spore bearer, non-encapsulated, gram-negative. No, no, no. The answer is capsulated bacteria only. So in capsulated bacteria, if you remember, there are many capsulated, but three bacteria is very, very important. I call them as shin bacteria. They're best buddies. SHIN, shin bacteria. What is this shin? Yes, for your Streptococcus pneumoniae. H for Haemophilus influenzae. N for Neisseria meningitis, Neisseria meningitis or meningococcus meningitis. Okay, so they are the shin capsulated bacteria. That's what in splenectomy this vaccination is recommended. Especially Streptococcus pneumoniae is must in a splenectomy patient. That they'll ask. Even in sickle cell anemia, which vaccine recommended? Because there's also splenectomy is there. So this is one thing. Okay, just remember. So splenectomy patient pneumonia is there. So which are more likely encapsulated. In encapsulated, which bacteria? These are the three bacteria. If you get these bacteria, don't forget they're capsulated. Okay, that's all. That's only the only point you remember. Okay. Now another beautiful question. Recently, it's coming again. This bacteria, which is quite. It was they forgot. I thought examiners forgot about this bacteria. Now it started coming in AIMS and Neet. They all started asking this question also. So what is this question? An alcoholic patient. An alcoholic patient. He has a cough. Sputum with red currant jelly sputum, and the culture, there was a mucoid colony, also can be a question. Lactose fermented mucoid colony. Every clue is given. On the gram stain, a capsulated gram negative, everything they've given like a chocolate. They opened the cover and everything, and they're just telling you to eat the chocolate. That much easy question is this. So you have a capsulated, there's a capsulated bacteria, everything has come. Fine, fine, fine. Now, what should I think? Alcohol. First of all, if you forget everything, remember one thing. Alcohol patient, where do they go? Let me ask you, alcoholic patient, where they go to drink the alcoholic patient, where they go to drink the alcohol? Of course, they will go to the club. They'll go to club. In club, what do they eat with alcohol? They need something to eat. No, say they eat the fried items, fried things. They eat the fried items. Not only fried items. Sometimes they're crazy. They like to have what? Jelly. They like to have jelly also to eat with the jelly. That's all. These three things you must know. Okay. So now, why did I say club? Why did I say, when I say club, I mean to say it is Klebsiella. Klebsiella. Okay. Klebsiella. Okay. Number one. Fried item, because this is also called as fried landers, basically like fried landers pneumonia also they call. So fried item means alcohol. The word alcohol comes, you remember the Klebsiella, remember the fried item, fried landers pneumonia. I remember jelly because you have a severe pneumonia with current jelly sputum. Current jelly sputum. And remember, it is one of the capsulated. Klebsiella is one of the capsulated bacteria. That's what the colony is mucoid, because it is capsulated. Capsulated. Okay, capsulated. So in this stain, you can see around the bacteria, there is this like this capsulated. Ideally, if you remember for capsule, first capsule use negative staining. We do negative stain. Negative stain means we are talking about India ink and nigrosin. Nigrosin. Okay, nigrosin. But here, that's a big list. The shortcut is, some pretty nice killers have capsule bacteria capsule, that is no need that much deeper and all. Now for us important is club. Every clue is there, so my answer should be Klebsiella pneumoniae. That's all. Equally other things and all out of the thing, not at all into it. Okay, that's all. That's all. That's all. Now next question. This is, please mark this question. Would always, you will have one question from this bacteria. You will tell me now what is this. A person, this person, he is working with the abattoir. A person is working with the abattoir. Abattoir means animal. You relate with anything related with the animal. Animal skin. Person who works with the animal skin are called abattoirs. Okay, don't forget. In exam, don't get confused. Okay, abattoir, animals. And he got a papule in his hand. He was getting a papule. He got a papule in his hand. This is the papule he got. And then which turned out to be an ulcer. Unfortunately, turned out to be an ulcer. So what is the which test will help you? See, animal skin. When I have animal skin or anything, the first thing that would click my mind is something zoonotic disease. Okay. And it was a papular ulcer. This ulcer is basically, if you remember, what is it? It is a malignant pustule. We call it as malignant pustule. Malignant pustule, painless malignant pustule, which is also called eschar. Eschar also seen in scrub typhus and this thing. But please remember, two disease cause this. They are, one is your Bacillus anthracis. Other one is your scrub typhus. You can see eschar, same thing. You can see scrub. I'm sorry. Other one is your scrub typhus. Two things, okay? I don't know, it will be visible. No problem. Bacillus anthrax and scrub typhus or SR. Okay. Now, what to do? Now about the Bacillus anthrax. Now, let's go to Bacillus anthrax. Now, wow, look at this beautiful girl here. And for South Indian, they know this girl. I don't know about North Indian friends. They know this girl. This is Andrea Jeremiah. This is a popular actress, Andrea. Andrea. Okay. She is Andrea because anthrax. Okay. Andrea, anthrax. Somehow you have to make a link because see, look what she's wearing all the leather, animal leather, she's wearing all the animal leather and beautiful girl. Look at her beautiful hair. Can you see something? Because that's a beautiful medusa hair she has, medusa head, medusa head she has, beautiful medusa head. Look at her beautiful pearls. She's wearing such a beautiful pearls. I love her pearls, pearls like necklace she's having, beautiful. And then one hand she is holding this beautiful, what she's holding? A beautiful bamboo. She's holding a beautiful bamboo tree, bamboo tree. And other hand, look at, she's holding an inverted fir tree. I think I should use green color here. She's having a, she's having a Christmas tree or inverted fir tree. Okay, so bamboo, this is inverted fir tree. Very easy. That's all. Your whole anthrax is over. And who's this cool guy? This cool guy is our Maddie. Maddie, our Madhavan Maddie. And he is a pilot. He is a pilot. Okay. P-I-L-O-T, pilot. Okay. Let's see. Okay. This story is fine. Sir, what do you want to tell? Why are you bringing all these things here now? Yes, there is everything here is one question, 100% guaranteed question. So this is your Medusa head colony. Why did I say this one? Because this is the Medusa head colony. The direct questions immediately Bacillus anthrax show to mark. Remember Andrea anthrax and mark everything. Okay. And look at this. This is a pearl-like reaction. Pearl-like colonies. Pearl-like colonies. Beautiful pearl-like colonies you have. Okay. Next, look at this. This is your beautiful what car? This is your you can see this is the alter. This is the McFadden's reaction. McFadden reaction. Why, sir? What is this McFadden reaction? This you have to know. McFadden reaction. All the Bacillus anthraxes, they have all the capsule made of polysaccharide. But here, the capsule of Andrea is made up of amino acid. That means anthrax amino acid. A for anthrax amino acid. That means it is made up of polypeptide. Remember, only very important question, only your anthrax has amino acid, that is polypeptide. That's what we do, this special thing. What you do in McFadden, you add methylene blue. You add methylene blue dye. You add methylene blue dye and you see the capsule, purple color capsule you get. That's it. That's all. That is the McFadden, purple color. Okay. Now this is the inverted fir tree. You can see inverted fir tree. So that's all, no? Yes. So you got everything. And this is your bamboo. Bamboo shoot appearance, a bamboo tree appearance, bamboo tree, bamboo shoot appearance. This is on gram stain you'll get because of the spores inside. Okay. Now let's go to the question. So we told which is correct. So which of the will best help in diagnosis? So it means I am thinking about Bacillus anthrax. So my option here is Bacillus anthrax. Bacillus anthrax has a capsule which is polypeptide. Polypeptide. That means it is amino acid. A for anthrax, A for amino acid. I'm repeating again and again because you can't make mistake in this question. It will affect you, okay? Because some students are smart. Some students will stand in that 148, 149 after 150. That shouldn't happen. That's what I'm saying. It's okay. Very easy. So when polypeptide amino acid comes for this special stain is Maddie. Anthrax boy ex-boyfriend is Maddie, our Maddie. So you do McFadden reaction. McFadden reaction, you're using which one? Methylene blue. This is what I'm saying, repeating. Instead of giving McFadden, they will give you just trichromethylene blue, McFadden's reaction. So McFadden, Maddie is for Andrea. Andrea means anthrax. Okay. So your capsule is stained purple color. That's it. Rest all are wrong. Carbofuction for TB, acid fasting. Calcofluor white is for fungi. It's for fungus. Acid fasting again is the same thing. Carbofuction, acid fasting. That's a very very simple and easy. Please don't make mistake and come. Okay, it will become a big problem for you guys. Okay, such all. Now let's go to next question. Another question, another beautiful question here. I like it. Once again, I'm coming. Let me put this. So look at this one. Here, elderly male. Okay, an elderly male presented with a fever. Yes, an elderly male was presented with a fever, chest pain, dry cough, and sputum showed growth in the, excuse me, charcoal yeast extract medium. Charcoal yeast extract medium. Okay, something, this patient is something, but okay, these are comedy pictures down. Don't see that one. You see only this. There is one clue, only one clue. That is your charcoal yeast extract medium. Only, there is the only place where charcoal media is used. Rest all very rare. Okay, this bacteria you should know. So I always say that this is actually buffered. This is actually, it's called buffered charcoal yeast extract, basically called BCOE. That is, it sounds, BCOE sounds like a bicycle. So whenever the word bicycle, or whenever the girl sees charcoal, they're burning the charcoal fire, who is the person you're going to think? You're going to think about the military people. You have to think about military people. Military people is otherwise called legions. Remember, legions. So this bicycle, BYC media, charcoal is that the same thing. Only when this thing comes, you think about legionella. Legionella. There's one more question to come, because the legionella, this apart from cough and everything, you will have, patient will have diarrhea also. Diarrhea, hyponatremia. These words come, hyponatremia, diarrhea, these type of things comes only to our poor soldiers, because they live in what, broken AC cooler. The word has AC cooler comes when there's a broken, their contamination of legionella is very high. That's what they get. What is Pontiac fever or Legionnaires disease or Pontiac. Legionnaires, the name itself has its easy, Legionnaires disease. So these are for Legionella. Very simple. Okay. Don't forget bicycle. Don't forget the see, in Kashmir, of course, the army is very cold. So they need to put charcoal fire. No, so charcoal for legions. Or they have to do bicycle. They usually provide bicycle for them for exercise. Okay, that's all. Remember like that. Legions. So very, very simple. We got it. Now our next question is all out of us. I told you there will not be a question without typhus. You will always have one question related to typhus. Yes, that's what I added this question. So true about the relation to scrub typhus, except they said except what it was. See, scrub typhus, once again, yeah, when you talk of scrub, then we have to better see all the typhus. It's better not to mix anything. Okay, so typhus, when you see, we have two epidemic typhus. I'm going very quickly. Okay, I'm going very quickly, guys. This is like a revision. You have epidemic typhus, you have endemic typhus. Epidemic typhus, endemic typhus. Epidemic typhus, endemic typhus. Then you have a scrub typhus. Scrub typhus. Okay, this is on one hand. On the other hand, you don't forget, we have this Rocky Mountain fever, and we have Indian typhus. And also one more typhus which is caused by or Rickettsia akari. Okay, so all right, the epidemic typhus is caused by which bacteria? You know that Rickettsia pravasaki. This one is caused by Rickettsia typhi. Endemic is typhi. Scrub, you know, Rickettsia susuga mushi. Susuga mushi. There is S also here. You can remember that. Susuga mushi. And Rocky Mountain fever is caused by Rickettsia. On the mountain, you call Rickettsia. On top of the mountain, you go and say Rickettsia. And India means my hometown, Konori. No, so Rickettsia Konori. Rickettsia Konori. Kunnur is my place, my home, near to my hometown. So it's in India. It's in India only. And Akari is a kari because this is again, it's caused one of the spotted typhus. Not that important. Okay. Yes. Now, everything, first of all, you should know the vector is very, very important. Vector, how to remember such confusing. Anything epidemic is a big level. See, epidemics all over, no, some of all over the world. So whole country. So if everybody in the hair, what they have, most of them have what they have a lice, louse. So just louse. Anything, if it's not only for epidemic typhus, even for epidemic relapsing fever also, which caused by Borrelia recurrens. Anything epidemic, you think about louse. Endemic, what are you going to think? When it's endemic, you don't think too much. Endemic is like our You're going to think about what? You're going to think about the mites. Okay, it's caused by the mites. What about Sushukamushi? Sushukamushi, it is caused by our, it's caused by which one? It is caused by, this is the most important, that is your, it is called larva of the sugar mite, but that is the larva stage. Okay, larva stage. This is the larva stage. Don't forget, it's the larva stage. Okay, this made by the, this is coming from the larva stage of the sugar. That's called especially this thing. Mites called larva stage. That's important. Okay, not the adult one mite. That's going to be question. And Rocky Mountain fever again. Rocky is in mountain, so mountain will always you have to take your watch. Tick tick tick. Konori also. Konori is in my hometown. There is a, if you come to Kunur, there is a big watch tower. Tick, 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 it says. Akari, of course, Akari will be, it is going, might. It's caused by might. Okay, not much. Okay, not that important question. Now, about, wheel-Felix reaction. Now, when we talk the wheel-Felix reaction, that is, you're using the, in wheel-Felix is a type of, wheel-Felix very well, you guys know it. It's a, you're using protease to detect the antigen. Okay, antibody you're detecting using the OX19, 2 and K. So now what happened in epidemic typhus and just to only OX19 is positive, OX19 is positive. In scrub typhus, OXK is positive. K is scrub, no? I can write scrub as K. So K positive. Easy. Okay. What about these things? In these two, your OX19 and OX2 also positive, positive. 2, 2, 2, 2. Okay. Tick a 2, 2. Might nothing. Might does nothing. Poor might does nothing, nothing, nothing. 0, 0, 0, 0, 0, 0. So now let's go to here. Look at this one. Scrub typhus on wheel Felix OXK is positive. Absolutely. Just now we spoke. Scrub K, so it's only one positive. So I am very happy. It's okay, positive. Tetracycline is drug of choice. Of course, yes. For all of these rickettsia diseases and all, those it is tetracycline only. Nothing else. All this type of rare disease coming, all tetracycline only. Okay. Transmitted by adult mite. Yes, that will be a problem. It's not adult mite. It's a larva stage of the mite. That is sugar. That's what the disease is also called as sugarosis. Scrub typhus is also called sugarosis. Okay. Is caused by susu? Yes. Scrub typhus is susu. Yes, yes, no. Yes, yes is there. So susu. That's all. Okay. So now the wrong answer is adult mite. It should be a larva stage. Finished. Okay. And we have revised the whole rickettsia. This is all with rickettsia family, typhus family. We finished. This much you know. Easily you'll get one mark from here up. I'm going to guarantee you. One question is from here. Sure. Pakka. So please be careful with this question. Okay. Again, if you don't get, don't blame me. But I expect this question very from the past 4-5 years. I'm seeing these are a few. There's a pattern. They're asking the same question repeatedly. Okay. Excuse me a second. You can read the question once here. Look at this, another beautiful question. Here the question is, all are true regarding donovanosis. Donovanosis except. So now donovanosis, I always say very good donovanosis. Okay, first of all, Donan as a STD disease. Poor Donan. I'll somewhere write it here. Let me read it. Donan, the Donan. This is not Leishmania donovani, the parasite one. This is just donovanosis. Donan, this guy, he got STD. Poor him, he got a STD. Painless, it's not that painful. He got STD. And what he likes? He likes beef. He loves to have beef. He likes beef so much. And his favorite, who's his favorite person is grandma. Grandma is his favorite grandma. Okay, his favorite person. Second one, so cheap guy, he buys pin to his wife. He gives always give pin to his wife. Can you believe that? Okay, that's it. These are the things. Now, let's go to the question. Here, the causative agent is Klebsiella granulomatis. Definitely, yes. When I say Donan, why did I say the word grandma? Because it is caused by Klebsiella granulomatis. Grandma. He likes his grandma so much because STD, there are confusing things are there. We'll talk about it in a while now. Yes. Painful beefy ulcer. Oh, beefy ulcer is right. It's painful. Is it painful? Yes, that's the question. So let's wait here. Safety pin appearance? Definitely, yes. I told Donan he's a nice guy. He gives beef to, he gives beef and pin to his wife. Okay, fine. Syphilis can concomitantly occur with, yes. Normally, most of the STDs, they don't come single, combination only, combo. Syphilis and your herpes simplex or different, they can come. They can happen, not always, but it can happen. Okay, right. Now, what about painful? That is the wrong answer. Okay, now you got it. So, Donan is easy. Now, when you talk about this one, genital ulcer, you know this again and again. I'm repeating here. When you talk about genital ulcer, STD genital ulcer, you have to think two things. What are they? One is a pain. Other one is no pain. Pain and no pain. Yeah. Before that. See, this is the thing I want to say. This is the beefy ulcer. So this is a beefy. It looks like this red color. And this is a safety pin. Safety pin, you see, safety pin. How it looks, safety pin like this is. Okay. So when you talk about pain, you know, what is the pain? What is the pain? The painful ulcer? Only two. One is your herpes simplex virus 2. Other one is your Haemophilus ducrei. Is your REY, ducrei. There the word cry is there, means you know it's painful. That's what they are crying, right? And then herpes simplex virus, you know, 2 means it is always painful. No pain, you will think about syphilis. Your this one, donovanosis. Other one is your lymphogranuloma venereum. Lymphogranuloma, that is the genital elephantiasis. So in these three diseases, syphilis, though already the name is there, less is there. And Donan is also soft guy. He's a soft guy. It's a soft guy, soft donor, so no pain. He also has no pain at all. Okay. And LGV, only lymph node will be painful, not the ulcer, lymph node. Lymph node is painful. L for L, lymph node. Otherwise, that's also painless only. Okay, category. So this is the clue. Shortly, okay, you must have read this very well in your derma also, but then remember, only two are painful, rest are non-painful. But in lymphogranuloma venereum, one exception, because L, it starts with L, so lymph node is painful. That's all. Very, very simple. You got it? Very, very easy. So you're not, these are chocolatey questions. You can't make mistake in this chocolate question. Okay. I know you guys may saying, sir, everything is chocolate for you. No, I'm just kidding. So this is the way you're going to remember, and you will not forget. I guarantee you. 1 or 2 times you go through and you'll take the PDF also, I'll give you, revise and go. Micro will be easy. Okay. At least for micro point, I can give you guarantee. Okay. Now next one. All are true about the leptospirosis. Now look at this leptospirosis. Now here, leptospirosis, except, okay. Okay, now before going to leptospirosis, let's make a small story and then we go. Then it'll be more easier for you guys to solve the question. Whenever I say leptospirosis, in leptospirosis happen in which places, you know. The leptospirosis usually common in which places? Wherever there is rain, rice field, and rodents. Rodent means rats. A lot of rodents will be there. So in this place. So once there was severe rain, rice field, everything was affected. Then you know which guy came? Matt. This guy came. Matt Damon. If you remember Matt Damon, the actor from America, he came. He came and what he did this guy? This guy was so kind. He gave them all umbrella. Helped them, and he told them he wanted to take them back to his country, to America, comes to South Korea. Okay. So what he did is he flied everyone in Emirates flight to where? To Korea. He took them to South Korea. No, good Korea, not North Korea, South Korea. Okay. Why this flight did umbrella? Why did it say Matt? Because, okay, Matt, because Matt is which test? Microscopic agglutination test. Please remember, microscopic agglutination test. Okay, very important question, repeatedly asked, only for your leptospira. Leptospira kits were helped by our Matt. Look at this guy. This is our Matt. This is a beautiful Matt. He was helping all the people. See, in the flood, he was helping them and taking them. So umbrella, because this is one of the spirochetes with J-shaped handle. J-shaped handle or umbrella handle you call. J-shaped or umbrella handle. Okay, and this is spirochetes. This why? Because the media name is Flight because Fletchet, Emirates because EMJH Media, K because Korea because Kortov's Media. Very simple. Okay, very, very simple. He was helping, such a good guy. Now let's come to a question. And of course, leptospira, you have P, so the drug of choice is penicillin. Okay. Okay, now let's go. Penicillin is drug of choice? Yes, but if you don't also, you can solve one by one. Okay, now we know it, penicillin. Urine and feces is F, exactly, because this rodent's urine, they will go into the patient's, you know, when the patient walk in barefoot, any wound is there, it will enter inside. Either it's feces or it's urine, it goes. That's the reason. Okay. So that's also right answer. What about cat is right? No, that's what we told Matt. Matt is helping, not the cat is helping leptospira. Matt is helping leptospira. So this is my wrong answer. Okay, I'll come where cat is used. EMGH, I just told you. EMGH is the flight they're using. You have to, this media looks very crazy, but it's easy to remember. Fly Emirates to Korea, Kortovs. Okay, that's all. Now, these are the medias, culture medias. Now, when you say cat, you know who likes cat? Our Diana, Mycoplasma. Why did I say Diana? Because you know that there is something called Diane's method, Diana. So everything in Mycoplasma is about Diana. Diana's favorite animal is cat, and she likes to eat an agent, and she's a people person. So PPLO agar or PPLO agent, everything was a question. And other thing is there is no cell wall, there's cholesterol. That's what her skin is gliding. Diana's skin is gliding motility, Mycoplasma. Don't forget. And also we call this walking pneumonia. She loves to walk. Diana loves to walk. Walking pneumonia. And also one more thing. What did we forget? She loves to eat egg, fried egg. Remember fried egg colonies? Exactly. One question from there. Pakka, I already discussed mycoplasma now. So you are going to shine in that question, not make any mistake. Okay. I'm sure you already know that, but just next revision. Okay. Got it. That's all. We've done. Now let's go to another bacteria. This is another very interesting bacteria. Look at this one. Even I love this question. If this question comes, so happy. So look at this. Yeah, the bacteria that is used in control for autoclave. Whenever you say autoclave, so you have, this is no excuse. You have to know that this is means when this one is coming, when you have this autoclave, you're, excuse me, so change the color. Okay, so whenever you say the word autoclave, the bacteria which is coming to mind is Stereothermophilus, Bacillus, or Geobacillus, or Bacillus doesn't matter, Thermophilus. So this one can handle high temperature. It can handle more than 55 degrees Celsius. That's very heat resistant. So what is this bacteria is called? This bacteria is called thermophilic. See, indirectly they asked question. Thermophilic. So mesophile is the most bacteria. The most bacteria, they live survive at so around 22 degree to around 40-45 degrees Celsius or 50 degrees Celsius. Okay. Cryome is less than 22. Size. Cryome is less than 20 degree or 22 degrees Celsius. Cryos goes in minus. That's not used. So that's it. So thermophile, best to say thermo comes. This is all medically important. This is all medically important. This is all medically important. Bacteria come under mesophilic. They come under mesophilic. That's all. Very, very simple, right? So that's what I'm saying. You have to know like this way. So you'll not make any mistake. Okay, that's all. Now, next question. All true about Yersinia pestis exam. So Yersinia pestis, again, repeated question, expected question, and people usually forget and go without revising Yersinia pestis, but that is the most easy. Whenever the word Yersinia pestis comes, what comes to your mind? For me, I remember ghee. I remember delicious ghee. Yersinia pestis comes, I remember beautiful ghee, and I remember there is this ice cubes in front of my house in winter. The ice just falls down. If you're an FMG student in Russia or Armenia, wherever, you can see that lot of snow is just hanging in the morning from your roof. These are the two things always comes in my senior pestis. Yes. So what I'm going to say is, that first of all, few things about this disease to talk. Yersinia pestis is the one which causes the plague. I'm sorry. So it causes the plague, and it's transmitted by which one? Rat flea. So plague, rat flea, black. That is whenever this plague comes. It is usually we have the most common one is bubonic. Which can be bubonic plague, bubonic, septicemic. The dangerous one is septicemic. Yeah, dangerous one. Common one is bubonic. Okay, fine. Now another important thing is to grow this one to the Yersinia pestis. Yersinia pestis. The best culture is what? Broth. We use the ghee broth. And then what you see in ghee broth, you will see stalactite growth. Stalactite growth. Okay, this is our thing, we know. But how to remember, sir? Yes, remember this guy, his name is Vason. Vason is having a ghee stall. He's having a ghee stall, but unfortunately, he died with the plague. He died with plague because plague was also called as what? Black Death. You remember? It's also called as Black Death. Okay, so you died with plague. Why did I say Vason? This is the special stain. That's the question. You have a special stain. It's called Vason. This guy is Vason, so he's a special stain. Ghee broth because it grows only in the ghee, and stall because you have stalactite growth. You have this stalactite growth. Okay, ghee broth, stalactite growth. You have to remember, any means put in your mind. This is the only question they'll ask you. Ghee broth, stalactite growth. Direct question, stalactite growth is seen in stall. Then you have to think, stall, I've listened somewhere, Dr. Santosh was saying stall. Who is having Vason? Yeah, yes, Vason. But how did he die? He died with pest, Yersinia pestis, which caused him black death. That is plague. He got a plague, Yersinia pestis. That's all. Very, very simple. Okay. This is the way I will be coming in your mind in your FMG exam. Okay. That's all. So remember, so you got this right. This is exactly how it looks. You see, now this is a ghee you inserted, and after that you see they're hanging like this. Like this. See, exactly like this. It's hanging like this. So this is the one which we called as a stalactite growth. Stalactite growth. Okay, that's it. If this picture comes easily, you can. It looks like an inverted fir tree appearance, which we saw. What? Who is carrying? Bacillus anthrax. Our Andrea anthrax is carrying, and another one is here. Stalactite growth. Also, it looks like something hanging down. Okay, so Excuse me, however you want, you can remember. Okay. Yeah, and of course, drug of choice is streptomycin and doxycycline you can give, but I'm not going to stress that here now. You can add it later. Okay, now sample with this another very, very important question. You guys must have seen 1,000 times. You must have revised this, and I hope now you'll not make any mistake here. So look at this. A sample of blood is found to be very infective in typhoid during which? Okay, this is basically very simple question only. What they asked us in typhoid fever, that means in during the typhoid very infective period, so that means sort of they're asking the diagnostic part only in typhoid, it's caused by salmonella typhi, you know that salmonella Salmonella got typhoid fever, you know that is that. Yeah, I know everybody knows, even some students who are finding difficulty in micro, it's okay, don't need to worry. This is Salmonella has a typhoid fever. So he, what happened, whenever he gets typhoid fever, he goes to this doctor named Basu is his favorite doctor. And Basu, what does he do? At till first week he does some test, till second week he does some test, and third and fourth week, and in third and fourth week he does some test. So when you talk about this, at first week it is the blood culture, okay, blood culture, because it will be in the blood till first week. This is all till, okay, I add the word till. Okay, second week, A for B for blood, A for antibody detection, that is basically we're talking about Vidal test. And S and U, stool and urine culture. This is the test. Okay, now we're going to detail. So this you have to remember, for Basu, never forget it. Okay, so now here they said very infective means it should be in the blood. So just till first week. So your answer is first week. Indirectly they have asked. Okay, indirectly nothing, but they have to indirectly. That's all. Okay, this much only for salmonella. Okay, nothing much to stress. This is salmonella and all the things. And other things, what if you remember in salmonella, you know that if indirectly they ask, it's a fever. So whatever fever they have, step ladder fever. Okay, step ladder fever number one. And then you know there's a rose spot, and there is relative bradycardia, rose spot, relative bradycardia. Okay, did we miss something? Yes, pea soup diarrhea. They usually don't have diarrhea. Please remember, typhoid fever, there is no diarrhea. Your salmonella enteritis can cause food poisoning, but not salmonella typhi or paratyphi, never cause diarrhea. But if they cause, it would be more like a pea soup diarrhea. Rice water is for your Vibrio. Viba likes rice water. Sorry, she doesn't drink rice water, diarrhea, rice water. But pea soup diarrhea is basically for your Salman ji. Salman Khan's favorite is pea soup, right? That's what is very strong. Okay, pea soup diarrhea. So like this only, I know you remember the exam. The problem is you are thorough now. I know you revised 3 or 4 times, very good. But when you sit in the exam, these are the subjects. These are subjects, non-killing subjects are the one that causes you crazy. You will get confused. It is Salmonella or Shigella. It is Escherichia coli or Klebsiella. It is Staphylococcus or Streptococcus. This confusion, or Proteus or Pseudomonas. That's what I'm making it in this way to remember it easily. Okay, that's all. Yes. Now the next question. Wow, wow, wow. This question, please, 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 without knowing this question, don't enter your examination hall. Okay. Don't means don't. Okay. Okay. Now look at this beautiful question here. It says the child was admitted with hematuria, thrombocytopenia, bloody diarrhea. Bloody diarrhea. Okay. The thrombocytopenia, bloody diarrhea. Okay. Somewhat, it looks very this thing. So what does this mean? So here the child was admitted with the hematuria, thrombocytopenia, bloody diarrhea. It's a correct pathogen. So it means something serious. Okay, there's a bloody diarrhea or dysentery. There's a dysentery, and then after that, what happened? The patient already getting the hematuria. Why hematuria? Because the patient got complication. What? Rat. What is a rat here? Rat for RBC. So A for anemia. Okay, wait, I'm going to write it here. Anemia, this is basically hemolytic anemia. R already goes renal problem, renal failure. T for thrombocytopenia. This is the characteristic thrombocytopenia. Because of hemolytic anemia, there is hematuria and renal problem is there. So this is characteristic for which something which is hemorrhagic. So most common cause of this symptom, bloody diarrhea, this should be our EHEC, enterohemorrhagic E. coli. And the next one is Shigella. If you don't have enterohemorrhagic, then you go for Shigella. This is the most dangerous one, which is causing bloody diarrhea or bloody dysentery. So I'm going to choose EHEAC. But now that means then there are other there are other types of E. coli. Don't forget. So what are they? You have ETs. We'll go quick revision. Very important. One definite question from here. So you should know this. Enteropathogenic E. coli and enterotoxic pathogenic, and then what we have entero-invasive E. coli, and then this is the EHEC we just spoke, and then next one is your entero-aggressive E. coli. So what one word for everything. Okay, T, it's a toxigenic. T is toxigenic. So it is for traveler's diarrhea, which causes traveler's diarrhea. Remember, traveler's diarrhea, which is more like a cholera diarrhea. It's like a Vibrio cholera. It's like a cholera diarrhea, not that much dangerous. Okay, it's profuse diarrhea, no inflammatory anything. Okay, so traveler's diarrhea. P for PEPs is the one causing pediatric cases, pediatric diarrhea, diarrhea. So it is children's. Children, you have a question on this also. Question easily, many times repeated. Many, you can see, you open your previous Fmge and see so many questions came. Entero-invasive is basically somehow it is very much like a shigellosis. It's like a shigellosis, but the here only thing is that this there's something called VME, vanillyl mandelic acid, and positive. Vanillyl mandelic acid is a mechanism, that's a toxin which is like this, and then it is also called serine test positive. Serine positive. Okay, serine is positive. Serine is invasive. Invasive. I is invasive. Serine. It's also a little bit dangerous one, but somehow not as dangerous as EHEC. Excuse me for my eyes. Yeah, enteroaggressive is something which forms a it forms like a aggregative brick formation. Brick formation in the intestine, they all aggregate together and form a brick-like appearance like this. That is it. That's all only. Okay. So this thing. And of course, this is the last one is your EHEC, which we already spoke. EHEC1. This is the one which is spoke here. Okay. The most dangerous one. This is the most dangerous one. Most dangerous. Because the toxin is like Shiga toxin. It's like a Shiga toxin. So they can ask you anything they can ask. So if they ask, remember EHA. H means hemorrhage. Anything hemorrhage is dangerous. So that's what we're taking this. Okay, very simple. So see, finish this also now. Okay, very, very simple. Now, next question. Oh, yes. Now, this is another very gentle, this is almost more very general microbiology question topic, but you have to know no other option. Which of the following is not an antibiotic sensitive testing? You know the antibiotic sensitive because antibiotic is first, after what we do in microbiology, when culture is done, bacteria is identified, we have to choose the sensitivity, which drug is sensitive, which is resistant, or which is intermediate. We have to check. So what are the methods for that? Here, this is nothing to apply. You would have seen in your lab, microbiology lab frequently. This is most commonly used. Most commonly, that is the Kirby-Boyer disk diffusion method. It is right, this one. And this is an E-test. We call E-test, or it's a type of agar daily MIC detecting test. MIC detecting based on MIC strips. You know, MIC strip we use, we can detect. So this epsilon shape. No? So E also we call E-test. This is the one, this one. It's right. Agar dilution, yes, we use special this thing. We dilute the we change the concentration of antibiotics in each, diluting it, and then we put the microbe and see which is the last tube where there is no growth, that is considered as the MIC value. Okay, that's one thing. So what about the camp test? Of course, we just spoke. Camp is not for us. Who likes the camp? Our Agartala boy, Agartala boy, Agartala boy. When I say the Agartala boy, it is group B, that is Streptococcus agalactiae. Agartala boy with hippocampus is doing a camping. Reverse camping is done by our Nagarjun. That is Naegler's reaction. That is Clostridium perfringens. Okay, that's it. Camp, reverse camp. This is the way you want to remember. Otherwise, you'll forget. Remember, camp, Agartala boy, boy, B for boy, Agalactiae. And then reverse camp is our Nagarjuna Naegler's. That is Mr. Perfect Clostridium perfringens. Perfect perfringens. That's it. Okay, simple. This is your camp test. This is exact camp test. Okay. So in camp test, what you do, that's what, okay, good that we bought here. Central, you're going to streak the Staph aureus. And in the side one, which you're streaking where you get arrow, this is the positive. That means here, which you streaked is the group B Streptococcus. But in reverse camp, what happened? Instead of Staph aureus, you would be using Clostridium perfringens. That's what it's reverse. Okay, that's all. Very simple. Okay, so this is here, which is not, camp is not. Rest all right. Okay, fine. Next question. Okay, wow, this is another very, 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 very important. I can assure you, write and give you this question from this topic, vaginal discharge. Okay, now let's okay, quickly we'll do a vaginal discharge revision because it's expected question you can't miss, you can't forget. Okay, so now we have vaginal discharge. Some patient coming with a vaginal discharge. So when they have vaginal discharge, you have to think about three bacteria. What are they? First one is your BV. BV, that is bacterial vaginosis. Bacterial vaginosis. BV is bacterial vaginosis. And other one, Candida. Candidiasis, candidal vaginal disease, candidiasis. And the third one is your trichoma, TB, that is trichomonas vaginalis. Trichomonas vaginalis. The beauty is everything is different. Why different? The first one is a bacteria. If you remember, one bacteria and one fungi and one parasite, protozoa. That's protozoa. Beautiful, no? Everything different thing comes here. So now what happened? When I talk about the bacterial vaginosis, you remember BV. BV is very smart. So, bacterial vaginosis. So, how to remember? First of all, the discharge here is thin gray discharge. Gray, thin, grayish, fishy order. In candidiasis, CC. So, it is a cheesy. Cheesy or curdy white discharge. What about trichomonas? Trichomonas vaginalis, I told Trisha likes green veggies. So it is a green color discharge, green discharge. Green discharge, sometimes painful. Okay, sometimes painful, doesn't matter. That's it. And in bacterial vaginosis, if you remember, in bacterial vaginosis, one second, let me just change the color here. Give me a second, I want to change this color. It's not a beautiful color. Yeah. Okay. Fine. So here what happened? Bacterial vaginosis only. The characteristic one, the score which you're using is called Nugent score. And we have Amsler's criteria and okay, let me just cancel this one. Amsler's criteria is the most commonly used criteria. Okay. Amsler's criteria. In Amsler's criteria, very simple. What is that? You will have first of all this discharge. This is number one. Number two, what happened? You use 10. Okay, you use 10% KOH. 10% KOH. If you add, you will get a fishy smell. Second one, remember BV always has a clue. She has a clue her husband is cheating on her. Okay, he's sleeping with another guy. Okay, BV. So clue cell is positive. Another one. And the third one is that we have done everything. pH. You check the pH, it will be more than 4.5. Okay, because in candidiasis, pH will be less than 4.5. This is the only one which is very acidic question. In trichomonas vaginalis, apart from this green, we have strawberry vagina. Okay. And that's a parasite one. That's a parasite, you know, that it looks like single, single. We have a question on that also. We'll talk about later with that. Okay, now let's go to the question. So look at this. So don't forget, clue cell is a question, expected question, clue cell. KOH, fishy order is a question. Everything for your BV. BV, you know, in Hindi, BV means wife. So wife has a clue. Husband is in fishy order. I mean, husband smells a fishy order from the wife. When wife gets a clue that she got it from husband only, and clue cells positive. And pH is more than 4.5. Okay, this much only you should know. It's very simple. Excuse me. You have Amsler's criteria and Nugent's criteria. Nugent's criteria is a Gram's criteria, and this is the causative agent, you know, Gardnerella vaginalis. Gardnerella vaginalis and Mobilingus. This goes high and lactobacillus goes down. Okay, that's much only. I'm not going to stress too much here. So a foul smelling vagina. That's what a female with foul smelling vaginal discharge and whiff test positive. Whiff test, that's what I'm saying. This is the 10% KOH you're adding. This is called whiff test. Okay, fishy order. That's what you get, a fishy order. You add 10% KOH, you get a foul smelling or fishy smell. That's all. Okay. So your answer is bacterial vaginosis. Simple. The rest all candidiasis is here, curdy white. And then if it is a green color discharge, it comes. Then you think about trichomoniasis, gonorrhea. It's a rare. In female, it's not that much this thing. In male, of course, it is painful discharge. Okay, fine. Now, next question. Okay, what is given here? Here, the mother had a again, sorry. Yes. Bring this a bit down here. Yeah. So now here, if you see here, this question, the mother history of painful genital discharge. A year before, she had some genital discharge. Okay, painful genital discharge. So it could be either Ducri or it is herpes simplex. Okay, herpes simplex virus. Now, so anything. So let's say just see, because the common one is always the herpes simplex virus 2. Other one is a H. ducri, but this is most common one. Okay. Now, after let's say 18 days old, her 18 years old developed CNS symptom. Oh, he got a CNS symptom. Chronic sign positive, CSF. Okay, that means he got meningitis. Raised lymphocyte with normal glucose and protein. Okay, you know that very well. I don't have to say this. Okay, very quick revision. So if it is a, first of all, if it's a virus infection, if it is bacteria infection, and if it is a TB or fungi, what will happen? Okay, this is the question, right? Now here, first of all, is the pressure. What about the pressure? CSF pressure we are talking, and then we're talking about the glucose, and then we're talking about the protein, and then we're talking about the cell which is raised. Okay, these are 4 points you should know very, very well. Okay, this is again standard, every year question is there, so please don't make mistake. Yeah. So now what happened to the CS? In virus, everything is beauty. Virus is not at all dangerous. Virus is not at all dangerous. So CSF pressure is normal, but in bacteria, these two increased TB fungi. Glucose normal, protein normal. Okay, everything is normal. Maybe a little bit change. Otherwise, virus is very good. Okay, so the cell is not always. Some are very dangerous viruses we have, including your COVID, HIV, and so many hepatitis B and all. But I'm just saying. Okay, here lymphocytes go high. You know this very well. What about the bacteria? In bacteria eats glucose. So your glucose will go down. Think like that. Bacteria eats glucose, so glucose goes down. And a lot of inflammation. So your inflammatory protein go high. Okay, so same in CSF. Same with TB. Glucose go down, protein go high. Same. But only difference is here you have neutrophils going high, but here lymphocyte. That's it. Okay. So now you see which is fitting in this criteria. Very simple. See, this one question. This is for meningitis. I'm talking about meningitis here. So when this question came, so now here you see glucose and protein is normal. Everything is normal. And only thing is that raised lymphocytes. Sometimes they can give pressure is little bit high or anything, but usually not. It's normal. Okay. My less increased or whatever. Don't worry about it. It's normal. So lymphocyte is high and you already have a clue. It's a virus. So definitely it is your herpes simplex virus 2. That's all. Very, very simple. Right. That's all. So it's not varicose zoster, can cause, but not. So the sheer genital, no. So painful genitalness is a herpes simplex virus only. Ducrey is a bacteria, so that's out. These two, no link. Coxsackie versus zoster, no link. Okay, that's all. That's all. So these are all not chocolatey questions. You're not going to make any mistake for sure. Okay, for all my FMG doctors. Hmm. Next one, a patient with history of trauma. Now, the next question. He had a history of trauma, injured with a rusted metal. Rusted metal has hit him. Then what is the mechanism of spastic paralysis? Rusted metal. What do you think? When there is a metal, all the things which has come is spore, some spore. Spastic here is they've given. They're given spastic. Everything is very clear. It's brief very, very well. You can see very well. It is mentioned very clearly and beautifully. It's mentioned very clearly and beautifully that it is the what? It is your spastic. Everything is a Clostridium tetani. Clostridium tetani. Rusted metal means is it's a Clostridium tetani. So tetani means this is basically trismus. Trismus, this jaw, the face gets a devil's grin. We call devil's grip. Devil's grip, trismus, all these things, all the names will come here only, So this, like this, lockjaw, right? Trismus is basically lockjaw. All these words come for Clostridium tetani. So you have a spasm here, everything goes spastic. Spastic means something strong. That means there's no inhibition, no inhibition. So what is inhibitor? Inhibitory mediators. So inhibitory mediators are GABA and glycine. So inhibition of the inhibitory. These are inhibitory mediators. Inhibitory mediators. So that's what. Okay. So answer is very simple. GABA glycine, which causes spastic paralysis. And don't forget, in children, you call it as opistotonus. Opistotonus. In botulinum, it's called floppy baby syndrome because flaccid. Okay, now inhibition of acetylcholine. This one should be which one? This is your Clostridium botulinum, which inhibits the stimulatory mediator acetylcholine. And inhibitor of EF factor, we already talked about it. Pseudomonas. Other one is your diphtheria. Norepinephrine, nothing is there. Nothing from bacteria, nothing is there. Okay, medicine you can read, but not in here. Okay, that's all. This is the thing, Okay, rusted metal. So this is the injuries because of Clostridium tetani spores only, right? Yes. Fine. Matches the following now. This is another repeated previous some exams. It has come this question. So here you see a patch test. Patch test is more not our test. It's an immunological test. So patch test is your contact dermatitis. KOH means itself, you should know it is KOH means it's for fungi. So which fungi we have? Tinea. So tinea. What about biopsy? Biopsies you do for like disease like lupus vulgaris, etc. So it is lupus vulgaris. Slit skin smear. Slit skin smear is very important. That you do for leprosy. Leprosy you do slit skin smear. So important. Okay. Yeah. And same way, there's a sang smear. You're going to do for which one? for herpes virus, for herpes, both herpes simplex and HSV, and also your HZV, herpes zoster virus also. So you look for which cells? Multinucleated giant cell, MNGC cell, multinucleated giant cell. Okay, so that is for herpes. That can be asked. So slit skin for leprosy. These are two different type of names where for this thing can come. Okay, that's all. Okay, that's easy. I'm not going to go too much there. Now, which of the following is false regarding the lesion? So I am, which is false. The question is which is false. Okay. The picture is given. So before going to the option, I have to think what it is. First of all, what is this? This is a watch. This is a watch, genital watch. Okay, it's a vaginal watch. So it's a genital watch. So genital watch is otherwise called as, what do you call it as? You call it as condyloma, condyloma acuminata. Condyloma acuminata. The same thing if it's condyloma lata, that is for which disease? Syphilis. It is secondary syphilis. Secondary syphilis you see catastically. But condyloma acuminata, which is caused by which one? Your herpes simplex virus is caused by sorry, it is caused by not, I'm sorry, excuse me, HPV, human papilloma virus. Okay, I'm sorry, it's tongue slip. Human papilloma virus. So human papilloma virus, important thing is, you know, the two important group, at least you should know. One is your 6 and 11, and other one is your HPV. HP, which one? Your 16, 18. So 16 and 18, you leave it. That is for cancer, cervical cancer. Everyone knows that. Yeah, most commonly it is for cervical cancer. Cervical cancer, but of course it can cause penile cancer, anal cancer, etc. But cervical cancer most common. HPV is for condylomata, there is condyloma acuminata, and then one more thing is laryngeal papilloma. It causes laryngeal papilloma. Don't forget. Okay, this is the important one I want to say. That's all. Okay. So the causative agent is 6. So now let's go. It's caused by HPV 6 and 11. Absolutely right. And E and 6-7 protein of this virus cause. Exactly. So we talk about cervical cancer. Two important protein we have, if you remember, E6 and E7. E6 actually, so it's a pathology question actually. Okay. E6 inhibits the P53. If you forget also, see, 6 ko you do ulta, it becomes P. So P53. Retinoblastoma 7, this inhibits another one, RB, retinoblastoma gene. So these are the reason for the cancer. These are the reasons for, these are anti-cancer. So if you inhibit these two are inhibited, then it causes cancer. Okay, that you know. Patient have laryngeal papilloma? Yes, patient can have, because I told both these diseases are caused by 6 and 7 only. Okay, 6 and 7. So we have butchers caused by 7, varicular warts in the hands and are caused by HV 1, 2, 3, 4, but most common is this only. Okay. Even Treeman syndrome, 5 and 8 cause Treeman syndrome. I'm not stressing on those things. Molluscum body positive? No, this is wrong. Why? Because your molluscum body is catastically seen for which virus? If you are saying pox virus, then you are right. It's a pox virus. You will see that in your pox. Okay. The cheesy appearance, molluscum contagiosum, molluscum, where you have molluscum body. We also got Henderson-Peterson bodies we call. That's for pox virus. So that's out of this question. Okay, very simple. So expect one from here also, one question from here. Yes, now next. Yeah, look at this. Always one question from nose comes ENT. Basically, it's ENT, but micro-related only they will ask. I've noticed it very time. So, how to remember this? A foul-smelling crust, merciful anosmia, seen, causative agent. So you know that foul-smelling and merciful anosmia, the merciful, you know this merciful. Merciful means patient can't smell. We will smell. Patient can't smell. We can smell. We smell bad thing from his nose. We smell some bad things coming from his nose. That's okay. So now what is this one? So you see, this is very big crust is there. This space, you know, it's very big. It's called roomy. It's also called as roomy space nose. Roomy nose. Okay, roomy nose. So this type of things are coming from something. See, two big space O. No, so something related with O is Oceania. Klebsiella oceanae, very simple. What about rhinoscleromatous? Rhinoscleromatous causes scleroma means it's a hard, no? So hard means woody nose. The word woody nose comes, you think about the rhinoscleromatosis. Okay, very, very simple. Okay, that's easy. Yes, you will get this one. And if you remember, there are two important cells. Don't forget in this one, Miculits and Russell cells. Okay, Russell cells. This is again more patho, but it's okay to know here. Miculits and Russell cells. Okay, Miculits. Yes. Okay, Russell cell. And what about the sea berry? Sea berry is like a berry. You know, Rhinosporidium, sea berry. Spore and sea berry. Somewhat looks like a strawberry. So it's a strawberry nose. So you have a woody nose, strawberry nose. So this is the one. That is basically polyps. This is the hard nose, woody nose. This is your Rhinus chloromatous. So three types of nose. Don't forget woody nose, roomy nose, strawberry nose. Strawberry nose, that's basically polyps. You see it in the, this is the ENT question. Basically ENT related micro question. Expect it. Expect 100% you'll have one question from here. That's what I choose this question. Okay. So you know this hard roomy nose, strawberry nose, woody nose. Very simple. Okay, very easy. You will do it. Okay. Next one. Diabetic patient. Look at this. A diabetic patient with HbA1c 10 only. 10. So it's a diabetic HbA1c is 10. Or not only, it's 10. So it is severe diabetes. Okay. So he's saying excruciating. Okay, okay. I should use this marker. It's better. So diabetic patient, one clue. Excruciating pain in the ear discharge. Pain, severe pain and ear discharge, enough for me. What's the thing I'm going to think? This diabetic patient with this type of thing comes, that disease name is first of all called malignant otitis externa. Otitis externa, you know this one. Malignant otitis externa is coming for our favorite girl, our favorite beautiful girl, that is our Ekta Kapoor. Ekta Kapoor. I'll tell you why. Before going that, so this common autism, because Ekta Kapoor, because first of all, remember everything. In Ekta, very important. She's colorful girl. She's colorful. Ear problem. Ear problem because she pierces his ear. No, she always pierces his ear. So she gets ear problem, and she goes to Shanghai. And then there, when she go to Shanghai, what she get? She got a lot of swimming pool problem. Swimming pool issues she gets. And of course, during the movie, she's always ready. She's always ready in the movie set. She's always ready. Okay. Then anything to add? Yes, whatever comes. Why did I say Ekta Kapoor? Because remember this one, ecthyma gangrenosum. Ecthyma gangrenosum. That is a question. Expect this question. This is caused by your, this one, Pseudomonas. This is the one which you're seeing down. This picture, this is ecthyma gangrenosum. This is the malignant otitis externa, which the disease condition, malignant otitis externa, the present disease, diabetic mellitus patient, this one, okay? And this one is the colorful I told, okay? And why did I say colorful? Because she's colorful because they produce which pigment? They produce green pigment, green, blue color, green, blue pigments they produce. And she's very sweet. Ekta Kapoor is very sweet. So sweetie order, sweetie or fruity. Okay, fruity, sweetie order. It's a fruity order. Okay, no one tastes it. Fruity order. Okay, fruity order. Ear problem because she usually gets swimmers here. And of course, this otitis, malignant otitis externa, Shanghai fever, the fever called Shanghai fever, very similar to your typhoid fever. Swimming pool, she got, that's what, in swimming pool only she gets this, swimmers here, okay, swimmers here she get. And all, anything, blue pus, green nail, anything colorful will be ecthyma gangrenosum. That is Ekta Kapoor, okay, Pseudomonas aeruginosa. So this all are because of this bacteria, Pseudomonas aeruginosa. Okay, aeruginosa. That's what I want to say. Pseudomonas aeruginosa comes. The only girl you have to remember is your Ekta Kapoor. Okay, Ekta Kapoor. So everything is colorful here, pigment, these things always. Why did I say? Because the media name, she's busy in movie set. So cetrimide agar. And what happened in the movie set? She got burned. Suddenly there was a burns, fire, accident, burns. So most common cause of infection in burns patient. Okay, that's what I want to stress. Most common infection, but this is just more than enough. Okay, this if you know it, and of course, Pseudomonas, you know the mechanism. It actually elongation factor 2. So now let's see what is the question they're asking. It shows swarming motility. No, not swarming motility. Which of the following is correct? Swarming motility is characteristic for Proteus. Okay, Proteus. So that's out. Bacitracin sensitivity positive? Of course not. Bacitracin is for, I already stressed, this is for Streptococcus pyogenes. Basi got pus. Grows in cetrimide, that is the right answer. Movie set. If you forget also movie set, Ekta Kapoor is in movie set. Pseudomonas is cetrimide agar because it's disinfectant. The only bacteria which can grow in any disinfectant all means that is only your Pseudomonas. That much powerful. Excuse me. If you go to ortho ward, And if you see ortho surgery, what burns what and ortho what, the moment you enter only, you get this fruity odor comes, and you can simply without diagnosis say that is Pseudomonas, and you see green color pus. Pus will be green color. Okay. Now, pearl-like reaction seen on this. Oops, pearl-like reaction we already spoke. Who is that? Our beautiful Andrea, Bacillus anthracis. See, I don't even have to use anything. I just go on. Okay, that's all. So cetrimide agar is the only option. You're right. Okay, and this again unipolar. This is oxidase positive. One another important test is oxidase. Pseudomonas as oxidase positive also. Like a Vibrio cholera, this is also oxidase positive. Few bacteria can remember. Okay, that's all. Okay, now next one. Now, look at this question. A patient is having fever, lymphadenopathy, rash with history of flea bite. Hey, just a second, 1 second. We missed something here. Once again, when I was talking about rickettsia, I want to make sure, did I write here? Yes, that's what. I was remembering something was missing here. This was the endemic typhus. It's not a mite. I'm sorry. This is actually flea. Okay, flea. Please remember, it's a flea. Okay, flea. Typhi means flea. Endemic means flea only. Flea is in a small area, no endemic. This is mite was for this one day. Okay, for Shusuga Mushi only. That's okay. Okay. I hope it's clear now. Okay, now because you see, that's what I stress. See, I remembered. Sorry, sometimes when this insects always create problems. See, even it caused problem to me. Excuse me. Now look at this. Fever, lymphadenopathy. The patient is having fever. Once again, the patient is having fever, lymphadenopathy, rash. Okay, typical symptoms. Flea bite. So flea bite is a clue because you see here everything can fever, lymphadenopathy, rash can happen in any typhus. It can have epidemic typhus, epidemic, endemic. Anthrax may not that characteristic, but rash is there. So now flea is there. So flea means it's a small area. So it is endemic. So I have to choose endemic area. Please remember this question can be asked, easily asked. If this place, if they've given me, if they given me louse or lice, I would think epidemic typhus. If they given me mite, but larva mite, okay, larva mite, that is shigerosis, I had to scrub typhus. Anthrax, there is no insect. Anthrax is a contact, animal contact. Now you know that cutaneous and the pulmonary contact. Okay, that's all. Okay, so remember, see, typhus may anything they can ask you and confuse you, so don't forget. Okay, yes. Once again to repeat, in Suzuka Musi, you know that it's OX-K positive, but in Laos it is OX-19. Here also OX-19 positive. Okay, positive. Rest all we discussed. Okay, now look at this question. This is also, they will catch you. I was wondering, where is this question? The patient was diagnosed with PSN, post-streptococcal glomerulonephritis. He had a skin lesion which showed following organism. What is the causative agent? Okay, very simple. You know that. Once again, do we have a space to write? Yes, we have a space here. So this is a post-streptococcal glomerulonephritis. You know very, very well about our streptococcus. Which one? Streptococcus. The answer is, it's a Streptococcus pyogenes. You don't even have to see Streptococcus pyogenes, okay? But the small revision, Streptococcus causes two groups of disease. One, it causes, the bacteria itself causes some disease. The bacteria itself causes some disease. And other one is your, which one? Autoimmune disease. You have two important autoimmune disease. Autoimmune disease. Okay, these are the two things important, very, very important. Now, when we talk about the bacteria, okay, now we talk about the bacteria. Itself, what it causes, at least three diseases you must know. One is your erysipelas. Other one is your necrotizing fasciitis. Another one, cellulitis. Cellulitis is, very, very common in diabetic mellitus patient. Like you have to remember that, no other way. Okay, necrotizing erysipelas. Common. These are the three you have to remember. And of course, your scarlet fever. Scarlet fever, the strawberry tongue scarlet fever, right? Scarlet fever. Okay, fine. Autoimmune disease, two diseases. You know very, very well. One is your rheumatic fever. Other one is your post-streptococcal glomerular. I'm not going to talk about rheumatic fever. That is Jones criteria. You know that criteria very, very well. In medicine, you must have made juice and you've drank in this one Jones criteria. You already have a clue there. I'll talk only diagnosis. Here, important is ASLO titer goes high. Okay, diagnostic part. For post-streptococcal glomerulonephritis, yeah, you know that is the one which causes nephritic syndrome or nephritic syndrome. Otherwise, you cola color urine. They have cola color urine, nephritic syndrome. Okay, I'm not going to talk to that's also medicine. But here important is your the diagnostic part, anti-DNase goes high. Okay, this one. This only I want to stress. post-glomerulonephritis. That's this only, nothing else. Okay, so this is a pyogens. So that's all because of pyogens autoimmunities, autoantibodies formed. There, yes, very important. This all cross reactions. So what happened is that the example in I think I shouldn't talk too much about this because cross reactions. No example, the M protein of the Streptococcus pyogens and our myocardium is similar, and the C protein, C carbonate, and the cardiac valve of our body are similar. Okay, that I don't want to go too much, because we are in revision part. Yeah, we can't go every part. No, we can't study every part. Okay, yes. Now look at this. Which of the following is primarily CBNet TrueNet? Okay, this is basically CBNet TrueNet. You know very, very well. This is basically for the TB diagnosis. Okay, primarily identified CBNet. So when you go like that, then I'm going to go to a quick revision of a TB diagnosis. TB diagnosis, TB diagnosis. One is we go to culture method, and other one is your molecular method. Now the molecular is the most popular one. Culture method, again, that it's basically we do conventional LJ media, LJ media, Levenstein Jensen media, egg containing media, or otherwise we go BACTEC, BACTEC or BACT alert are very, very common. Yeah, this is a common. And culture, something called Petrov's method, which was asked recently in another exam. Petrov's method, basically the sputum sample, whenever you get the sputum sample, you have to do two important things. You have to add NaCl, and you have to add, another one is your NALK, NALK, N-acetylcysteine reagent. No, this N-acetylcysteine, which is one of your paracetamol antidote. Same thing, NALK, N-acetylcysteine, right? So what you add, NaCl, sodium hydroxide, you add to kill commensal bacteria. And NALK solution you add, L is there, liquefy the sputum so that you can easily culture it very well. You can make smear very well. Okay. Okay. Kill the commensals. And this is to liquefy the sputum. So that is important. Okay, remember. Now in molecular method only, we have first one we call CBNAT. CBNAT, or it's called gene expert. Okay, so now what happened, we have one is this one, and other one is your LPA, line probe assay. We call it as line probe assay. Two important things, only two things important here. In CBNAT gene expert, only thing what happened, you can diagnose the Mycobacterium TB plus only rifampicin resistance you can detect. In line probe, you detect multiple TB plus most of the drugs, especially first line, definitely is most drug for TB resistance you can detect. Okay, so it's advanced. So here only rifampicin you can check. So that is what CBNAT, a gene expert, you will see Mycobacterium TB and rifampicin resistance. That's all. Simple question. Primary diagnosis means you're going to answer this and Italy. That's all. Okay. So we have done with this. Now next. Yeah. A child present with a fever, neck rigidity, a lumbar puncture was done. Okay, so meningitis. The sugar was decreased, high protein, increased leukocytes with predominant lymphocyte. Chest X-ray showed lung fibrosis and hilar lymphadenopathy, which mostly is very, very simple. You guys already got the clue, I know. So first of all, glucose less, increased protein, and increased lymphocytes. So glucose protein, based on these two, we can say it could be bacteria or TB. Now, because lymphocytes is increased, so it is a meningitis case. This is a meningitis case. So, because of lymphocyte high, might diagnosis Mycobacterium tuberculosis, or any fungal it can be, but usually Mycobacterium tuberculosis only. So, but because, why I saying? Because already they given lung fibrosis, hilar lymphadenopathy, they all are more going towards a TB. So where is my TB? I don't see. The answer is Cox bacilli, because the other name for Mycobacterium TB is basically called as Cox. So it is a Cox bacilli. Very simple. TB, Mycobacterium TB. Not to confuse too much. It's not a virus, because virus means everything will be normal. All right. So that's glucose protein will be normal. So that's all. Very, very simple. This questions are done. You can't make any mistake. Never ever try to, make any mistake in this type of question. It will be a big, big, big blunder. Yeah. Okay. Now next. Yes. Now our next. So this is a typical. Yes. This is our LJ media. LJ media. You can see typical LJ media. This is also like enrichment media. Like LSS media. This is enrichment media sterilized by inspisation or tyndallization. You know very well. I'm not going to stress that one here now. Now this is an acid fast stain. In acid fast stain, we are using how much? 25% H2SO4, right? 25% H2SO4. You see this color, no? This is the one you get. What you get? You get a beaded appearance, beaded pink bacilli, pink or red bacilli you see in acid fast bacilli. Okay, that you know about. Yes, that is for now. This is okay. Okay, remember this one is more than enough. Now look at this question. Yes, here a HIV patient with CD4 count less than 100 with a pulmonary infection. He got some pulmonary infection. This sputum sample collected showed acid fast bacteria. There was an acid fast bacteria, which you don't know which one is likely. So this is exactly like looks like a Mycobacterium TB, right? This looks like a Mycobacterium TB, Mycobacterium species. Okay, definitely it's a Mycobacterium species. But look at the condition. A CD4 less than 100. CD4 less than 100, the highly chance possibility is your which one? Ideally, it should be less than 50, but here it's 100 is given, doesn't matter. The common one is your Mycobacterium avium intracellulare complex. Intracellulare complex, which is also called Beti, Avi Beti, Avi Beti. Avi means Beti, Beti. Avi is a Beti, Beti. Betis bacillus. We also call as Betis bacillus. Okay, it's a very dangerous one. We also call as SMAC complex. SMAC complex we call. So this is causing very severe type of pneumonia in HIV patient. Cause very bad one. Okay. Hmm. Non-pigment comes under the non-pigment producers. Okay, so now what happened? So Cryptococcus, no, Cryptococcus is a fungi, so it is not acid fast. Just leave it. Pneumocystis also. Pneumocystis will not. It's also fine. It comes under fungi group. It will not cause. Nocardia is acid fast, but not this picture. This is also acid fast, but which all Noraphethy is acid fast, but not this one. So your only option should be Mycobacterium avium intracellular. It's right. Okay, very simple. So this also don't forget, you don't expect always a Mycobacterium TB will come, this one come. So two of them, another Mycobacterium species, one is your Mycobacterium kansasi, it is non-tubercular mycobacterium, and another one is here, this Mycobacterium avium intracellular complex, MAC complex. This both disease, they look similar to TB, Mycobacterium TB. That can be questioned. Which of the following disease resembles means kansasi or MAC complex? It's a pigment producer, this is not pigment producer. Okay, that's all. Okay, not going to stress too much there. Look at the next question. Yes, very important. And I know you guys must be so thorough with this question. You must know one question. It's sure. In the which phase of bacterial growth bacteria attains the maximum growth? Okay, so this is basically what is the idea is basically they're saying about the growth curve. So when you talk about growth curve, this is a beautiful growth curve. You know there are four phases. This, right? So there is a lag, log, stationary, and then this is your decline. Yes, each phase what is important. Lag phase, in lag, okay, let me write it here, it's better. Lag, and then log, then stationary. Okay, now in lag phase, it's like a relaxing, your lazy phase, you are in vacation, lazy, your vacation. End of the vacation, what happened? You will become big, the size increases. You become, before coming to college and vacation, lazy vacation, you are in a vacation and you are lazy, so size become maximum. Log phase, what happened? You come to college, you go to college in log, you're in college, so you're active. So in active means what happened? Automatically your size decreases, you will multiply, you'll make more and more friends, you become more slim and trim and fit. And what you do in college, you have to do biochemical test. If you come to if you come to our department, microbiology, you have to do biochemical test, you have to do gram stain, any staining. In fact, any staining you have to do, any staining, and maybe you have to put some AST test, also antibiotic sensitivity test. So these all are in your active log phase. What about stationary phase? Stationary phase, STAT is there. So I'm going to make the stat as a B, stab. So what is the S stands for? S for spores, T for toxin. Which toxin I'm talking? Exotoxin. And A, what I'm talking, antibiotic production. Some of the bacteria produce antibiotic also. And B, I'm talking about bacteriocin. These also produce bacteria. Fantastic. That's all. Decline, and then of course here in stationary, the live cells is equal to dead cells. In dead, everything is dead. So there will be more dead cells. That's all. Nothing important there. Now your question can come from anywhere. Now you see here the question is simply bacteria attains maximum growth, maximum size or growth. So it is your end of the which phase? Lag phase. So I'm going to mark the lag phase. Very, very easy. Log phase, they can ask you next. This time you can expect this question: which phase best to make a biochemical test or staining method or antibiotic sensitivity? So you're going to mark log phase. Or spores is 100 times repeated question. Which phase spores are formed? In S for S, stationary phase. No mistakes in this question. Never ever unacceptable. Of course, log phase is, remember, log phase also called exponential phase. Exponential, don't get confused, it's a logarithm, no? So exponential. Okay. And of course, toxins they can ask, antibiotic bacitracin less asked, but this anything can come. So very simple, easy, you'll get 1 mark just like that, like easily. Okay. Now next one, next question is a third. Exotoxin, endotoxin, without, there will not be any question without exon endotoxin. You know, you always have to remember very well. I always say only one thing to my students to remember, or student, when you talk about endotoxin, exotoxin, remember like this: you have endotoxin and you have exotoxin. Endotoxin means who stays inside the house, who's an introvert, he's always inside the house. Exotoxin means who goes outside the house, you know, he's very, very happy and jolly type. Exotoxin, right? Exo and endo. Now, like this is for really no any person, don't nobody takes it personally. Okay, it's just for clue. So outside you have this beautiful sun is there. Okay, sun. Here also beautiful sun is there. Okay, sun. Okay. Now look at this. Endotoxin people, endotoxin who are always inside. So when they are always inside, they are negative. They are always negative people. Thoda, they are always negative. Okay, they're inside the house. Second one, what happened? They are negative means they are getting heavy, no? So they get a lot of lipid, fatty fat. They become a little bit fatty. That means lipopolysaccharide. Lipopolysaccharide. Negative, they have a lot of lipid in their body, they're inside the house, so heat stable, they will not get any problem because they're inside the house, so heat stable will be. Unfortunately, no immunity, no immunity at all, they're inside the house, so how they'll get immunity? No immune, not immune, that's all. Okay, because they're mostly no protein, no good protein, so they're not protein, they're mostly sugar lipid, so no protein. Exotoxin, they're going out, so they are mostly gram positive, sometimes they can be negative. Okay, clue. And here what happened? They are going out. So they take a lot of proteins to become strong and healthy. They drink protein powder. They go out and play games, etc., etc. Unfortunately, there is sun. So they will be heat labile. So sad, no? Because it be a lot of heat when they're playing, they'll get this thing, no? So they heat labile. Okay. Now they are protein. So the immunity, they're playing games, they're meeting people. So the immunity is strong. So immune reaction is positive, antigenic positive. Okay. This much only. For this, you're breaking your head for so many years and you're revising 1,000 times in bathroom. You're sticking and reading and reading. This you remember exo people, endo people, very easy. Okay. Exotoxin. So this is extrovert, active guys. Okay. This is our active guys. Uh, okay. So I think I'm endotoxin. Okay. I'm also a little bit endotoxin type of guy. Okay. I'm just kidding. I'm mixed. Okay. Now exotoxin, you're going outside, an active guy. So what happened? LPS is your nature? No, you're not having lipid. LPS is lipopolysaccharide? No, you're outsider. So you're not bit. And only gram negative people? Not at all. You're positive guy. You're going outside. You're an extrovert. You're an extrovert. No, you're very positive. Okay. Both positive, but mostly positive. Heat stable? How can I be heat stable? I'm going outside. It's a heat labile. I will be, this thing. With sunlight, I will die, I'm not die. I'll get fainted. Toxoid can be produced. Absolutely right. Because I'm going outside means I'm taking a lot of protein. I'm a proteinicious guy. So I can make toxoid. I can make all the vaccine. When I say immune means vaccines can be made. Protection is there. Okay. Finished. You got it. So toxoid can be produced. Your answer is D. Very simple. And this time expect one question from here. Definitely 100% guaranteed question from here. Okay. That's all. Now let's go to next one. Now here you see, yeah, identify the test to detect the toxin causing the below disease. Toxin causing the below disease. Okay. Identify the test to detect the toxin. So nothing they will be given the picture. What I'm seeing here, I am seeing a beautiful pseudomembrane. When I see a pseudomembrane, sometimes there can be bull neck also, na? You know that the outside one bull neck, it looks like a parrot, but it's not a parrot, bull neck. These two are very characteristic. Which one? Your Corynebacterium, diphtheria. Corynebacterium, diphtheria. So to detect the toxin, so coronary diphtheria, if you have to detect this toxin, excuse me, excuse me. So for coronary diphtheria, to detect the toxin is exotoxin. You know that diphtheria toxin is exotoxin A. So detect this toxin, which method I should use? Shick test is for diphtheria only, but that detects what? If you remember, this is the susceptibility. This detects the susceptibility of it. We don't use much. We did this the susceptibility. So that is out. It's a skin test. You know, remember type 3 hypersensitivity reaction is a type 3 hypersensitivity. Nobody asked, but if you remember also, okay. And what about Nagel's reaction? We'll come to Alex before that. Nagel's reaction, Nagel's Nagarjun. Nagel's is Nagarjun. Naga is basically a perfect Clostridium perfringens. To detect the Clostridium perfringens toxin, lecithinase, you remember? Like lecithinase phospholipid C is basically. Cassoni, again, repeated question. This all are important question. Cassoni, you know, for hydatid cyst. For hydatid disease, hydatid cyst, you inject, it's a type 1 hypersensitivity. Remember, it's a type 1 hypersensitivity reaction. That's all. So only it's a electrical precipitation is the method. Okay. So how you remember? Elec is like electric current. You know, it's like electric current. Remember, like it's electric current. Where you have electric current in your throat, diphtheria. Only in diphtheria you will have electric current. Okay. So this is the test to detect your toxin. Nagel's for Nagel's reaction for detecting the Clostridium perfringens का lecithinase toxin. Lecithinase toxin. Hydatid disease for Cassoni's test. Schick is for susceptible diphtheria. Very, very simple. Okay. Very, very easy and very chocolatey question. No mistakes here. Now, next question. Look at this. Here, this patient is having, he's a chronic, first of all, he's a chronic smoker. Okay. High fever, cough, confusion, plus diarrhea. So, there is a respiratory symptom. Everything is there. There is a respiratory symptom. There is a GIT symptom. Diarrhea is there. Though that is a phyto, this combo comes. This combo will happen only with our military people. That is our legions, legionella legions. Okay, poor them. They suffer a lot and they get this disease, right? So that's one. So now if you see, so this is, so on chest X-ray, you can see bilateral infiltrates are there. Okay, bilateral infiltrates are there. Now the sputum showed gram negative bacilli. Okay, gram negative bacilli is okay. That is, okay, but okay, we'll go there. So now you have to identify. See, another thing also, if you go here, so this will first find the answer now. So this type of combination comes lung bilateral infiltrate. Bilateral infiltrate means basically it's an atypical pneumonia. Okay, this is atypical pneumonia. Pneumonia. Okay. Now, so what does that mean? So this is very characteristic for which one? Your Legionella pneumonia. Okay. All cause atypical, but this combination of confusion, high fever, diarrhea with combination typical for Legionella. And you know, BYC media, we buy charcoal yeast agar you use. And then the AC, because of broken AC as other clues for the disease. That's fine. Not about it. Now, yeah, that's all. Okay. This is only atypical pneumonia and this is for Legionella. We already saw that. We are going to the next question. Agent used in the plasma sterilization. Agent which is used in the plasma sterilization. Okay, now this is very important here. Also, it's a sort of sterilization question. So in plasma sterilization, you know, it is very, very important. We are using the, which one? We are using the vaporized H2O2. Okay, this is the one, the plasma sterilization. So plasma sterilization, what is important? Another important thing you have to know is in plasma sterilization, it's best for the arthroscope. Arthroscope. Because 2% Sidex, 2% Sidex glutaraldehyde, 2% Sidex glutaraldehyde is for all endoscopes. All endoscope, but exception is this arthroscope. So use plasma sterilization where we are using H2O2 gas. And here also you should remember for the indicator, biological indicator, you are using same like autoclave. You are using Bacillus stearothermophilus. Bacillus stearothermophilus. Two questions, okay, for arthroscope and basis theophilus. Ethylene oxide, again, very important. Ethylene oxide, we'll talk a little bit about ethylene oxide. Ethylene oxide is used for, if you remember, the answer is this one, okay. Ethylene oxide we use for ICU respirator. All the, for sterilizing the respirator and the heart-lung machine. Heart-lung machine. Eti, you know, that is because Eti, our girl, Eti is a Dr. Eti, you know, popular girl. She's in ICU in charge. She works in ICU. So she does respiratory heart lung machine. One second one, you know, her favorite is she likes to make gobi sabji. Can you believe? She likes gobi sabji. Of all the food, she likes gobi sabji. Why? Because the indicators are Bacillus globigi, and then other is Bacillus subtilis. These are the two indicators you're going to use. Formaldehyde for fumigation. The answer here is vaporized H2O2 is basically plasma sterilization for arthroscope. That's all. This much you remember, more than enough. Okay. Yes. Next one. Now, next question. Another very interesting and very nice question. You can't make me this more a medicine question, but related to our microbiology. Okay. What is that? Read it. Yeah, the young patient with history of severe dysentery subsequently developed quadriplegia. Okay, he had a dysentery, suddenly went ascending quadriplegia. So I'm going to think only one disease. Pain and everything is normal. He got a quadriplegia. That means he got some neurological disorder after dysentery. So what are you going to think about that disease if some severe dysentery and ascending quadriplegia happens? So severe, see, the ascending quadriplegia means it's of one clue, that is GBS, Guillain-Barré syndrome. You got it. Answer is Guillain-Barré syndrome. Very, very fine. No problem. No doubt in it. Rest all are descending. Myasthenia gravis descending. Lambert-Eaton descending. Transverse myelitis mixed. So Guillain-Barré from microbiological point of view. Okay. So this is ascending paralysis, number one clue. And what are the diseases usually causes this? Campylobacter jejuni. Campylobacter jejuni. Number one. Number two is Zika virus. So remember, in camp, when you're using Zika noodles, you'll get Guillain-Barré syndrome. Be careful. Zika noodles or Campylobacter jejuni, you'll get this thing. Okay, that's all. This is only what to remember. Campylobacter jejuni and Zika. These are the two common that is can lead to Guillain-Barré syndrome. And Campylobacter jejuni, I'm not going to stress too much. This is again a microaerophilic. It's very characteristic, known for its microaerophilic property. Excuse me. Excuse me. Butcher's media, we have Butcher's screws media. The media for going this is screws. Screws media. And Gramstein, you have seagull appearance. Seagull appearance. Seagull appearance. Okay, that's all. These are few important things that you have to remember in Guillain. Otherwise, it's diarrhea. It's usually poultry. It comes from the poultry. So diarrhea comes of the poultry. That's all. Okay, Guillain-Barré is commonly asked question. Okay, next. Antibodies that's causing both opsonization and activating classic complement pathway. So antibodies. Which antibodies that causing the opsonization and also activating classic complement pathway. So you know very, very well, that is our favorite one, IgG and IgM. They are the common ones which is causing this one. Okay, this type of thing comes only these two. Okay, one is your IgG, another one is your one is IgG, other one is IgM. So common for opsonization and classic complement pathway. But for alternate pathway, if they ask alternate pathway, it is IgA. Okay, remember that. That can be a question. Okay. Opsonization making phagocytosis easy, and then classic complement also, classic complement activation, IgG and IgM. That's all. Okay, this one I want to stress here. That's all. Next, this question. Okay, it's an easy question. Now comes another very, very interesting question. You guys must be like known. Was very happy seeing this. So, electron microscope, they have given in electron microscope, there is this organism, which is the best test. So they have given, what is this one? You can see what shape it is. It is a bullet shape. It's like this, no? It's a bullet. So whenever you see a bullet, who will try to kill a bullet? Who will try to kill a bullet when there is what? When there is a dog. So that is rabies, for rabies. So it's a bullet shaped disease. So it is rabies. That is a test for rabies, which is the best test. The gold standard, the best test is not virus oscillation, fluorescent focus, fluorescent antibody. The best is direct fluorescent antibody test. Direct fluorescent antibody test. Okay, that with the fluorescent, you will check the antigen, you will detect the antigen. You detect the antigen. Okay, now how to do for rabies diagnosis? I'm going to write it here. We have rabies, two types: antemortem and postmortem. Antemortem, both are important. Antemortem and after dying, postmortem diagnosis of the patient. Yeah. So now antemortem test, the best sample from where you can take is a question. Where you will take nape of the neck. From the nape of neck, you have to take the hair follicle. Hair follicle. Remember, that's a question. Hair follicle, you will take the sample. Okay, you'll take. And then you will use a special stain called cellar stain. Cellar stain because you will sell the dog. When the dog got rabies, you sell it out. Okay. It's dangerous, but I'm just saying. Cellar stain. You use the cellar stain and then you will check for the antigen. You'll do this direct fluorescent antibody test. Cellar stain is one, and of course Other one is your direct fluorescent antibody. This test which you're doing, the one which you're doing, direct fluorescent antibody test. Okay, important. It's a gold standard. It's the best gold standard. Okay. Post-mortem, they already died. So we are looking for what we're looking. We're looking for the Negri bodies. Negri bodies, you know, very, very well. Important question again. And Negri bodies, where do you see which organ? Where you will see Negri bodies? Usually in the hippocampus. You do postmortem and you check it in the hippocampus or cerebellum. Sometimes basal ganglion also. Okay, any part. Okay, but this is the common sites where you can see ganglion. Okay, that's all. This is the common thing. That's all. Very, very simple and easy. So you don't make mistake. Rabies diagnosis, you do like this. Anything, I don't think so. I think most of them we covered. This is only main thing is the diagnostic part for rabies, only very important. Otherwise, this hydrophobia, aerophobia, all those photophobia, all those things are general symptoms of the rabies. Okay, I'm not going to talk that too much here. A patient comes with a GIT distress. GIT distress, so something related to GIT. He must have taken something, ate something outside. Habit of eating outside usually. Which hepatitis virus is this? You know that. So whenever fecal-oral route comes, only two viruses. So the viruses can be fecal-oral route, only two viruses. What are they? They are your, one is your hepatitis A virus, and another one is your hepatitis E virus. That's all. Okay, common. Otherwise, rest all the viruses, this all three viruses, they have other routes like the sex route, blood transfusion. First of all, IV drug. IV drug users, blood transfusion, mother to child. Vertical. Okay, these are other important things. Okay, routes. So this is the one they can ask you very easily. Okay. Yes. And again, a little bit about which group they belong. They might ask also. These days, you know, there are people are crazy. They can ask any question. So HAV belongs to which one? Picornavirus. Picornavirus. E belongs to EC. I always say EC. Everything is EC. And a C calcivirus. A class pick, you know, always the picks are A class picks. Okay, easy. And then hepatitis B is only DNA virus. It's the only DNA. So it's called Hep DNA virus. Hep DNA virus. That's, you know, that one. And C, chocolate flavor. So Flavi virus. And D is called defective. D for defective or delta. Defective because it depends on B virus or delta. Delta viridae belongs to delta viridae. Okay, all question. Anything they can ask. Okay, so that's what I'm just stressing because they will stick to the basic one and try to confuse you. So let's be ready for all the things. Okay, however they want to, you know, try to make you this thing, right? That's what I'm stressing these points. Okay, next. Excuse me. Yeah. Okay, now, okay, next one. Look at this question. Here you can see the patient presented with painful blisters. The patient presented with the painful blisters. Once again. Painful blisters on the trunk involving dermatome. Which of the following is false? False statement. Okay, they said he's presented with the painful blister. So see, it's along the, if you see the picture, it is along the dermatomes, dermatomes, like unilateral side. So when this type of picture comes, painful blister imagery comes, you have to think only one thing. What is running in your mind? If you're saying it is shingles, that is basically varicella zoster, shingles. Reactivation of your varicella zoster, VZV, the one which causing chickenpox. Yeah, varicella zoster virus, basically zoster virus reactivation. So you should be an immunocompromised patient. Very common in HIV patient. It comes very common in HIV patient. It's very common. Or immunocompromised. Whenever immunity goes down, or other stress, anything in those conditions, it gets reactivated from the new. It's all the ganglion, no? So it will just come and causes infection. So usually common immunocompromised, definitely yes. This is right answer. Painful blisters unilateral, definitely very painful. Caused by herpes simplex, yeah, that is the thing. So it is not a herpes simplex, it's a herpes zoster virus. That's what varicella zoster or herpes zoster we call it. Herpes zoster virus. Okay. Gabapentin and acyclovir, definitely we have to give for the treatment. So this is the wrong answer is this one. So this is gabapentin or pentagabalin. Okay. So the pregabalin, gabapentin. These are the commonly used for the pain you're giving. Okay, that's it. So this is one of the complications of your this thing. Okay, shingles. Next one, the inclusion body of the virus is one. So this is, by seeing only, still I remember in my exam, almost every exam I had this one. Repeatedly they ask, okay, so what is this one? This is first of all, owli. Owl eye comes. I always say like this to my students. Remember, who is having the owl eye? Chief Minister, CM. CM's house, they have owl eye. Okay, CM house, they have owl. They have owl. They have owl. CM house has owl. That's it. So when I say CM, it is cytomegalovirus. Okay, CMV virus. Now, what are truth about CM virus? It causes mononucleosis? Definitely, yes. They asked which is the incorrect statement. The question asked here is incorrect statement. Inclusion body is given. Okay, now they're saying Paul Bunel test is positive. So there I'm going to ask you a question. Wait. Causes retinal HIV? Definitely yes. It is the most common when the CD4 count less than 15 HIV patient, it causes the retinitis. Okay, very, very important. Most common cause of retinitis, chorioretinitis or retinitis in the HIV patient. Okay. Now, cerebral calcification fits? Definitely yes. Microcephaly, cerebral calcification, all are catastrophic for your cytomegalovirus. Okay, right, fine. Now, so what is the thing? Paul Bunel is positive? No, that is very, very important. Why? Because when you talk about mononucleosis, I'm going to write it here. Sorry, cut this one. Mononucleosis. When you talk about mononucleosis, it's basically, that is in tonsils, no? They have this, we also call kissing disease or infective mononucleosis. So when you have mononucleosis, the causative agent is both Epstein-Barr virus and cytomegalovirus. Okay, cytomegalovirus. Also called kissing disease, no? Kissing disease, because the tonsils are affected, because the tonsils, it that it affects the B cells. The B cells are favorite for cytomegalo and the your Epstein-Barr virus. There are also B is there, Epstein-Barr B. So like now the differential is these two. So only differentiate how you differentiate. Both mononucleosis is there, means atypical lymphocytes will be there. So for these two you differentiate, you're doing what? Paul Bunel. You remember this is a heterophile test. Now, Paul Bunel one, other one is monospot test. These two are only for Epstein-Barr virus. Paul has Epstein-Barr virus. In CMV, it is negative, negative. So that would be negative. Remember that, okay? Paul will always go with the BB. If you forget also Epstein-Barr, Paul Bunel, all BBs are there, so no need to worry. Okay, easy. Okay, that's all. So this is very simple. So your answer is no, Paul Bunel is negative. It's not positive. Okay, that's the thing. Okay, finished. Very simple. See, why to struggle? So easy revisions we have. Now look at this question. Another very examiner's favorite virus, I would say. Most of the examiner's favorite virus. A child present with a maculopapular rash, it begins at the back of the ear. Always. It starts from the back of the ear means itself. I will think one of the paramyxovirus. Which is that one? It is your, okay, let's see. So you can, if you say measles, then you're right. Already you got the answer, but still wait. So there fever was there, conjunctivitis and running nose was there a few days back. Oral cavity showed this lesion, which is wrong. And the oral cavity showed some lesion, but what is the wrong statement? Yes, okay, good. So what is this lesion you're seeing? You can see here this white spot. You can see this white color. It's a bit dry, white spot. That is basically your, that is very characteristic. That is your Koplik spot. So this is basically the Koplik spot. So when all this Koplik spot, clue, and the lesions in the maculopapular behind where all goes towards your measles. Measles disease. So measles, very well. Okay. So it is belongs to paramyxovirus? Definitely yes, because in paramyxovirus, in paramyxovirus, we have P, that is your parainfluenza, R, respiratory syncytial virus, and two M's, that is your measles and mumps. Not the rubella. Rubella will never come. Rubella is your Togo virus. Okay. And then one more is nowadays Nipah. Nipah also comes here. It's very important. That's all. Okay. So this is right answer. Warthin-Finkelly cell? Definitely yes. Look at this picture. This is the Warthin-Finkelly, the giant multinucleated giant cell. This is basically Mng cell in this thing, which is called Warthin-Finkelly cell. Same thing. So characteristic right. SSP, yes, very important question also repeatedly asked. SSP is a subsclerosing panencephalitis. Okay, subsclerosing panencephalopathy or encephalitis, you can say. Okay, we have PMLE also, proximal multilocal leukoencephalopathy, that is in JC virus. So this is subsclerosing panencephalitis. Okay, leukoencephalitis, this is SSPLE should be, it's okay, fine. Panencephalitis, this is a very rare disorder that comes after many years, SSP. Okay, so fine. Now, the vaccine strain is Gerryl Lynn strain. Is it right? No, not at all. Because Gerryl Lynn strain is for mumps. This is for mumps. This is mumps vaccine. For measles vaccine, the vaccine name is basically we call Edmonston, Garib. You remember the Garib people gets measles. Okay. Schwartz also. Schwartz, Edmonston Zagreb, but mostly Edmonston only they'll ask. Edmonston Zagreb. So Garib people, they can get measles, monster measles, Garib people. Okay. Monster Garib. That's it. Okay. Measles. Finished. Vaccine. For this vaccine. Okay. That's all. So we are done with this. And for rubella, it is RA 27/3. Okay. For rubella. You know that rubella. Because we're talking about MMR, so we'll talk like this. You want to say RA 27/3, right? Okay. Now, 50th question. A patient presented with fever, chills for a week. On blood smear, Giemsa stain for the following picture was given. Which of the following is true regarding this Plasmodium species? Okay, you have the symptoms. Look at the symptoms. It looks like the patient's fever, chills for a week. Blood agar Giemsa was done. Following is true. Which of the following is true? So here, so look at this picture you're seeing. This is the gametocyte of what shape? Gametocyte which is banana. When it is banana shape or sickle shape, they call sickle, crescent or banana. Okay, anything. Crescent or banana shape means itself, you know very well what you will be thinking. You should think that is the most dangerous one. Your Plasmodium falciparum malaria. This is symptoms are more like a malaria. This is falciparum, Plasmodium falciparum. It's the most dangerous. Okay, because most I remember why, because there's a dot called Moyer's dot. Moyer's means it looks more like a Mao, no, China's name, Mao. Okay, so this very dangerous one. Everything is dangerous here. Of course, it's dangerous. Trophozoite transitions visible in the peripheral smear? No, you don't see it. Remember, the late trophozoite and C joint. You will not see in the, because they all get occluded in the peripheral vessels. So you will never see it in the, liver vessels. Capillaries get occluded. So it doesn't come to the peripheral. It gets inside the organ itself it gets occluded. So it will not come. Only you will see gametocyte. Okay, that's what you see, gametocyte here. So these two, that's the right, visible is wrong answer. Relapse is seen in this, but no. Relapse is seen in which one? It is seen in the Plasmodium vivax and Plasmodium ovale, not here. A coliformis diagnostic, let's come there. Single ring seen in ultrafilms? No, this is also wrong statement. You will see, because Moyer, no, falciparum is very dangerous. So you see multiple rings. Okay. So what about acoliform? Yes, acol is seen. Acole is seen. This is the catastrophe. Acol is like a headphone. Remember all mouse Chinese, they put the earphone on their ear. Okay. So that's what you're seeing here. This even you can see it. I'll go to the picture here. So this is the thing. You see multiple ring and looks like a earphone. So acol. So this is classic for your Plasmodium falciparum. Okay, falciparum. But what about this one? What about the other ones? So here you see single ring. This all go for your Plasmodium vivax. Vivax and falciparum are the most common ones overall you'll see. So that's what single ring you see, and big RBCs. RBCs become big. Big RBC single. This all for which guy? Mr. Vivek. Vivek is a big guy. Vivek is a big guy. Vivek is a big guy, so he's single, big guy. But he's single, he says single, but he has two girlfriends. You know, one is Duffy antigen. If Duffy antigen positive means in RBC, it goes very fast. One, and also he has Shafna. He has a girlfriend, Duffy and Shafna. So these two words come. Please remember Vivax. That's it. Okay. And then this is a Chijon stage. If you see a Chijon, that's only in Vivax or in Ovale, but Chijon very characteristic. Okay. For falciparum. So this is Vivax. For Vivax. You don't see the Chijon till falciparum, never ever. Okay. And then the last one which you're seeing is you see oval shaped gametocyte. Oval gametocyte in Vivax. Ovale and malaria, they don't ask me, because those two are very rare. We don't have it almost in India. It's not there only. So Vivax and this only very commonly asked. Okay. So these all are seen for 5x. Okay. Duffy girl, Shuffner. Everything is for Vivek, Vivek, Vivek. Vivek is a lucky guy. He's single because single and he's a big guy. So big RBCs. And he has Duffy to help him go inside. And another girl, Shuffner. Shuffner's dart is seen. Very, very simple. Okay. This is a category for 5x. That's all. That's all. That's all. Okay. Now, just a second. So next question, 51st question, almost half of the 50 questions we finished. Another 50 questions are going to be very easy and very important. You will understand why. It's almost like one complete revision for you only. Nothing is lost here. No. So now next question. See here. It will be very helpful for you. Now more will be our mycology and parasitology topic, which is again very important. A young boy was presented with the abdominal discomfort, nausea, vomiting. Okay, fine, not important. Stool sample was taken and a microscopic examination was shown below. This egg was given. So what is the egg you're thinking? You know, always 2 or 3 eggs in exams, FMG is common. Look at this egg. What do you see? This is typical egg of which one? Your Ascaris lumbricoides. Ascaris lumbricoides, right? Ascaris lumbricoides. Okay, so it's one of the nematodes. But that is fine. Now, what is important for us here? So you have, when you talk about fertilized egg, we have two types. No, we have fertilized and unfertilized. Fertilized, another one is your unfertilized eggs. Two important eggs we have, fertilized and unfertilized. So fertilized and unfertilized, only difference is that you see in a fertilized egg, same this egg only, it will be like this. Okay, same like this. Here also like this. Here only thing is that you will see something, a space you can see. Okay, you see a crescentic space, that is one. So a space, you should see a space. The space must be seen positive and it will be floating. The egg will float. Floating will be positive. Okay, in unfertilized, no, it will be completely like this, completely covered. No space, no float. They sink down. No float. Okay, unfertilized. So they sink down. Easy, very easy. This is the concept. Okay, now you can say fertilized egg can float. Of course, definitely here they stood wrong statement. So definitely have for fertilized float. Space is there. Both of in fertilized everything is positive. Here everything is nothing. In unfertilized. So unfertilized, nothing. No space, no float. Bile stained egg, yes, all are bile stained eggs. It's right. So we'll talk about non-bile stained eggs. If you remember, non-bile stained eggs, non-bile eggs. Shortcut is Neha. Neha is a beautiful girl. She doesn't have any bile and all. She doesn't have any joints, right? Neha is a beautiful girl. So N for Nicator. E for Enterobius vermicularis. Basically the pinworm, the threadworm or pinworm. H for H nana, Hymenolipis nana. A for Ancyclostoma. If you remember Ancyclostoma, these two both are buddies because they both are hookworms. They are hookworms. These are non-bile. Rest all are bile-stained egg in your whole parasitology. Okay, so it's easy. So definitely yes. A crescent-shaped space is seen in unfertilized. Yes, now comes. I told now. So everything in unfertilized is negative. So no space, no this thing. So this is a wrong answer. There is no any crescent-shaped space and all there. Okay, it's just an embryo and finished. They belong to nematode family. Definitely yes. Take up the big list is there. Nematode. And that this Ascaris also will come in the nematode family. Okay, that's all. So this is very easy. This is questionable. You can't make mistake, right? Yes. Now next one. Look at this question, another parasite question. We already discussed it. Now it's coming here again. 35-year-old female complained of vaginal pain after sex and fishy smell discharge. Fishy smell discharge. Excuse. A sample was collected and Giemsa stain was done, which is a true statement. Okay. Ideally, here there must be a little bit confusion for you. Fishy smell discharge. Ideally, fishy smell discharge is for your BV, but not necessarily. Sometimes your Trichomonas vaginalis also can have a fishy smell discharge. Nothing, they can be mixed infections. Okay, mixed. So you don't have to stick to that because you have other clues. So anyway, they've given you the picture. They've given you the beautiful picture. What they've given, you see everything is here single. What I'm seeing single nucleus. And I'm seeing only trophozoite, no cyst, only trophozoite. So when this type of situation comes, only one thing I'm going to remember, who I'm going to think. You guys know already, I've repeated many times previous classes. This is our single Trisha. Our single girl, Trisha. Trisha is basically Trichomonas vaginal, TV. trichomonas, no TV. So trichomonas are the Trisha because it is trichomonas. So why it's important? Because Trisha likes green veggie. She likes green veggie. She likes greens and she likes strawberry. Remember, her favorite fruit is strawberry. She's single. She's still single, single, single. Single nucleus and the only trophocyte state. There is no cyst. There is no cyst. Okay. For Trisha, there is no cyst. Only trophocyte. Okay. Single. And what is there? She has a beautiful eyelash. So cystine, lash, cystine media. She has beautiful eyelash and she has also beautiful, what is diamond. She's very rich actress, no? So yes, diamond. Okay, these two are the media name. These are the media name. And one more thing, she has only 5 flagella. Okay, 5 flagella, 5 total flagellas, 4 anterior and 1 posterior. These are the few things. Clues. Now, Clusil is characteristic? No, Clusil is not here. Both trophos and cyst is in? No, I just told that is not possible at all. Okay, that is not possible because this only trophocyte is the cyst is not seen. pH is less than 4. No, this is for Candida. This is for Candida. Clusal, who has a clue? BV. BV has clue. So this is also wrong. So there is no cyst stage. Partner must be treated. Yes, that's the only thing because your trichomonas vagis mostly it goes to sex only, not to this thing. So for this vaginosis, you have to treat the partner. Apart from that, this I given you clue. Why did I say green? Because see, because green discharge. It causes greenish discharge. Greenish discharge. Green is discharge. I'm going to put this one a little bit down. Yeah, because green is discharge. Strawberry vagina. Strawberry vagina. You have strawberry vagina is there. Single because trophocytone is there. This thing. So these are the few things. So lash and cystine are the culture medias. Culture media. Because she has a beautiful eyelash. This is Trisha. If you see, she has this beautiful eyelash. Okay. Beautiful eyelash. And don't forget, she wears nice diamond. So diamonds media and lash cystine media. Okay, they are the common questions frequently asked and 5 flagella. So anteriorly, Trisha has 4 flagella. Posteriorly, she has only 1 flagella. 1 posterior and 4 anterior flagellas. That's it. That's exactly what is given here. You see only 1 posterior. Anterior, there will be 4 flagellas like this. Okay, that's all. Simple, very simple and single nucleus. There's only 1 nucleus inside. Contrast to your Giardia has 2. Okay, that's all. Very, very simple. No doubt in it. Trichomonas vagis, now you will not make any mistake. Okay, easy. Trisha is going to help you in your exam. Okay. Now, next one. So what is this question? You can see here, this question. Here, look at this. Which of the following is true regarding LPCB? LPCB is a lactophenol cotton blue. Okay, lactophenol is blue color. No, what you're seeing is a LPCB stain, lactophenol. Now, what you're seeing, when I'm going to this picture, what I'm going to think is that I am seeing something like this. So what is this shape like this? It is a spindle. This is a spindle-shaped macroconidia. Spindle macroconidia. When I see a spindle macroconidia, I always think about something spindle. So microsporum. Microsporum. So I have SP, spindle microsporum. So microsporum is basically the one of the dermatophytes. And remember, we have 3: epidermophyton, trichophyton, and this one. Microsporum, it will affect only the skin and hair. Skin and hair. But remember, this is the first one, microsporium. But we also microsporum. But here we also have what? Trichophyton. And we also have epidermophyton. Epidermophyton. Trichophyton, tri. So you have your skin plus hair plus nail affected. Look at the picture. This is called try with pencil. Try with pencil always. Before going to pen, try with pencil. So pencil shaped microconidia. Pencil microconidia. Conidia. Okay. Sorry, pencil macro. I'm sorry, macroconidia. And of course, in trichophyton, you have a large amount of microconidia too. Microconidia is too much here. So pencil number 1 question. All 3 are affected also. Another question. They all are dermatophytes. Epidermophyton. Here, epidermis skin ends with N. So it is the nail, not the hair, nail. Also question, frequently asked. And look at this. This looks like a club. So club-shaped macroconidia. Macroconidia. Club-shaped macroconidia. Here it is pencil. Here it is Club-shaped macroconidia. Okay, so how to remember club? All the persons in South India, the name with Abi, you know, Abi, the guy with Abi, they own a club. They own a club for party. Okay, remember like that. Abi has a club. Trichome is 3. Try with pencil. So pencil macro question. This was a question. And then what we got is a microspore. Okay, Microspore adoni, Microspore canis, so many species are there. That's not interesting. Now question is true. This is a trichophyton species? Not at all. Trichophyton should be pencil. So I'm not going to put that. Pencil microconidia. Macroconidia again. Macroconidia. Skin and hair affected? Skin and hair. Yes, that is right. That is true. Because that's what I told. Microspore means you remember micro hair. Nowadays, everybody hair is micro only. We don't have good hair. We have hair fall. So micro hair. And spindle. SP is there. So it's spindle. Easy. So that's right answer. Microconiocommon, no. This is common in trichophyton. Trichophyton is the one which has more microcondia. Microsporum doesn't have microcondia. Okay, micro doesn't have micro. Remember like that. Red pigment, reverse red pigment is characteristic not for this. That is for your it comes in the trichophyton rubrum species. Rubrum. Okay, rubrum. Also your penicillium marnifi has this. Not here. Okay, so just out. So your right answer, skin and hair affected. Expect one question. Thoroughly, definitely 100% you will have one question of all this picture. One question will come. That is in history, in whole Fmge history and Neet PG history, it is there. So please remember this one. Okay. Next question. Next question is a farmer. You look at this another beautiful question. A farmer presented with the ulcerative lesion on the lymphatics of the arm. Okay. Along this lymphatic of the arm, upper arm maybe, he got this picture. It's a false statement. What is a false statement? Okay. So first history for me giving a farmer ulcerative lesion along the things more for me. It is going towards which disease? Going towards the sporothrix. Sporothrix, okay, because it's ulcerative and along the lymphatics means it's, you know, that it's along the arm. If you say this is the arm, it is along the arm like this, it's going. So that row of ulcers, sporothrix Schenki. Okay, that's fine. Look at this picture. I'm seeing a beautiful what? Flower like conidia. Rose flower like conidia. Flower or rose conidia, whatever you want. It's look a rose like flower. So basically this is a Gardner's disease. You know that Gardner's disease because sporothrix means of Gardner's disease. So flower conidia is there. And then you know in sporothrix means rose Gardner. Always remember rose Gardner. This Gardner has many good things. First of all, Gardner, he smokes cigar. And he has a rose garden. That's what rose conidia, rose garden. Cigar bundle appearance. And he at night time, he likes to look at the stars. He like at the stars, staring star, okay? Stars. And what else? He has a splendor bike also. Remember, he has a splendor bike also. Such a good guy, you know, good. Sometimes he smokes pot. I remember, very dangerous guy. He smokes pot also. Okay, whatever that is. So now remember, so this is a dimorphic fungi. Definitely yes, because in dimorphic fungi, if you forget also, now I'm going to give a clue. Dimorphic fungi will it will come behind also. The shortcut is, if you remember, I told hit, blast, cock, paracock, all dangerous words, and spot and pen also. Okay. Hit for histoplasmosis, blast, blastomycosis, coccidiosis, paracoccidiosis, spot, sporothrix, P for penicillium. It will come there. I have written separately also. Don't worry, it will come there. Now, in sporothrix Schenki, important this you look at. So dimorphic, definitely yes. It comes under subcutaneous infection. Yes, there are 4 subcutaneous. You have to do MRCS for that. MRCS is mycetoma, rhinosporidium, chromoblastomycosis and sporothrix. Okay, we'll talk about it. It will come. Okay, so these 3 are important. So it's cause subcutaneous, definitely right. Cigar bundle appearance, that's now only I told Gardner smokes cigar, so that is also right. Copper penny bodies, no. This is a wrong answer. You see what body? Asteroid body. You see asteroid body. I'll show you that picture in a while. Stars. That's what I told stars because the gardeners watch the stars, not the copper penny stars. So that is asteroid body. So that is one thing we have to change. We'll talk about that now. Now, next question. Look at the next question. Somewhat similar. You could confuse you. So see again, once again, dimorphic we saw. So now when I said this one, MRCS, subcutaneous fungi, M for mycetoma. Other one is Rhinosporidium seaberry, that is the strawberry nose, Rhinosporidium seaberry, chromoblastomycosis, and Sporothrix. MRCS. If you want to know about subcutaneous fungal infection, you have to do MRCS. Okay, remember like that, MRCS. Okay. Now, look at this. The farmer here presented with a warty cutaneous lesion. Okay, I got it. He is a farmer. He got a warty cutaneous lesion like this. This is what you're seeing here. See this one you're seeing on his foot. Histopathology examination is given below. Which of the following is true regarding this fungi? Which is true? They ask which is true regarding this fungi. Okay, I see a what? It's a varicose what. Okay, it's basically varicose what? Varicose what? Okay. Huh. Epidemic varicose or whatever. Okay. So dimorphic fungi. Is it dimorphic fungi? Does it come in the? So no, they ask which is true. They ask true. No, they. Sorry. They ask which is true regarding this one. So now for true, it's a dimorphic fungi. No, it's not coming in this classification. See, hit blast in we have hit blast, blastomycos, cock, paracock, spot, sporothrix, pen. We don't have chromoblast, so it is not wrong. Okay. So it is not. This is basically this is basically the diagnosis of this disease. It's typically what? When a farmer comes and varicose growth comes, there is no doubt it's a chromoblastomycosis. Chromoblastomycosis. Got it? So it is not a dimorphic fungi. Careful. Blastomycosis is a dimorphic, but not chromoblast. Okay. Chromoblast is not dimorphic. Okay. Important. Figure of 8 appearance? No. Figure of 8 appearance is characteristic for your blastomycosis, not for chromoblastom. Blastomycosis, you see, I'll show you that picture. It'll come, not here. Okay. That's also out. Splendor Hopley phenomenon? No. I told Splendor bike is owned by Gardner. Gardner is otherwise called Sporothrix Shanghai. So it is Sporothrix. Sporothrix. So that is also out. This is also out. Murray-form cell. Yes, that is the right answer. Expect this question. A Murray-form cell is otherwise called, you have many names for this. It's also called as medlar body. Medlar bodies we call, or we call it as copper penny. Sometimes we call sclerotic body also. Don't forget sclerotic bodies. So any question, Murray-form, medlar, copper penny, some people remember as MMS, they remember. However, you won't remember medlar, copper, these all were chromoplastic. If you forgot, also see the word chrome. The chrome means it's like copper only. Now, you remember, right? When the word chrome comes, means it's like a copper only. So copper, sclerotic, they all meaning same. So that's what. So very close. So it's a farmer. So farmer, everything causing the causative agents are like fa. It goes like fa no, Fonseca. Fonseca, like this, the word no Fialophora, Fia for farmer, Fialophora, Cladophillophora, Clado, Fialophora, Fonseca, Fialophora, Cladophillophora. These are the etiological agents. Okay, so this comes under subcutaneous fungal infection. Okay, very good. Now look at this. These are the things you should know catastically. So this is one. This is a mycetoma. This is a mycetoma. So in mycetoma, you will see the sulfur granules. This is basically that sulfur granules. Sulfur granules. When you stain the sulfur granules, you will see all the periphery, all the basal, everything you can see like this. Okay, that is one thing. Just that peripheral things you can see. This is the typical sporothrix. Sporothrix, row of ulcer. We just spoke Gardner's disease. So Gardner's look at what? This one, that is the asteroid body. Asteroid body, otherwise bodies. Sometimes you call sugar bundle appearance, asteroid body, or the mechanism itself called splendor bike. So these type of things. Why did I say pot? Because the treatment of choice, you can use potassium iodide for sporothrix, but nowadays, of course, atraconazole is used. Okay, that's for sporothrix. Right. Now, what about this thing? What about this one? This is your chromoblastomycosis. So this is the one exactly the copper penny or the medlar bodies. Copper penny or medlar bodies. Copper penny or medlar body. Medlar body, Murray-form cells. Okay, that's it. So this picture comes easily, you can get it. So don't forget, with an asteroid body which looks like this, and then you can make it small so you can see compare. Asteroid body looks like this, that is for sporothrix, and this is copper penny for your chromoblastomycosis. I'm going to write it here also so that be easy. This is your chromoblastomycosis. Very, very simple, easy. You're not going to make any mistake in this question now. Yeah, easily you'll score it. I know that. Next one, look at this. This picture, I don't even read the question first. My eyes is going to the picture only. What I see here before going to the picture. So this question will make, just see. See, I'm seeing a beautiful spaghetti and meatball. Spaghetti and meatball. Okay, meatball. Or it's somewhat like banana and grapes. This type of question comes, eating food comes. There's only one lady who does that. Who is that girl? Who is that girl? Our Mala, eating Mala. No, Super Mala. I call her Super Mala. Super Mala because it is Malassezia furfur. The causative agent is Malassezia furfur. Furfur. Okay, you know this disease very well. This disease usually causes which one? Pityriasis versicolor. P-A-T-Y. Pityriasis versicolor. Versicolor. Okay. Not only that, okay, we'll go there, but before that, we'll go. I say super mala because it is a super antigen. Okay, super antigen, the super mala. Okay, mala says for versicolor. So, okay, now look at this question. Beautiful question. These are expected question. Not making any mistake in these questions. Okay, this is the way to make not only just pass, score also good. Okay. To increase your mark above 170, 180. Okay. So don't make mistake in these questions. So as a 20-year female, she came with a pruritic hypopigmented macules. Okay. Patches were over the chest, skin capping children show abundant yeast-like cell and filament-like spaghetti meatball. So spaghetti meatball has come. So your thing is Malassezia furfur. Now they told one false statement. Malassezia furfur is the causative agent. Is it right? Yes, of course, right. We just spoke about it. This is the right answer. Okay. Disease is tinea corporis? No. Why? The disease is actually Pityriasis versicolor or tinea versicolor. Pityriasis or we call tinea versicolor, but not corpor. That's wrong statement. Okay, that's the right answer. The wrong answer, false statement. ASD you eat fried egg. Exactly. Not only maggoty and speedball. This Mala, she likes to eat also what see fried egg also. She likes fried egg and adding olive oil. When adding olive oil, you get this fried egg clear colonies you get. Okay. So super antigen definitely is. That's what I call her as a super mole. Among super antigen bacteria, it's a staphylococcus and streptococcus, enterotoxin A and F. And your in streptococcus, it's the scarlet fever causing etherogenic toxin or super antigens. Okay. Apart from that, in viruses, rabies, HIV, or super antigens. And here, your mala. Only fungi with the super antigen is mala. That's what you have this disease. Okay, finished. Simple, simple, simple. So this is just easy to remember. This is exactly mala. See, she's eating. This is the typical rash, hypopigmented rash. So this is mala favorite meatball, banana and grapes. Your fried egg. Okay, that's all. Fried egg also, don't forget, fried egg is also seen in which one? Mycoplasma. Don't forget, fried egg also seen in mycoplasma. Fried egg colony, it's also characteristic for the mycoplasma. Okay, that's all. Okay. Now, next one. Which of the following is the least important for development of following fungal infection? First of all, look at this beautiful fungus. Okay. So you see here, it is a, first of all, wide angle. Okay. It is wide angled, no septate. That means aseptate. We have other something which is acute angled, aseptate hyphae. You call aseptate hyphae. They are fungus. Acute angled septate hyphae. Right? So wide angle means it's like this wide with no any space like this, okay? Like this. Acute angle means they are very well branched like this, okay? And very nicely branched, okay, like this. And they are septate. They have septate in between. Very beautiful septates they have, okay? Acute, 90 degree acute angle. So now what are these fungus? This aseptate is basically no shape wide. That guy name is zygomycosis or mucormycosis. Zygo or mucormycosis. Acute angle, the word itself gives you aseptate means it is aspergillus. Acute angle, septate. That's the clue. Okay, so never forget. You get a picture like this. If something wide, no any shape, give no, that is zygo. Zygo, the big guys. They know wide guy name is zygo. Aspergillus is clean. A for acute, S for septate. You have everything there. Okay. Now for mucormycosis, what are the clinical feature? The most common risk factors. They ask least important factor. So the most important factors here are diabetic ketoacidosis, definitely yes. Steroid, definitely yes. Neutropenia, definitely yes. What about chronic use of antibiotic? No link at all. Chronic use of antibiotic and fungi, there is no link at all. Okay. And one more thing you can add in zygomycosis. Apart from this, you can say people who excess iron, for especially when they go blood transfusion and all, increased iron chelators. When there's increased iron chelator use, for treatment purpose. So that also can be a problem, but use of antibiotics not a problem. Okay, mucormycosis only the same thing, which you remember, they are they basically the one which is causing, they are the rhizopus, mucor, and all those things. Mucor. So they have the most commonly the affect the one affecting the it cause orbitocerebral cerebral infection, fungal infection. It causes black color, no, necrotic infection, necrotizing infection, black, everything goes gangrenous and black. That's the one. Okay, so that's done. Next one. Look at this question. This is everybody's favorite question. Look at the child. Okay, a 3-year-old child brought to clinic with erythematous rash on the cheek. Rash on the cheek. Okay, someone must have slapped. Okay, someone must have slapped. Okay, on the trunks and limb. Has a low grade fever, headache and respiratory infection, etc. The suspected organism contains single stranded DNA. That is more than enough. You know that. Once again, to talk about the DNA viruses, I don't go. So when you talk about DNA viruses, it is called DNA virus, a happy virus. The shortcut is we call HHAPPPY. You know, H for the herpes virus group, and another for hepatitis B virus, A for adenovirus, and then we have parvovirus, and then we have papilloma virus, and then we have pox virus. Here, all of them are double-stranded DNA. Only paru is a single-stranded DNA. So now how to know her story? Okay, if you want to know us. Okay, we didn't have that picture. Oh, here it is. Look at this. Oh, see, this is this picture. Before going to that question, this is the zygomycosis. Zygomycosis or mucormycosis. It spreads like very fast. It's called rapid spreader. You know, it spreads very rapid growth. Sometimes they call lid lifters. The grows, it just even the lid comes out. The lid cover also will come out. Okay, rapid growth. So see, invasive. It's an angio-invasive, so it goes deep into the brain and becomes very, very dangerous. So this type of picture comes. See, this is our mucormycosis, how it looks like, wide angle. Okay, that's all. So this is our paru. Look at her. You know very well paru. Where you can't forget paru. Paru is our choti paru. You know that paru from our Devdas movie. Devdas movie, you know very well. Just everybody knows. Okay, just a clue only. She's a single lady, so frustrated. That's what happens. She slaps the child. She slaps with her five finger to the child. Okay, and then later on what happened, she herself get her child with many diseases. You know what disease she get? One, she get non-immune hydrops fetalis she gets, and other one is that they get this uh, pure red cell aplasia and also aplastic crisis. These are the diseases they are getting. Poor her, because of slapping the children, God has given her all these diseases. Okay, this was a clue only. So she is single. That's what we say, single stranded DNA virus. Why we say this word? Slapped five cheek appearance, because the disease name itself is called slapped cheek appearance. That is called fifth day disease. Fifth day disease, slapped cheek appearance. Otherwise called erythema infectiosum. Infectiosum. Number 5 is the infectiosum. Okay, that's all. And these are the other diseases caused. So paru you will never ever forget. And remember, she's a small paru. She's a small girl, a small paru, because smallest virus. This is the smallest virus. Remember, paru is a choti paru. That's what people call her in Hindi. Choti paru. Okay, choti paru. So this is she has all these things problem. Poor hair. Okay. So now let's go to the disease. So which is most likely there? What is the diagnosis? So you saw all the clue was given. So this is scarlet fever? No, scarlet fever is Streptococcus pyogenes, the strawberry tongue. Okay, that's not our problem. Erythema infection? Yes, that is what we're talking. I told erythema infection because Hep means five. Fifth day disease, that is your parvovirus. So classic example. Okay, and exanthema subitum and roseola, these two are caused by herpes virus, human herpes virus 6. This is sorry. Subitum is caused by 6 and 7. Your rubeola is basically it's the measles. So that is also not caused this one. It's totally different. Okay. So it's not even legal. So when you talk about DNA viruses, the only thing which is causing is your erythema infectiosum. So remember that. Okay. HHV 6 and 7 causes exanthema subitum. S is there. So it is 6 and 7. 6, 7. So it is totally different. 6, 7. But only this one. So your erythema infectiosum or fifth day disease or slapped cheek appearance. It's characteristic for your parvo, paru, paru, paru. Don't forget it. Okay. That's what I made this picture and written it. So please, please, please remember. See, she's slapping the child with 5 and then erythema infectiosum. Okay. That's all. 15. Next question. Next question, look at this, another beautiful question. Here, a child presents with a complaint of perianal itching, okay, predominantly night, disturbs the sleep. Eggs of the causative agent has shown in the pH. Okay, very first statement. Okay, okay, okay. Everything is this and all, you know, this and all like fingertips last moment. So perianal itching night. So what is your diagnosis? What you're going to think? When this type of things comes, automatically your mind is thinking, what happened when the perianal night comes, the child will call what? He'll call help. So he will call Didi, right? He will call Didi. He'll call the sister instead of mother. He'll call Didi. Okay. So Didi egg. So this is like this, right? This. So this is a plano, one side plane, other side convex. Plano convex egg. Okay. So when you have a plano convex egg, Didi is coming. All these things comes. This is basically your enterobios vermicularis. Enterobios. Okay. I'm going to write it as enterobios vermicularis. Not a full name you needed. Enterobios, or we also call it as. Also we call it as thin, this called we call it as a thread worm, thread or pin, or even seat worm. Seat worm. Okay, these are the other names. All are important. Okay, because you have something to differentiate. False statement. They asked for false statement. NIH swab used to call some definitely yes, National Institute of Health Lab. This is a special swab with a bottle and there's a close. You can take it, roll it, and take it like that. Auto infection definitely common. Yes, this was right. Auto infection, you know, auto infection. The parasite which is causing auto infection shortcut is just auto goes inside the chest. Remember, auto goes into the chest. So CHEST. You have to know this very important question. C for cryptosporidium, the most common cause of diarrhea in HIV patient. H for H-nana, H-nana not that much significant. E is this enterobius, which we are talking now, enterobius, thin worm, red worm. S for strongyloides, stercoralis, which causing larva, currents, and etc. Dangerous one, my favorite one. And T is the tinea, but tinea, which one? Cysticercosis. Cysticercosis, the egg get, auto ingestion, right? That auto infection. So these are the things you have to remember. TAE, tenia. Okay, these are the autoinfections. So enterobius is coming there, so it is a tick mark. Whipworm, let's wait for whipworm. Adult worm remains in cecum. Definitely, adult worm, they remain there. At night time, the female comes nicely, come to the perineal region, lays her egg, and again goes back. And poor child is itching, crashing whole night, is crying and calling the. Okay, poor him. So that's what planoconvex exander. This is really easy. You will not make any mistake. Now, whipworm. Why is a whipworm? Whipworm, no. Why you have to take whipworm? Is not, yeah, this is wrong. You call it as threadworm, pinworm, seatworm. A whipworm is basically Trichuris trichuria. You try to break the eggshell with the whip. Okay, try to break a coconut shell, because coconut rectum is common there in Trichuris trichuria. And one more thing is this: what it is? It's a barrel shape. You use a barrel or a whip. Use a barrel or a whip to break the coconut. That's all. Okay, Trichuris trichuria. This is a nematode, totally different story, right? See, we covered now Trichuris trichuria also. This also. So in Trichuris the egg is like this. You see, it looks like a barrel. And the babies, if you see this rectum, because of the rectal prolapse, it took a coconut shell. This is all for I'm talking about Trichuris trichoria. Okay, so this egg is like this, barrel shaped, barrel or dumbbell shaped. Okay, that's all. I'm going to finish. Okay. Yes. Now the next question. Look at the another next beautiful question. So here the next question is. Yes, look at here. This is a 6-year-old boy presented with lower abdominal pain and diarrhea. Fine. In stool examination, something was shown, which is false. Okay, seeing this stool, I'll be so happy and glad because look at this. This is some trophozoite. This is some trophozoite. Okay, it has a trophozoite. What I'm seeing inside the trophozoite, I'm seeing the beautiful RBCs. I'm seeing multiple RBCs there. I'm going to see a multiple RBCs. Many RBCs are here and there. Okay, that means it has caused erythrophagocytosis. Erythrophagocytosis. Someone has eaten the phagocytosis. So that's some trophozoite using egg. And of course, this is a karyotype nucleus of the toxin. We are not interested. So I'm seeing RBC. This is, if I see this, the only thing that comes into my mind is which one I'm going to think about. Which one? Entamoeba histolytica. Entamoeba histolytica. That is basically amebiosis. Okay. Now you know the characteristic. Okay. Now see, which is false. Causes flash shaped. Of course, yes, it causes a flash shaped ulcer. Entomoeba, you see this picture here. This is this flash shaped ulcer. It's caused by your Entomoeba histolytica ulcer. Okay, flask shaped. But if there's something called longitudinal ulcer, if you see longitudinal, this is a flask ulcer. Flask ulcer, flask shaped ulcer. But if a longitudinal ulcer comes, you're going to think about which one. This is again more a patho, but nothing wrong with discussing. A longitudinal ulcer is usually caused by your Salmonella typhi. Okay, but this the flask shaped ulcer is caused by endometriotica. So this is right answer. Liver abscess common. Of course, it's right. And what is this liver abscess called? Anchovy sauce. Anchovy sauce. And anchovy sauce. This is caused as anchovy or chocolate like chocolate anchovy abscess, anchovy like sauce, anchovy sauce abscess or anchovy abscess, whatever it is. Common one. Infective stage is quadrinucleate cyst. Definitely yes. Cyst is the infective stage. Okay. Yes. The fat malabsorption is common. Oh, oops, not at all. The fat malabsorption means the only thing which has to come. Who gets this fatty malabsorption or steatorrhea? Person who's eating what? Which vegetable? Gia. Okay, Giardia lamblia. Giardia, remember, when you eat a gia, that big vegetable, the tube-like vegetable, everyone hates it. I like it. Some people hates it. So when you put it inside your mouth, what you get? You get a steatorrhea. You get, like, it's just for remembrance. Okay, nothing serious. You just have to remember like that. Okay, so it'll be very easier. Okay, Giardia lamblia. That's the thing. Okay. Now, this is an NIH swab. Okay. This is a typical NIH swab for Enterobacter vermicularis. I just wrote the picture to show you. It just look like this. They give identify means you don't get confused. It should have this rubber stopper and a special glass rod with a cellotape in the end and all. So it's NH for Enterobacter vermicularis. Okay. So that's all. So your diagnosis fast GRDS fat malabsorption. Okay. We have question GRD also. Don't worry. This is that anchovy sauce. This liver abscess, amoebic abscess. Amoebic abscess, which is showing what? Your anchovy sauce, which shows you typical anchovy sauce. Anchovy sauce like appearance. Very, very simple. Okay, that's all. Now, next question. Now, look at this question. Now, here, a truck driver came with a complaint of painless indurated genital ulcer after unsafe intercourse, common with truck drivers. Which of the following is a non-treponemal specific test? Okay, first of all, this question, look at the diagnosis. It's painless and indurated genital ulcer. Okay, and now here they're more talking about a syphilis type. Okay, so it's just a syphilis. Basically, it's a syphilis. So, syphilis, you know that in syphilis, we classify them into, we have two tests, non-specific, that is basically screening, and specific tests. Specific tests are basically treponemal test. Okay, treponemal tests we have. So in that, if you see non-specific, the most commonly used are VDRL and RPR. Okay, RPR. Both are precipitation slide, we call it a slide flocculation test or precipitation test, slide flocculation test. Oh, you know about that. Best VDRL, and VDRL again very good for even the neurosyphilis. But overall, both are helpful for which one? For your screening. It is used for the screening and treatment prognosis. Screening and treatment prognosis. You know that very, very well. This is very, very important question. You know, repeatedly asked. Special test means there should be always this word treponema. T should be added. So what are they? One is your treponema pallidum immobilization test. Other one is your TPH, treponema pallidum hemagglutination test. Other one is your FTA TT. See, everywhere there's a T is there. T should be there. FDA, ABS. Other one is TPPA also is there. Okay. So idea is, remember, everywhere you have this TP. Oh. Everywhere you have this T, 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 T. That's what. So TT is there, so it's treponema. These two are not. So simple question. So which is not treponema? They ask which is not a treponema test. So I'm going to think about everywhere TT is there. This all are right. So which is not treponema? RPR. RPR and VDRL, they are not testing. So that's the right answer. Okay, finished. Very, very simple. Now next question. Okay, this is very, very easy. You can't make any mistake in this question. Duffy antigen. Duffy antigen serves as a receptor. I told you Who is Mr. Vivek? Vivek has two girlfriends. Vivek, Plasmodium, Vivax is Vivek. Vivek is such a sexy guy. He's a big RBC. He affects, he's young, on it because I already told you a lot of things about them. He's a young RBC, he's a very young guy, so he attacks young RBCs. So that means RBC size increased, RBC size increased. He always says to everyone that he's a single because he has a single ring. Unfortunately, not unfortunately, fortunately, he has two girlfriends. One is a Daffy, because Daffy helps in entry, another one is a Sharpness. Schaffner, SCH, spelling, 1 second. Yeah. Sharpness, okay? Sharpness dot also. Sharpness dot. I think some small spelling mistake. It's okay. Don't mind it. Duffy and Sharpna. Okay. I remember. You remember it as SHASCFNA. Sharpna. Okay. Sharpness dot. That's all. Okay. Sharpness dot Duffy. These all are for your plasmodium. And of course, relapse. Relapse means you think about Vivax and your this thing. Ovale. Okay. That's all. Very, very simple. So your answer is Vivax. That's all done. Okay. Next. Okay. We're just hurrying the ideas because this is a revision class. You already know, just, brainwash, put here and there, whatever you're missing. That's all. Okay. Investigation of choice for follow-up of the patient with anti-H. pylori drug. So, H. pylori, H. pylori means that's the one which is causing the gastric. When you talk about H. pylori, I'm not going to talk everything there. You know that this is one of the things that is causing the gastric. This is one of the things that's causing the gastric ulcer, gastric carcinoma, also duodenal adenoma, and important is maltoma. Maltoma is many times repeated question. That's what I'm writing it here. Maltoma. Okay, maltoma. That's all. These are three diseases. When we talk about the diagnosis, the most common and very easy one is your urease breath test. So that is not only for this thing, it's easy to do, not for prognosis also it's important, for follow-up also, and it's the best screening, for best screening test. But gold standard is your rapid urease, which is invasive. So that's what we are not using it for follow-up and all. So best for follow-up is this one. The urease breath is the best one. The stool antigen here, you all can be done, but they're just not specific. So the best for follow-up is urease breath. From urea, you will take this capsule and see how much of urea is coming out. That is the one they're measuring. The carbons are measured, and then accordingly we say it's working or not. That only. Okay, that's the thing you remember. I follow it. Excuse me. Yeah. So that's all. This is the one you want to remember in H. pylori. Okay, next. What is the marker in the window period HPV infection? Yes, very, very important question. So, okay. So before that, you should, when you talk HB infection, you have to know because it's very, 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 very important. So we will sort of quick revise this HPV infection. You know very well. I'm not going to this thing. Only just, you should know with thoroughly. So people who know, then not a problem. But who doesn't know, I'm teaching in 5 minutes. I will finish everything for you in hepatitis. Hepatitis we have got Danny particle. You remember, it's a Danny particle. So there are few antigen, few antibodies which are very important. First one is your HBs AG, and we have anti-HBs. Anti-HBs. Okay. And then second one, we have HBe antigen, and then we have anti-HBe antibody. Anti-HBe antibody. Okay. And then we have HBc core antigen, and then we have anti-HBc antibody. Okay. One is good, one is bad. Something like that. Okay. Now remember that when your S is there, remember you simply say yes or no. Simply say yes or no. That means, and sir, this is basically an Australian antigen. HBsAg is an Australian antigen. That's also a question. So whether if the HBs antigen is there means just simply infection is positive. We don't know acute chronic, just infection positive. But if already antibody formed means no infection, recovery, or vaccinated. It is basically recovery or vaccinated. That's all. Okay. The infection is decreased or infection is gone. So recovery or vaccinated. That is first point. Remember. Okay. You simply say yes or no. For yes or no. For yes, you say yes or no. E, remember, E is always an enemy. E means enemy. E is enemy or evil. So all bad things, all bad things will come with E only. What are the bad things? High replication. Virulence is high. Pathogenicity is high. Got it? Replication, virulence, pathology, everything is high. When antibody is already formed, everything goes down. Everything goes down. Okay, virulence, pathogenicity, everything goes down, down, down. Very simple. Now, E means enemy, bad, evil. So replication, virulence, pathology, all multiplication, whatever comes, okay, everything are bad. Okay, prognosis bad, even prognosis, everything we prognosis, okay, prognosis also. Also, the bad prognosis, bad prognosis. If it is come down, then prognosis is good. What about C? C means it tells the disease is simply acute or chronic. Acute or chronic. C means chronicity. It tells about the chronicity. But unfortunately, no use. HBS antigen is no use because it's very inside. It will take so much time to come out. So it's no use. So anti-HBC antibody has a role. Either it is IgM or IgG. IgM means, acute infection. It says acute infection. IgG means it says chronic infection. This is common for every infection. You know very well. G means chronic. M means acute. Okay, right. Very, very, very important thing this asked is this are not fine. In window period, in the window, sorry, in the window period, which is very important means in window period, the most important one is your IgM or okay. W is looking like M. So IgM is the important marker in the window period. That's the thing which we have to talk. That's what they asked here. So in window period, the marker is simply W is looking like M. So it is HBC IgM antibody. Very, very simple. Which is also says it's an acute infection, which says that it's acute infection. Also, it is a marker in window period. Finished. This much only. This HBV may any question come, you will write it based on this. Yes means yes or no. Antigen means yes. Antibody means no infection. E means enemy. E antigen means everything is high, 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 dangerous. If it antibody form, everything is low, low, low. C is useless, but its antibody is IgM and IgG significance. M means acute. G means chronic. And M also means window period. That much only. Have you have to worry for this? I don't think so. Okay, that's all. Again, remember one question may be in this. If vaccinated means how much titer should be, the HBS antibody should be more than 10. Just remember the value more than 10 international unit of what value, that's not important. Just 10. Okay. If we call it as a Danny particle and Australian antigen. HBS is also called Australian antigen. That's all. Very, 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 very important. Okay. So this is the picture. So this is the window period. You see in this window period, you're seeing IG, this one, HPC, IgM is the main marker. Okay. In starting and all, see, in starting and all, when the best starting, of course, you do PCR is the best. In initial incubation period, nothing has rise. So the best thing to do for any disease, PCR. Even for HIV also in incubation period, you can't detect antigen antibody. They are taking time to come out. So in that cases, what you have to do is you do a PCR and identify the protein, okay, whatever, or that antigen which is going to rise there. Okay, that's all. So this is a hepatitis. Now next question again, another very nice question. Look at this. Here it says brucellosis. Brucella, Brucella means I always think about only one thing. See, I always say my students also, Bruce Lee. Whenever you think about this one, you think only Brucella comes. I tell them to remember Bruce Lee. Bruce Lee, the Chinese actor, very popular one, right? So Bruce Lee is famous. He's a very good actor. So it means his famous place, he likes Malta, Mediterranean, and Uganda. Uganda is his favorite place. Huh? He likes animals, so zoonotic. He likes animals, so it's zoonotic. Okay, other thing. Okay, this is a very common one. So these are the Bruce Lee. A few things you should know. Like there's also he likes milk. He tries to like Bengal milk. He likes the Bengal milk. Whey protein. So many things are there, and most important, he has satellite. He has very important satellite in his home. Okay, it's very rich, so he's having satellite. So why I say all this Malta, Mediterranean, Woodland? Because these are the fevers they are causing. Malta, because it's Malta fever. It causes Malta fever. Mediterranean fever. Uganda, undulant fever. It causes undulant fever. Okay. And the disease is non-specific only and it's intracellular parasite. Okay, now you see brucella. Fever is undulating pattern. Yes, right. That is right. That is the first question. Two regarding brucellosis. Okay, it's right answer. Musculoskeletal system, definitely it causes a lot of joint pain, joint pain, fever, joint pain, lymphadenopathy, all these things are common. Okay, fine. Brucella is a facultative intracellular. That is also right. It is an intracellular pathogen. So all are right. Okay, that's a brucella. The most important thing I would stress here is SAT test. SAT is a standard agglutination test. That's what Bruce Lee has a satellite. Remember, Bruce Lee has a satellite. Brucella, excuse me, Bruce Lee has a satellite. This you have to remember. Okay, that's all. Sat. Yeah, but of course, there's something else also we are missing. Satellite, we have a satellitism. That is different bacteria. Okay. Satellitism is by H influenza, Haemophilus influenza bacteria. Okay. Haemophilus influenza. Okay, which cause satellitism. That's the hemophil. Okay, that's what, we'll talk it when that question comes. Okay, or maybe it's not, but just we are revising it. No problem. Next one, the treatment of pregnant lady exposed to chicken pox patient. Chicken pox. Okay, so pregnant lady. Pregnant lady means what? Pregnant lady means you have to get a clue which vaccine. You can't give them what? You can't give them no live vaccine. That is the concept. No live vaccine for a pregnant ladies. So, what is the chickenpox vaccine called? That's also a question. If you remember, chickenpox vaccine is okay. When you eat a delicious chicken biryani, you'll say okay, right? Okay. Okay is a live vaccine, live chickenpox vaccine. So you don't give it. So if a pregnant lady is exposed to chickenpox, ideally you will be giving only the immunoglobulin and acyclovir. So varicose zoster, IG and varicose. This is right. You never give vaccine, no this thing, only acyclovir, not enough. So you have to give this one. Okay. Here is this question. If baby already got infection, that is varicella congenital infection, what are the classic symptoms? You know that one. That's also for first few years, I don't see question from here, but the characteristic lesion is limb hypoplasia. Limb hypoplasia, very characteristic for this varicella disease. Also, psychiatrical or cicatrizing skin lesion. Scar, basically it's a scar lesion. Scars are formed. Okay, scar lesions are there. These are two important things used in a varicella congenital infection. And you know that if the delivery is 5 days before delivery and 2 days after, then again that is the child is more prone to get the infection. Okay, you get a herpes zoster infection. This is congenital. You have limb hypoplasia, cicatricial skin lesions. Okay, that's all. Now, which infection is not transmitted by Aedes mosquito? Okay, Aedes mosquito. So they say which is not transmitted by Aedes mosquito. Aedes is otherwise called, okay, Aedes is otherwise called tiger mosquito. Tiger or Aedes. Okay, our popular actor, Tiger or Addy, actors you remember, they get all the fevers. Which fever? Dengue fever? Yes. Zika fever? Yes. Yellow fever? Yes. West Nile? No. Except West Nile. Not West Nile. Why? Because West Nile is caused by Culex. How to remember Culex? Culex means coolie. Remember like a coolies. Okay? Coolie piece. Coolies means the poor guys, who really suffer a lot. Coolies, they live in, first of all, in Japan. Japanese encephalitis. They live in West Nile. West Nile fever. West Nile encephalitis. And coolies, they work a lot. And so they get what? Elephantiasis. It's not a viral, it's a parasite, but still. Filariasis, no? Elephantiasis. So these are, when it comes coolie, three organisms you have to remember. You have to remember. Coolies live in Japan. Coolies live in West Nile. Coolies get elephantiasis. Because Culex mosquito is a conservation for your elephant is also, though everything can cause, but it's the most common one. Okay. So this is important. Don't forget. And rest for tiger, all the fever. Your dengue fever, your Zika fever, your yellow fever, and also chikungunya. Chikungunya fever also comes. Okay. So these are 4 fevers that is caused by your Aedes mosquito. Very important. Okay. That's all. Next. Next. Yeah. And then look at this question. Again, I think same. You repeat it again. Yeah. That's okay. It's like a double revision now. So here a 65-year-old patient on immunosuppressive therapy, he developed cough symptom pneumonitis on biophilic basophilic granulosa. So basophilic granulosa is this only. So it is basically your, again and again repeated, it's your cytomegalovirus. Okay. So it's important. The idea is CM, every CMs they have in their house, they have owl. That's it. Owl like inclusion bodies. Okay. Owl is there. CM house, there is owl. Finished. Okay. That's all. Now, yeah, this is another very important and commonly asked question. So you see a CD count here goes less than 350. They are present with the following symptom. First of all, when the CD count is going less than 350 in HIV patient, there's no clue, but you have to remember what are the organisms, very infections are common in HIV patient. CD for less than 50 means first one is your Mycobacterium tuberculosis, you should remember. Then you have to remember your candidiasis, and then you have to remember your herpes zoster virus, that's shingles, no, I told that one. And then another important thing is your Kaposi sarcoma. These are the four important, very important issues. No. Now let's see here. This is so something is here. So you must have already got a clue. You see, this is a bluish, this blue color, sort of vascular tumor. This is a blue vascular tumor. So blue vascular tumor, or simply the most common cause of tumor in HIV patient is your Kaposi sarcoma. And when Kaposi sarcoma comes, they didn't give it the word. They call which virus cause it. So it is basically HHV. If it's a K is like this, if you can want to alter, no, you can make like this, no, K, you can make it like 8. So HHV 8. Okay, very simple. And another one, figure of 8 when they ask, that is your blastomycosis. Don't forget. One is Kaposi, K, you can make 8. Other one is your blastomycosis, which is broad-shaped, broad-based budding cells. Okay, that's all. So two eights. Remember, 8 is how important in our this thing. There are other 8s also. We'll see. If we have time, we'll discuss. Okay, a patient with history of TB developed hemoptysis. Chest X-ray shows this. Now, what you're going to identify. Now, here, look at this picture. Here you can see TB, hemoptysis, chest X-ray shown. So already you can see here, there's a space. Some space is formed here. You know, this space is here. Something is here. So now what is that? Usually that is a ball-like appearance. No? So in old TB cavity, something is formed that is basically your aspergilloma. This is direct, straightforward questions. Okay. This is more radiology, but then this was asked repeatedly. That's what I'm saying here. Aspergilloma, like a ball-like appearance is there. So this thing. Okay. And then you know aspergillus, I already told you, it's a acute angled septate hyphae. Acute and septate hyphae should be there. Septate hyphae should be there. That's all. I'm not going to stress anything else here. That's all. Next one. 40-year-old patient with symptom of, look at this patient. He has a symptom of fatigue and weakness. An investigation showed low hemoglobin and low reticulocyte, but your WBC and platelets are normal. Only low hemoglobin and reticulocyte is there. So what is the causative agent? So first of all, aplastic anemia parvoviruses, no. In aplastic, everything should go away. The WBC plate, everything should come away. So that is not. Pure red cell aplasia by parvo, it's very likely because here only you're talking about RBC is here. So it is this is the most likely. Okay, this is more one we can wait. Iron deficiency anemia can cause, but by Giardia, no. In Giardia, we usually have malabsorption, not iron deficiency. We have there steatoria, fat malabsorption. Yeah, steatoria we have. So that is not out. Okay, that is out. Now, megaloblastic endophlebitism, yes, but not this picture. It's a megaloblastic is a vitamin B12 deficiency, vitamin B12 deficiency caused by this one. So that's also out. So even aplastic can little bit more similar, but excuse me, but this is more, it will correlate to pure red cell aplasia parvovirus. Moreover, the adult patient, pure red cell aplasia more for adult patient. Aplastic anemia more for a children's only it should come. So based on the age factor and this thing, if you see pure red cell hyper, it's again more a medicine related, but because the word parvovirus we already talked, that's what I'm saying. So aplastic anemia parvo, these are right, but here this for this age and this factor, we'll go with pure red cell aplasia parvovirus. That's all. Okay. Yes. Now on lymph node biopsy, again here on a lymph node biopsy, you see that the catalytic beta-causing. So this is something you see. This is something. Look at this picture. No, something. It looks like a caseous necrosis. This from a lymph node biopsy. Caseous. Identify the casting. So that is very catalytic for the caseous necrosis. Again, is a pathology, but who causes this? This causes by a microbe. That is your Mycobacterium tuberculosis. Okay, now Mycobacterium tuberculosis, they grow in the food pad of mice? Absolutely not. This is by Mycobacterium leprae. Okay, they are acid fast, decolorizes 25% sulfuric. Yes, this is right answer. This is Mycobacterium TB. Of course, it's an acid fast stain, a Zeal-Nielsen stain. So Mycobacterium TB grows in very well. Gives hefty ABS positive? No, that is syphilis. Syphilis will not have This one, it's not a syphilis picture. Will flakes with voice, but scrub typhus? No. Is it scrub typhus? No, it is also not. So your answer is this one. It's very indirectly they have asked. So TB means acid fast and 20% H2SO4. So when you talk 20% H2SO4, then we have other percentage also we need to discuss about this. We use 5% H2SO4 in acid fast stain. Let's start with 25%, 5%, 1%, 0.5%, right? These all are important question. So 25% H2SO4, if you talk, that is your microbiome TB, the best one, the main one. 5%, 5, the totally LEPRA. Lepra has only 5 letters. So it is Mycobacterium leprae. Leprae. Okay, yes. 1% for many, for all your acid fast parasites. Acid fast parasite like which one? Cryptosporidium, not Cryptococcus, Cryptosporidium, Isospora, cyclospora. Okay, and some of the your Tinea saginetacus, the proglottids, and then your hydatids, hooklets. There are few, but this is mainly, and of course your nocardia also. Nocardia or 1%. 0.5%. It's like a 5, no? So it's spores and sperm head. That's all. Very simple. Okay. If the H2SO4 question is important, that's what we are talking about it. Okay, nice. Next one is your another important disease. Now, somewhat an immunology question also very important. See, in which disease, in which one of the following primary lymphoid organ is hypoplastic? Okay, they are said that primary lymphoid. When you talk about primary lymphoid organ, only 2 organs should come in your mind. What are they? One is your thymus. Other one is your bone marrow. I think first I should write thymus, bone marrow, and then thymus. So first one is your bone marrow, other one is your thymus. So here, just in which this one is going. So you know that when it's bone marrow, it is for, you know that bone marrow is birth of B and T cell and just B cell maturation. Only T for T, so T cell maturation, not the birth, the maturation. Okay, that we know. Now, in this disease, Guillain-Barré, no any link, that is with the ascending paralysis. Rheumatic fever, so post-streptococcal, it's a streptococcal pyogenes autoimmune disease. Microbiome tubin, nothing. So, only thing is DiGeorge syndrome. Why DiGeorge syndrome? Which organ is absent here? Thymoma. So, that's what in DiGeorge syndrome, the shortcut is catch. If you remember, it is basically catch 22. So, C for, you know that we have a cleft palate. More try to fast cleft palate. A for abnormal face, you know, abnormal face. T for, I think you are repeating with me, that's the easy way. Okay, thymus dysplasia, and then C for you have the cardiac defect, especially which type of cardiac defect you're talking about, tetralogy of Fallot we're talking, and H for hypocalcemia because of PTH, parathyroid hormone is less. That's what. Okay, and then 22 is your chromosome 22 is short term. So Q11. Okay, short term Q11, 22. Very simple. So now here, very important, that's what. So your thymus is missing, and then your parathyroid is missing. Basically, third and fourth pharyngeal pouches are out. Third pharyngeal pouch is missing. That's all. Okay. So indirectly, J-George syndrome, primary lymphoid organ, thymus is missing. Okay, that's all. Okay. Not thyroid. We have parathyroid and thymus gland affected, but not thyroid gland. Okay, that's important. Yes, another important question again. Look at this. HIV patient comes with a pneumonia symptom. Okay, chest X-ray, bilateral infiltrate. Fine. Somewhat bilateral infiltrate is there. Okay, we use some pneumonia like Gomori methylamine silvestrate. Yes, that's enough. Gomori methylamine means itself, you know, that is basically, it gives us black color. So you see black color. This is the typical, you see, these are the trophozoites. Okay, how it looks. So this is basically a ping pong appearance. You call ping pong. So the idea is this is a pneumocystis zero vichy. Okay, pneumocystis zero vichy. So whatever you're seeing, this is a ping pong appearance. Okay, so CD4 less than 200, yes, definitely, because under 200, you can either 100, 200, you get what? Cryptococcus, Cryptosporidium, two cryptos will come, Cryptosporidium, also pneumocystis, Toxoplasma, and your pneumocystis and Toxoplasma. That's it. These are the things very, very common Commonly comes. So this is a right answer. So they said false statement. Prophos that appear pink ball appear definitely. These are the pink ball. P for pneumocystis, P for pink ball appearance. However you want to remember, both are fine. Okay. Severe pneumonia, yes, that is also right. It is an HIV patient cause very severe pneumonia. Dimorphic fungi, no, 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 no. It is not. You already said. We also said dimorphic means hit, blast, cock, paracock, spot, and pen. So in that category, it's not coming. So it's not a dimorphic fungi. So that's what dimorphic fungi you have to remember. Okay. So this is basically a type of HIV patient, pneumocystis cerevisiae, very, very common. That's what it causes this infections. Okay. Next, which among the following is used to sterilize? This was another very nice question. Glass petri dish. So it's a glass, anything glass. Okay. So yeah, before going to that, yes, I'll give you a clue how to remember. Anything glassy, anything powdery, anything liquidy, anything sharpie. What is this? Okay, you know this. You guys must have seen it before also. My other class, all the glassware, any glassware like petri dish also glassware only. So any glassware, flask, glass, anything glassware, powdery because this is a gloves dusting powder, gloves powder. No, dust not the gloves itself. It's the powder. Okay, and liquid paraffin, sharp surgical instrument, These are the four things you have to put in hot air oven. Hot air oven. Okay. Other things and all plastic plastics you put will go away. Okay. Anything rubbery, plastic, those will go to autoclave. Okay. So now you have to say the hot air oven ka exact temperature. Hot air temperature is 160. The autoclave 121, 360. No, this is the wrong. Temperature is wrong. It doesn't work like that. Hot air oven 160, 120 minutes. Yes, that is the right. If you compare here, this is the right answer. Autoclave 134, no, wrong. Hot air 127, no, we don't have this. These are all not the right things. Okay. So the ideal one is your hot air oven 160 degree for 120. That is usually it is 1 to 2 hours. Usually 1 hour is sufficient. Again, depends on the thing. Okay. So these hot air oven means all these things. But for your autoclave, when you go for autoclave, which is usually 121 degrees Celsius for 15 minutes, 15 pressure, 15 pascals pressure. That's 15. Okay. 15 is 15 actually. Okay. Okay. Now here, what you do here are the non-sharp instruments, non-sharp surgical instruments, all the culture media, and anything rubber and plastic. Remember, last time they asked micropipette, they've asked micropipette will go in this only. Okay, so those things, non-sharp instrument, culture medias, rubber, plastic items, all will go in the autoclave. Other things, the hard glassware, powder, liquid paraffin, they all will go in this, because you can't put a powder in autoclave because it's a steam. No, it will get wet and it will go away. Same way in your liquid paraffin, it will not penetrate it. So these are the things. Okay, that's all. So now next is, yeah, another very, very important question again. Here, AIDS patient positive. AIDS positive, that's HIV positive is AIDS patient. History of fever, vomiting, meningeal symptoms. Which of the following tests help in a rapid diagnosis? Okay, now when HIV patient comes with many HIV plus meningitis symptom, this combo comes. What strikes in your mind when HIV plus meningitis combo comes? It is basically caused by most common cause of meningitis HIV is your cryptococcus. You know very well about the cryptococcus. I no need to say. If you want shortly, we can a brief discussion. It is coming from the pigeon droplets. Okay, the primary organ is usually lung, but when it gets disseminated, the second there's a complication disseminated, it will go and cause the meningitis. Okay, it causes meningitis in the brain. Okay, it causes. So this is a common feature of cryptococcus, and you remember this is the only capsulated. This is the only capsulated fungi. There are few, but for us important is only cryptococcus, only capsulated C fungi. Okay, that's very important. So the identification of capsule is very, very important here. That's all. This is the main thing for cryptococcus neoformans you should know. So Indian ink preparation of CS, it's a rapid test. See, this Indian ink preparation is we can do. That is also right test. Blood culture, not that significant. Very rarely you can. CSF culture, definitely. We do it in the bird seed agar. Bird seed or Niger seed, we call Niger seed or bird seed, we grow it. ST definitely, and even CSF we grow. Excuse. And it's also it's a pure yeast. Okay, this is Cryptococcus, a pure yeast also. But they also they need immediate test. For immediate rapid test, you have to do latex agglutination. You're detecting the antigen or antibody of the mainly it's detecting the anti-cryptococcal antigen latex agglutination is the best rapid test. Okay, so rest all are right, not wrong. Even Indian ink is for capsule, or Indian ink is a negative stain for capsule. You can do all, but ideally the best is this only. Okay, that's all. This is the one we have to stress here. Now look at next question. All again important questions here. Here, to a 54-year-old farmer from Ohio, he came to the physician with a chronic cough, lung symptom. Ohio is a clue. X-ray showed hilar lymphadenopathy, fine. And biopsy of mass taken, staining lactophenol cotton blue showed, LPCB they did, and then they showed multiple tiny yeast forms, within macrophage. So ideally, this is the picture. This is the picture you can see here. You see inside, you can see this inside, there is this thing. So if you exactly write it, inside the macrophage, you see like this, figure of 8 like this. Tiny, very, very tiny. Okay. These are the things, whatever you're seeing here inside the macrophage, all these things. Okay. They all are like this. Now, what to do? Now, what to do? So this is basically when you get this type of picture, Ohio is one clue and tiny inside macrophage is characteristic for your histoplasmosis. Histoplasmosis. So I will talk about that. So the answer is you got it. Now that means we have to go and do all the dimorphic fungi. So when I say dimorphic fungi, see this is a cryptococcus. This is not a dimorphic. This is just simply crypto to show you the cryptococcus. Cryptococcus. Okay. So the capsule is there. This is an Indian ink stain. You saw the cryptococcus. Okay, that's out now, which we don't need. Now we need all our dimorphic fungi thoroughly. You should know thoroughly. You can't enter the examination hall without knowing a dimorphic fungi. One or two question always it's there. So first dimorphic. First I told hit. So it is histoplasma. Histoplasma capsulatum. Capsulatum is the name, but there is no capsule. Capsulatum. That's not a real capsule. Okay, remember that's not real capsule. So hit, in hit we have histoplasma. Next is blast. I told dimorphic you will do all bad thing blast. So blastomyces dermatitis. Okay, blastomyces is enough. Histoplasma, blastocyst. Okay, this is first one. This is your second one, and then this is third one. I told you how to do cock. Dangerous one. With a gun, you do a cock. Coccidiomyces immitis. Coccidiomyces immitis. You remember coccidios. That's enough. Next. Paracock. Cock and then paracock. Two. Paracock. That is your paracoccidiosis. 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 Okay. Yes. Next. Then the last one is your pen. Pen means penicillium or maro. Kisi ko maro. Okay. Okay. You can read talo also. Okay. That's fine. Okay. I'll go with talo. It's not going to confuse you guys. Go talo. Tallow pen. Okay. Because cause for Talaromyces marnifi. Marnifi. Oh, you're going to kill someone. No, marnifi. All dangerous one I told. Five. So we got all five. One is porothrix is already gone there, so I'm not going to add it here. Okay, we already spoke out porothrix. Now look at the pictures very, very carefully. Histoplasma capsulatum. First of all, everything is like a TB here. It looks like a TB. Histo means TB. How to remember? In Ohio cave, Darling was, Ohio cave, there is this darling, the guy was hitting his darling with kisses, he was hitting her, and then he ended up getting a TB, okay, because there was a bat in the cave, there was a bat in the cave. So it is spreading by the bat is one thing. Look, everything is TB here. So you get two important things here. Tuberculate conidia. Other one is look at this one, tiny budding yeast cell, tiny budding yeast cell inside macrophage, intracellular. That is very, very important. Budding yeast cell, intracellular, and tuberculate conidia. So TB. It's almost like a TB. Okay. Other disease is called Ohio disease, caves disease, or Darling disease. All are important. So Ohio inside the cave, Darling got hit. So hit by what? TB. Got hit by TB and also bat. Of course, bat is very inside the cave. You will have bat also as an important role. In blastomyces, B looks like 8. So it's very simple. In all dimorphic functions, the main organ is lung symptom only. Remember that, okay? Lung symptom. So here we call it as broad-based budding. B for everything is BBB, broad-based budding. Or figure of 8. 8 figure. Okay, that's all. Coccidiosis means cock. So whenever you have a cock, remember, whenever this cock comes, you have two things. One is your arthrospore, and this one is a spherule with the spores, spherules with spores in it. Okay, mainly arthrospore. That means Mr. Arthur is having a cock hen. Okay, Arthur is having a cock hen. Remember like that. Arthur is having a cock hen. This is rectangular shape. This is the one. This is the arthrospore. This is the arthrospore like this. And coccidiosis inside you have a sporules. That's all. Okay. What about paracock? Paracock, you have cock and then paracock. So it means surrounding something is there like this. So that is called cartwheel, pilot wheel, mariner wheel, any wheel, mariner wheel. Okay, this all are. Or Mickey Mouse. Simply it is called Mickey Mouse. Mickey Mouse sign. Mickey Mouse budding is such. That's all. If you see, this is for a paracoccidiosis. You know very well. This one comes Thalaromyces. Thalo, it's easy for us South Indian because Thalai means our Ajit. Ajit means red color. Anything red color. No, red movie we remember. So idea is here a bamboo rat will come. Bamboo rat is one of the main reason for this bamboo rat. So what you do, so what happened when this comes in, when bamboo rat comes in the house, what you take a broomstick, okay, broomstick or painting brush, broomstick or painting brush, broomstick or painting brush and give a nice slap on the butt of the bamboo rat. Then what happened? It will become red color. So red color on your reverse part of your SDA, sabrodextrosaga, right? Sabrodextrosaga is for the fungi. You know that one. You do it and you will get it. That's all. Okay, very, very simple. Yeah, that also recently they asked sabrodextrosa SDA is sabrodextrosa for fungi growth. So the pH of this one is usually, see, S looks like 5, no? So 5.5. 5.5 is the pH for sabrodextrose agar. Okay, just for this thing. Okay, that's all. So you see, the whole dimorphic is over and very simple. You will not make any mistake in this. Excuse me. Okay, now which of the following culture mediums for identify salmonella? I told you salmonella. Okay, so it's very easy again. It's again a revision of all the things, whatever we studied. Pilot. I told who is pilot? I told Maddie is pilot. Maddie, because what is that? McFadden. So McFadden, Maddie is, he was a pilot. If you see the picture, Madhavan was a pilot. So that comes in which disease? Anthrax. So in anthrax, no? So that is Bacillus anthrax. See how I'm remembering? You don't have to mug up anything. Pilot is a pilot. Who is a pilot? Maddie was a pilot. Cool pilot. Okay. Maddie for Bacillus anthrax. BYC looks like a bicycle. So when I say bicycle, who drives in bicycle? Legions, the military people. So Legionella. Strout, who starts to aim loving his New York boyfriend? New York boyfriend, you know that is your Neisseria gonorrhea. Nisha, Neisseria gonorrhea. So who is left out now? Our Wilson Blair. That's it. So this is the answer. Actually, what happened for Shigella Salmonella, everything is same. For Shigella and Sila G and Salmonella Salmon G, both are good friends. For these two people share everything. One they share is transport media, same. Enrichment media, same. Selective media, same. Except one thing. What is that one thing? We'll talk now. Transport media, both of them, when they go outside, they go with their socks. Without socks, they don't go out. Okay. Basically, socks. Okay. Socks. They wear socks and go. So socks, S-O-X, I'm going to write socks. Okay. So spelling. Sacs, buffered glycerol. Sacs, buffered glycerol. I'm sorry. Sacs, buffered glycerol. Glycerol. Enrichment media, for enrichment, they drink broth. What are the two broth they drink? They drink selenite or thiosulfate. Sorry, one second, I made a mistake here. Yeah, yeah, yeah. Selenite or tetrathionate. Okay, selenite or tetrathionate have broth. So they drink broth for enrichment. Okay. Like your Vibha drinks what? She drinks alkaline peptide water, Vibrio cholera. But your Salman and Sheila auntie, they drink hef broth. Selective media, DCA, XLD, Salmonella shigella, all are common. But one media, specially for only for Salmonella is your Wilson Blair. Is his bodyguard. Wilson and Blair are the bodyguard of our Salman Khan. Remember, Wilson and Blair are the bodyguard. So this is only for our Salmonella. That's the question. Okay. Easy. Repeated question. You can expect one question from here. Okay, that's all. Nice. Next question. Next question. I don't want to go to the question, see the picture, and I will tell it is a Giardia lamblia. Very simple. Okay, now which is false? They asked which is the false statement here. So, false statement. First of all, when I see the picture, no need anything. I'm just going to go. This is a Giardia. So that's what I repeatedly say. Giardia. I remember this Gia. Gia is that like bulb-like vegetable. No, nobody likes it. So Gia, what happened? This vegetable always falls down. It always falls down. And whenever mom cooks this Gia, what happened? You get steatoria. Okay, that's very very important. And then sometimes I feel like hanging with a string. I'm going to hang a string when I eat ghee. Okay, that much bad it is. For some people, not for all, some people. Okay, so these are the common things. Why I'm saying all these things are common? Because look, falls down because the motility is falling leaf. Ghia गिर जाता है. So falling down. Steatoria, fat malabsorption. Fat malabsorption is very, very common. Fat malabsorption. String test because you put this capsule with a string till which part? Duodenum, because you know that giardia there is D is there, so till it goes only to duodenum. Now we'll go to the question. So giardia, it causes steatoria? Absolutely. Gia, when you eat Gia vegetable, what happened? You get steatoria, fat malabsorption. Then on string, your capsule is inserted till jejunum. No, no, no. That's wrong. So that's the clue here. So you see D for D. So D for duodenum. Only till duodenum it goes, not more than that. Okay. You put the string capsule, the parasite will attach to the capsule, and then you take it out, and then you see in the slide. You put a wet mount and you see. Okay. Falling leaf is right. The cyst is oval shape. Definitely yes. The cyst is oval. This is usually it has two nucleus, and then it has 8 flagella. Whereas your trichomonas vagina Trisha has only 5 flagella and 1 nucleus. It's a single. But Gia is not like the Gia has 2 and 8 flagella. Okay, that's all. Very, very simple. Right? Okay, next one. Now, next question comes here. A HIV patient. HIV patient present with a persistent diarrhea, microscopic or stool examination given, the size of ooze is 4 to 6, which is the incorrect statement. Okay, the picture is given very nicely. So expected question, one question definitely you will have from this question, repeatedly asked question. So no mistakes here. So how to remember this? So we have this 3 in HIV patient diarrhea. It's caused by these 3. Okay, these 3. What are these 3? We are going to talk now. One is the cryptosporidium. Other one is your cyclospora. This is isospora, but please remember nowadays it is called as cystoisospora. Okay, so don't confuse with cyclo and crist. All are CCC now. Okay, they made it CCC. Okay, in order to confuse us more. Okay, now look at this. So here, here cryptosporidium, first of all, talk about the size. It is 4 to 6 micrometer. Double this in cyclo, 8 to 12 micrometer. Double this in isospora. It will become 24 to 36. Bigger one. C, no? So C. So it is C, you make it round. So it is round shape, circle shape. Circle, this is shape now. Shape, circle. Here also C, so make it round, circle, circular shape. Here it is C, it is like this. They say If you make eye like this, then it become oval. It's an oval, long oval shape. Okay, right. Next one. Acid fast? Yes. All are acid fast. Positive, positive, positive. This is sometimes negative, but yeah, it doesn't matter. Still it's positive only. Something called autofluorescence. Autofluorescence, shining, not crypto will never shine. But both the sporas will shine. Spora is like shining. Spora, yes, positive. Autofluorescence positive and positive. That is one question. Last is the treatment. When you talk about treatment, we always say cryptocurrency means crypto means it's of money. When money comes, who is Nita Ambani is the one. Nita Ambani should come in your mind. Cryptocurrency means. So that is Neto, netoxanide. Okay, netoxanide. Netoxanide. Okay. Netoxanide drug is the drug of choice, but for these two, it will be simply cotrimoxazole. Because they are not rich, you give cotrimoxazole. Okay. Huh. Okay, that's it. Okay, netoxanide. Nita, because that's what netoxanide. Netoxanide. Okay, netoxanide. Netoxanide. Okay, that's it. Okay. So now let's go to a question. So which is the incorrect statement here? So this picture looks like a cryptosporidium. So it does see, look at the size itself is enough to say that is this is a cryptosporidium. Autofluorescent test is positive for this parasite? No, that's wrong. That is the right answer. Acid pus? Yes, all are acid pus. Netoxoxanide is this treatment? Yes, this is the right spelling. See, I made a small spelling mistake here. That's what I was wondering. See, this some of the drugs are really terrible to remember their spellings. Huh? This is nitazoxanide. Okay, nitazoxanide. That's all. Okay, so occurs when CD4 less than 100? Definitely, I told you, less than 100, you have cryptococcus also and cryptosporidium also, and pneumocystosis and toxoplasma. So that's right. So your wrong answer is autofluorescence is positive in this parasite. It's the wrong answer. That's it. See, very, very easy and you got it. Next one, look at this image, beautiful image. I don't even think for me, they showed correct statement regarding the egg. So before going to the correct statement, I am only seeing, and for me, this looks like a barrel or dumbbell. It looks like a barrel or dumbbell for me. Okay, dumbbell shape. So what I'm going to do with the barrel and dumbbell and with a whip, I'm going to break something. What I'm going to break? I'm going to, no, wait a second. With the barrel and the whip, what I'm going to do? I'm going to try, try to break a coconut. That's it. With a barrel and dumbbell and with a whip, no, the one beating the animals for this thing. Okay, whip. I'm trying to beat the coconut. So I got all the answers here now. So this is the shape of this egg. Whip because it's a whip worm. Try because it is the Trichuris trichuria because it is the Trichuris trichuria. Coconut because the prolapse rectum get prolapsed and it looks like a coconut shell. So, is this which is the correct statement they asked? Which is the correct statement? Answer is the correct statement. Is this the egg of Trichonelospirus? Of course not. That's what I told. Try. Remember, this is a trichoria, not Trichonelospiral. Though both the trichina and trichospirus are nematodes, that goes different. You know the trichinospirus larvae insist on your muscle, and you will get all the muscle swelling in your buttocks, swelling in your back muscle. Wherever this muscle, you see the encystment of the larva, and trichinospiral is spiral muscle. Here, try to break the coconut shell because the coconut shell, the rectum, it has caused rectal prolapse. It looks like a coconut shell. That's what. Okay. So rectal prolapse. So this is wrong answer. Perianal itching? Of course not. This is basically that is enterobios vermicularis, not us. That's night itching. Coconut cake rectum is catastic. Exactly. So when you have a prolapse, you can get that. This belong to trematode? Of course not. They belong to nematodes. All of them, they belong to the nematodes. Okay. So coconut, that's what I'm saying. Barrel, so you break the coconut, or with the whip, you break the coconut. Finished. That's your try, and always try. That's all. Okay. So you got it. Next question. Yeah, this is a very easy question. Now it will be, see, that's what I took a little bit standard questions only so that, it will be easy for both the way. Okay. The following lesion causing virus can also cause which of the following? Okay. Now what I'm seeing here, for me, it looks like a oral thrush candida, or here they said virus. So virus means, for me, this is more a What would I think? I would simply think this is an oral hairy leukoplakia. Oral hairy leukoplakia. Who is having this oral hairy leukoplakia? Mr. Paul is having. Who is Mr. Paul for me? Paul, whenever the Paul comes, the only thing I'm going to remember is Epstein-Barr virus. So when Epstein-Barr virus causes a lot of cancers, if you remember, it can cause variety of things. What it can cause different lymphomas. It can Hodgkin, non-Hodgkin lymphomas, different type of Hodgkin, non-Hodgkin, non-Hodgkin. Again, it can get Burkitt's. All the lymphomas it can cause. It causes a gastric carcinoma. It causes nasopharyngeal carcinoma. So many things, cancers it can cause. Epstein-Barr is very important. So now what I'm going to think here, retinitis in HIV patient? No, that is a cytomegalovirus work, not mine. Yeah, cytomegalovirus affect the eye, it causes the retinitis. Ramsay syndrome, who? Ramsay syndrome. When the word Ram comes, you think about which one? Which virus you're going to think? You're going to think about this guy. What is his name? Our Justin Bieber. The facial paralysis, right? Ramsay G-nucleate ganglion. That is basically what? Varicella zoster, herpes zoster virus. Okay. So here, Ramsay, that means Justin Bieber, he had a Ramsay, he had this herpes zoster virus and he prayed to Ram. Remember like that. Okay. He prayed to Ram says. So varicella zoster. Okay. Nasopharyngeal carcinoma? Yes, definitely. This causes nasopharyngeal carcinoma. One most common cause for nasopharyngeal carcinoma is Epstein-Barr virus only. Okay. But Epstein-Barr virus, most common cancer is gastric carcinoma. We think it's H. pylori. Yes, H. pylori, yes. But H. pylori is the most common cause. But Epstein-Barr virus favorite cancer is gastric carcinoma only. Okay. Maltome of stomach, that is H. pylori. Finished. Okay, you can have always a cancer question, so please remember this very carefully. That's all. Okay, next, this we already saw the phase. Sporulation occurs in, if you remember, lag log S for S, so it is your stationary phase because we talk S T A T. T you can make it as a B. So spore forming toxin, exotoxin, A antibiotic, B bacitracin. Shortcut. So stationary phase. I'm not going to talk about that again. We did already enough. So now next question. Look at this question here. False about the nematode which undergo parthenogenesis. Oh my god, I love this parasite. When this word comes, I'm so glad because that is basically the word parthenogenesis all comes or ovoviviparous comes. The only parasite to come to your mind should be strongyloides. Strongyloides, stercoralis. Strongyloides, stercoralis. How to remember? Because you should remember strong woman woman. Okay, remember it's a strong woman because here they this stronger circle is there is no men needed, no men, that is no men means no male worm needed, no male worm needed. They directly, without any sex, they directly produce the egg, but that egg hatches into larva immediately. That's what we call it as ovoviviparous. Ovoviviparous. Okay, one is parthenogenesis, no male worm, directly without sex it's hatching, that's called parthenogenesis. No male directly this thing, so parthenogenesis. Okay, no male worm directly it's going, and then egg hatch and larva ovoviviparous. These were characteristic feature. Then you know that strong women's what they do, they are very fast larva currents, they are like a current, so it causes larva currents. Strong women's, they go barefoot. So that is what, because of barefoot only, what happened, the larva enters inside, the filariform larva enters inside, and you see, so this is larva immediately. So in stool, you will see only larva, no egg. In stool, only larva. So everything larva, larva, larva. Egg is totally no use in strong lady. Strong woman egg is no use. Remember like that. Okay. And no use for male worm, no use for egg here. In strong woman, no role for egg and no role for male worm. So larva and barefoot, absolutely right. We just spoke. On stool eggs, egg is seen? No, we don't egg. Okay, that's wrong answer. You don't see no male worm. No egg is important for your strongylitis women. For strong women, this is not needed. Strong woman, because this is a clue. Okay, strong woman means because only female worm is there. So remember, like a strong woman. This question is repeated many times. Parthenogenesis over viviparibus. You have so many questions every time asked. Larva currents, I told you, because the larva migrates like so fast, okay, compared to everything. Female worm lays egg with the foot, that's the parthenogenesis, right? Okay, so your answer is on stool, egg, never egg, because the egg immediately hatches into larva. So you will see actually rhabditiform larva in stool. You will see rhabditiform larva, you will see in the stool, not this one. So easy. One strong lotus, you can easily get it. And of course, the treatment is you're going to give ivermectin. That's okay. That's for later, not important. We'll discuss later. So this is exactly, this is the larva currents you see. Larva currents. This is the larva you see in the stool. The same, the larva you see in the stool for strongylitis. That's all. Okay. Okay. Now why this came? This came because this is a hookworm. This is a hookworm egg. Why I wrote hookworm egg here? Because you know in hookworm two things come. See, here that is, okay, let's say like this. Sand, my name Sand, barefoot. I'm a poor guy, I don't have a slipper. So I go barefoot only, barefoot, okay, barefoot. So my name Santos Sand. S for strongylitis. Remember only strong, hey, what I'm doing. STRON, strongyloides. A for ancylostoma. N for necator. These three, barefoot is the main is because the larva enters through the barefoot and then they cause the infection. Okay, these three. In this, these two are hookworms. You know that hookworm. And this is the hookworm egg. For these two, the egg looks like this. In stool, you'll see the egg, but not for strongylitis. In strongylitis, in stool, you'll not see this egg. Only these two you'll see. In strongylitis, only larva, no egg. Only larva, no egg. Because the egg hatches out with larva immediately. So here, hookworm like this. You see this hexacanth embryo, hexacanth 6, no? So hexacanth embryo with a space surrounding. So you don't confuse with ascaris. This type of this clear space and all comes to this space. That's your hookworm, either ancylostoma or necator. That's all. Okay, nothing much. Okay, that's all done. Next question. Oh yeah, this is another beautiful question. I love this question. When this question comes, spine comes. I think. So what is this? Look at this question here. Is false about this egg below. False. Okay. First of all, look at this egg. There's a spine. Whenever this something spine comes, okay, spine comes, you have to think about which one? Cystosoma. Cystosoma. Cystosoma also very interesting. Everything goes with yes. Now we'll talk about it. So cystosoma has three things. Okay, let's hear it. Cystosoma pictures here. So this is the cystosoma. Here what happened is that this is one of the eggs where eggs are closed, no any lid. Okay, so this is all closed. The eggs are non-operculated, not open, non-operculated eggs. And they are the primary host is always the definite host is always the man, and we have only one intermediate host, that is snail. Remember, snail, S for snail. There's something called okay, we'll talk about that. Swimmer's itch. There's something called swimmer's itch also. Swimmer's itch it causes because it penetrates only. Because this one, the infective stage is the infective stage only for in among the trematode, only for cystosoma. The infective stage is cercaria. Cercaria, C and S sound similar. That is to skin penetration. That's what we get the swimmer's itch. The swimmer's itch is because of that only. Cercaria, skin penetration. So all yes. Okay. Now we have three species. One is cystosoma mansoni. This is cystosoma hematobium. Look why I'm writing T like this. And this is cystosoma japonicum. Now you know very well, cystosoma hematobium T means C. It looks like a terminal spine. No, only one part. I'm sorry, not the upper one. So look, it looks like a T, no, T shape. So terminal spine. So this terminal spine comes, you think about hematobium, terminal spine. But what about this Mansi? Mansi has a beautiful side wall. See, Mansi has a side spine. She has a small pimple or whatever, on the side. Okay, she's very cute. Okay, she's cute. She has a pimple on the side spine. Okay, side spine. Japonicum has a small knob-like nose. Small nose. They have a small knob-like nose. That's all. So that is thing. So anyway, whatever. The ideal thing here is hematobium T causes cancer bladder carcinoma. It is present in the urine. So urinary bladder carcinoma. So in urine, you can see it commonly. But these two causes Katayama fever. Katayama fever. Fever, mostly it causes bilharziasis. Bilharziasis means sort of intestinal infection only, nothing much. Okay. So now with this question, now I saw a terminal spine T is there. So I'm going to think what? I'm going to think T for so hematobium. Hematobium. So this is causing the cancer. So what it's causing? Intermediate host is there? Definitely yes. S for S. So it's right answer. Bladder cell carcinoma? I told yes. It is in the bladder only. So it causes bladder cell carcinoma. It's right. Metacercaria, that is wrong answer. Why? I told for all trematode, metacercaria, picovirus. But here it is cercaria. Remember, for trematode only for cystosoma, cercaria through skin penetration. This comes. Okay, spinach. That's what they call it as, swimmer's edge. Okay, it's like a small eruption will happen on the skin. That's only swimmer's edge. Okay. Next is egg is infant urine. Definitely yes, because it's in the bladder. No, it's in the bladder. So bladder means of course you will see in the urine only, not in the stool. You will see the egg and urine only for hematobium. So this is an absolutely delicious question. Okay, very nice question. So don't miss. These are like little bit standard question, but if you are able to master this, then FMG is nothing for you. Okay, you will only pass with high score for sure. Now look at the next one. We are nearing only a few more questions. Yeah. Now this question is another very easy. Look at this. I not say everything is easy. When I say easy, don't you think, oh, sir, he's saying everything easy? No, really, it's not easy. I can understand. These are some standard questions, yeah, but that's the way. If you know this standard, that means you can easily clear nicely, okay, your FMG exam. So here is a patient with a seafood intake, prepared, has a hemoptysis, cough, red sputum. Okay, sputum examination exercise. See, first of all, so this all looks like this thing. So let's think here. Seafood intake is there, something crab or something crab or fish, something should be there, and lung. So it more look like it's a fluke. Okay, so this look like a lung fluke. They said sputum, no, same up there. So it's a lung fluke. So shortcut is enough when there's a lung fluke, only one. Who has a lung problem? Our poor guy money. He goes to seafood, he eats crab, crayfish, everything, crab, fish, or whatever he eats and gets money. So that is Western money. Our paragon's Western money is done. Okay, but the shortcut here is basically when you put trematode, shortcut is sisters can play flute. Flute is because it's also called fluke. That's what I've made as fluke. Okay. Sister, you already know. Why did I say sister? Cystosoma. We already spoke about cystosoma. Can. This is because clonorhynchus sinensis. Clonorhynchus sinensis. Opisothricus also. This is paragonimus. Western money. Flute because fasciola hepatica or hepatica and fasciolopsis busci. Okay, that you know. So this all first cystosoma everywhere snail is the first intermediate host and second intermediate host differs. So that's what in clonorhynchus everything is no paragonimus western money. Para is there. Okay, para you can say para. So it is crab or crayfish. That's what. Okay, but here paragonimus western money. Okay, then. Clonorhynchus sinus is sounds like a fish. So here the intermediate host is snail and fish. For fasciola hepatica, Hef A is there, Hef A. Here the second input is fresh aquatic plants. Fresh aquatic plants is the second host. That's all. Okay. There's a trematode. Shortly. Okay. This all. Next question. Yeah, these are all very easy. You're going to answer very fast. I know that. A patient history with a seizure underwent CT. He showed following image. What is this? Okay, a patient has a history of seizure, seizure, and here you see multiple what called starry sky. CT means you see starry sky appearance. Starry sky appearance in CT with multiple focused seizure. The thing that has to stick in your mind is neurocysticercosis. The most common cause of seizure in India in children with seizure, epilepsy, anything, the most common neurocysticercosis. Neurocysticercosis, you know that is basically the tinea solium. Tinea solium, the pork eaters autoinfection due to autoinfection they get it. Okay, autoinfection get it, especially for neurocercosis. The infective stage is egg, not the larva causes teniasis. Egg causes the dangerous egg only. It goes to brain cause neurocercosis. Infective stage is egg. Very good, it's right. They say false statement. Autoinfection definitely is autoinfection through fecal oral through fecal-oral route or through regurgitation. Anyway, it can happen. We never know. Okay. Cerebral signs are due to live. No, this is wrong answer. It can, but usually it's during the degenerative phase. When the larva is trying to death during the degenerative phase only, it releases, we have the immune response and patient gets all the seizures. So that is wrong answer. Second most common is subcutaneous muscle and the skeletal muscle. Okay, they are right. Of course, subcutaneous most right. That's also right. So cerebral signs are due to live larvae. So not a right. It's a wrong answer. Okay, that's all. This is very easy. So starisca appearance is one you say in CT scan. Mm. But in biopsy, the radiology people call it stari, but the pathology people they call it as a Swiss cheese appearance. They call it a Swiss cheese. Pork and Swiss cheese, nice combo, no? Pork, tinea solium, and you eat with the Swiss cheese. Very good combo. Okay. So in microbiology, we don't say anything. Okay. We just simply say tinea solium. Okay. So CT radiologists call it starry sky. The pathologists call it as Swiss cheese. And we microbiology call it as just simple tinea solium. That's it. Pork tape. Wow. Okay. We are good people. Next one. Next one. Now look at this question. Yeah, so the patient presented with a facial edema. Yes, this question I expected. I want you guys to know this because this is expected. A facial edema myalgia in a deltoid region. So everything, see, facial edema myalgia. And they did a muscle biopsy. Everything muscle, muscle, muscle. And they saw the larva was seen. This is the larva they have seen. Okay. This is the larva. Typical larva you're seeing. This is the muscle. So whenever there is a muscle, muscles are always spiral, no? The muscles are always spiral, right? Most of our muscles spiral. So when it comes spiral, I make it very simple. I don't go too much. I simply say Trichinella spiralis. Muscle spiralis. So anything with the muscle comes, skeletal muscle. I will not waste my time thinking too much. I'll go spiralis. So why I'm saying this? The disease occurs due to skin penetration of the larva. Right statement. Of course not. This is because of what? Trichinella spiralis due to pork. Not only Otinia solium is pork. Another pork is this Trichinella spiralis. So this is because of eating the pork larva. Pork and pork containing the larva. Right. Oh, sorry. Pork containing the egg. I'm sorry. Yeah, I should change this. Okay. Okay. So this is basically the pork egg. Yeah. Pork with the egg of this one. Not pork's egg. Pork's containing the egg. Costivision tenosurium, of course not. Okay. Because that is this encystment larva is there is no larva in tenosurium. You have only there is larva, but then it's not like this, not skeletal muscle, this typical. Okay. This much symptoms of muscle will not be there. Egg is dumbbell shape? Not at all. Egg dumbbell is basically trichuris, trichuria. Try. Mode of transmission is ingestion of uncooked. Exactly. This is the thing. Uncooked pork you eat, and then the egg goes and develop into larva and go insist on the different muscle. That's what you're getting facial edema, myalgia, because this larva accumulates in all your muscles. That's all. Okay. Finished. 89th question. This is another beautiful question. Expect this question because we had outbreak on this question recently. Outbreak. We had outbreak in South in Bangalore. We had many outbreaks. So they might you expect this. History of swimming. Swimming in public pool. Suddenly developed meningitis symptom patient. Admitted in hospital, but he couldn't survive. He died. This much dangerous disease means that should be only your Naegleria fowleria. Naegleria fowleria. Okay, swimming pool is more than enough to say. What happened? Who died? Mr. Nigel. Nigel, I call him N-E-G, Nigel or Naegleria, Nigel. Okay, I call him Nigel. Nigel, what happened with his girlfriend? With a girlfriend name is Pammy, Pamela Anderson. Pamela Anderson. Okay, we call her sweetly Pammy. That's for fun. Okay, Pamela. Pammy, we call Pammy. Okay, why do I call Pammy? Both of them, what they're doing, they're nicely enjoying in the swimming pool. And unfortunately, Nigel has to die. How he died? By getting Pammy. What is Pammy? This is the Hmm. This is basically where is this? Yeah, progressive amoebic meningo encephalitis. It means you see there is meningitis also and encephalitis also. Where the words are very, very important here because the meningeal signs will come only in Naegleria, not in acanthamoeba. Acanthamoeba it is just directly amoebic encephalitis. You word meningitis comes means it is only for the Naegleria fowleria. So Nagel because Naegleria fowleria Girl with Pami, because Pamela is basically progressive amoebic encephalitis. Swimming pool, they get this. They usually, this is the shape. This is the shape how it looks like at one pen like this and this like this. Okay, nothing special. Just it's just trophozoite. That's all. Swimming pool comes. This is the reverse. Nigel, girlfriend is Pamela, going to swimming pool and ending up getting this one, and he dies. That's all. Poor him. Okay. Now, what about this one? This is another very interesting question. They are same friends. Naegleria, and this next question, I think already you have found by seeing this picture only you would have found, seeing the spikes, seeing the spikes. But still, we'll go to the question. So, to students who don't know, no need to worry. Don't need to worry at all. If you think that what this sir is saying, so advanced thing, no, it's not advanced. Everything is there. So, yeah, somehow this revision will give you a lot of clue and many things you will be answering. I'm very positive about it. Okay, I'll pray God for that also to get good thing. So this patient with keratitis, on examination of the following is keratitis, just keratitis. False statement. I have a keratitis. I have two clues. One, I have a keratitis, and another one. So keratitis means I'm thinking about someone who's wearing contact lens. Okay, someone who's wearing contact lens. And second one, look at this one. He's having spikes. You know, this is so beautiful, handsome guy. He's having spikes. You know, he has a lot of spikes. So if this type of things comes, who is the guy? I'm going to think only one guy, Icon, our popular singer, Icon, right? Icon. So Icon, for some reason, whatever things he does, it looks more like a gay, gay. I'm not G-A-Y, G-A-E, I'm going to put G-A-E. Okay. So why Icon? Akantamioba. Why I'm saying gay? Because gay, two things the gays will do. One thing, they wear contact lens. And that's what he got. Contact lens he wearing, that's what he got, keratitis. And what they do next one, they do spikes. This is common. Coloring the hair with and making spiky hairs is very, very common for gays. So you see spiky, that's all. And even the cyst is double chin. Sometimes they become too fat and they get double chin, double chin. The double chin because the cyst is having double chin. Double chin because the cyst is having like a sort of double chin. Okay. Double chin cyst, that is basically cyst. So GA is very, very important. Why I put it gay? It's not to say gay, it's just for fun only, nothing. This is because it is called granulomatous amoebic encephalitis. See, there is no word of meningitis here. That's what Naegler fowleria and this acanthomioma is one topic. You miss one word, you're finished. That's what I'm saying. Naegleria, remember Nagel's girlfriend is Pamela Anderson, Pammy. But our Acon acanthamoeba is a gay, GAE gay, not GAY, GAE gay, granuloma amoebic encephalitis. Simple, simple, simple. Now you never ever in your lifelong you will not forget this. Okay. So contact lens risk, definitely yes. Cause the encephalitis, absolutely. That's what we're talking now. Quadrinucleate cyst is a characteristic. No, that's what I told you. I'll come there. Non-nutrient agar, exactly. All these things, for culture diagnosis, you use the non-nutrient agar with E. coli because parasite eats the bacteria, no? So it is basically non-nutrient agar with E. coli is there. It eats that bacteria. Why not quadrinucleate cyst? Because here the cyst is, I told, double-walled cyst you will see. Here it's no picture is not there. Double-walled cyst. The cyst will be having first layer and then second layer like this. So it's a double layer, double chin. That's why I say this gay guy Akon has a double chin. Okay, like us. Okay, furnace. Now, next, look at this. A patient is residing from, here the patient is residing from Bihar and he has a fever, hepatosplenomegaly, hyperpigmentation, pancytopenia, hypergammaglobulinemia. So this is Bihar is one clue, and with hyperpigmentation and hepatosplenomegaly, one shouldn't miss which disease? Kala Azar. Okay, so that is Kala Azar. Kala Azar, you got it. Okay. Jimsa stain was done and this was identified. The beautiful picture as given. You can see very nicely. I can enlarge it also. Okay, if you want. So you can see here, if you see deeply inside, the picture is exactly like this. Like this, like this. Okay, inside you have many things like this. This is basically, what is this? This is the A mastigote, which also called LD bodies. The Leishmania Donovan bodies. Not Donovan body, that is different. Donovan this is Leishmania Donovan body, which is a mastigote, not promastigote, a mastigote. Kala Azar, because it is caused by which one? You know very well. Kala Azar means itself, you guys know very, very well. What is that? The causative agent is the Leishmania Donovan. We have Leishmania tropica, which goes oriental ulcer, Leishmania mucocutaneous caused by Braziliensis. Okay, mucocutaneous Braziliensis. We're not talking about that here. Leishmania Donovan, Kala Azar. So now the question. Vector is, of course, sandfly. You know that. Vector is, now here, we're going to the thing. Okay, yeah. The vector is Sandfly is right answer. Promasticoid. Oh yeah, this promasticoid is not diagnostic. It's a masticoid. Just now we show in the picture. This elder body is a masticoid. It's not a promasticoid. Okay. RK39 is a detection. Very good. That is true. It is for rapid test. You have to do RK39 antigen only. Okay. And Napier's aldehate test is to detect the hypercombinant. Absolutely yes. Napier's aldehate test we do. And also we have this antimony test. Okay. Antimony test also we do. So this is all fine. So this is a wrong answer. So this is the answer. Wrong answer. Okay, right. Now, next one. A patient with a history of to America developed a symptom of myocarditis and megacolon. Jimsa stain was showing the following image. So what you are seeing here is it's a typical trypanomasticode. Trypanomasticode. Sir, how can you say? I can't based on the clinical symptom only. I'm saying it is, and you see something like this flagella, glandular things are coming in. That's very typical of trypanomasticode only. Okay. Now let's go a little bit about this and come back. So okay. So okay. I didn't have the picture. That's fine. No problem. So here, how to remember? If you remember this trypanosoma. Trypanosoma, we have cruzi. Other one is Trypanosoma brucei. See, this one cruzi means you know that that's a. I always say my student remember Tom Cruise. Tom Cruise, you know, he is such a romantic guy, no? So he first of all, he's in America. He is in America. And he lives in which city? Vegas, Las Vegas. No, he's from the Vegas. He's an actor, so he lives in Vegas, of course. America, Vegas. Everything is big for him. Big muscle guy. No, so everything is big for him. Big muscle guy. So everything big, big, big. He's a romantic guy. He loves kissing, kissing. You can see all his movie. He loves to kiss, kiss, kiss. Okay, that's all. This much. So you have all the answers here now. Why did I say America? Because it's an American sleeping sickness. American sleeping sickness. Whereas Bruce Lee will be African sleeping sickness. African sleeping sickness. Okay. Vegas because the disease name is Chagas disease. You call Chagas disease or American sleeping or Chagas disease. Vegas Chagas. Okay. So don't forget. Okay. Big muscle because three important organ goes big here. One is your, he have mega colon, mega esophagus or esophagomegaly. And he also have cardiomegaly. Understand? Three organs go colon, esophagus, and cardiomegaly will be the only three, not other organs, not hepatomegaly, not splenomegaly, not other things. Only colon, esophagus, and cardiomegaly. See, it's just Tom Cruise, everything is strong. Okay. Romantic because there's a sign called Romano sign. Romano sign. The eye swelling will be the Romano sign. Kissing because the bug name is called kissing or reduit. Ready to kiss. He's ready to kiss or reduit. Ready to kiss or reduit bug. Here it is different. Here Bruce Lee is caused by CC fly. CC. So he's a good guy. Bruce Lee always liked to see his girlfriend Glossina. Other name is Glossina. And only thing is he gets winter bottom. He loves winter bottom. Only Bruce Lee loves winter, not this thing. Only Bruce Lee loves winter, not our Tom Cruise. Only Bruce Lee likes. Okay, so we got it. So come. So this is the typical myocarditis megacolon, and America is enough to say we are talking about our Tom Cruise, Trypanosoma cruzi, Tom Cruise. Okay. So vector is ready with bug. Yes, kissing bug. I told Tom Cruise loves kissing bug. Absolutely right answer. Triple N media. Yes, this you should know. For both Leishmania and for trypanosoma, triple N media is one of the characteristic media. Okay, that is important. A case of Chagas, of course, I told Tom Cruise loves Vegas, so he goes there. Vegas is his favorite place. But Winterbottom, no. Who likes Winterbottom? Our Bruce Lee likes, not Cruise. Tom Cruise hates. That's what he's in Vegas, the hot city. Bruce Lee likes African cold countries. So this is typical of Bruce Lee. So that's the wrong answer. See, how did I roll it out? I only have to remember Tom Cruise and I have to remember our Bruce Lee. Topic over. I finished both trypanosomas over for me. Okay. That's it. Very, very simple. Isn't it easy? Isn't micro so easy? Many times people keep on complaining. No, this is tough, tough, tough. Just kidding. I know it is tough. Yeah. Sometimes, yeah, it's the only way how you study and you get it. This is an exam now, so just relax, just revise what I'm saying. More than enough, you'll get it. I also know how you guys are feeling because I've also been to a lot of exams like that. So it's okay. You will do well, no doubt in it. So hemorrhagic fever. Now, when you talk about it, which of the following is not cause the hemorrhagic fever? Okay, which will not cause. So first of all, remember this filovirus. We have two things: Ebola, Marburg. So one thing. So why I'm saying This time Marburg is spreading, so you can have question from Marburg also. Bola is बोला को मारा है. Phil, what he did, bola ko, he kicked the bola. So bola got, but when you kick the bola, he'll get always bleeding, no? He will get bleeding, of course. You know that. Yellow fever means white yellow, bleeding is there. Dengue to catastic petechiae, it's there. So that is also one thing. So bola is right. Yellow fever also right. What about KFT? Yes, I went to this KFT, this is a Casnor forest disease. I went to the forest, Casnor forest in Mysore, and I fell down. Accidentally, I fell down. When I fell down, what I'm going to get? Of course, I'm going to get bleeding. Yeah, crazy or what? Of course, I'm going to get bleeding. So the idea is when Phil Bola Kamara, you will get bleeding. So hemorrhagic fever. When in Koishnor forest disease, I fell down accidentally. Again, I got bleeding. In dengue, the bleeding is already there. You don't need to say. So all are right. So West Nile is wrong. West Nile and Japanese encephalitis, Culex, they cause encephalitis. Encephalitis, like Nipah virus. Okay, they call encephalitis, not this thing. Okay. Wow, nice. So we have only few more questions left. Easy questions, very important questions now. Okay. False statement regarding Coxsackie A virus, Coxsackie A and Coxsackie B, right? This comes under the picorna virus group. So now let's talk. It causes the hand, foot, mouth disease? Absolutely yes. Acute hemorrhagic conjunctivitis? Absolutely yes. It belongs to enterovirus? Definitely yes. Okay, picorna, picorna. So in that entero group it comes. Spastic paralysis, yeah, there you have to think twice because we have Coxsackie A and Coxsackie B. Coxsackie A, you remember first alphabetic letter F comes, then only letter S comes. So A for flaccid paralysis. Here it is the spastic paralysis. So your answer here is wrong. That's it. Okay, very, very simple. See, nothing you have to think too much. A means A and B order, F and C. First comes F, then C. So flaccid paralysis, other one is spastic paralysis, Coxsackie B. This is the hand, foot, mouth disease you're talking. Okay. So catastic, you can ask any question. So remember, Coxsackie, one question can be coming. Okay. That's what I call also herpetic angina. Another disease which you forgot is here, herpetic angina. Throat, basically it's affecting the throat. That's what you call herpetic angina, right? That's all. Next question about a polio. Look at this. Now here, the true statement regarding the polio infection, polio virus. So what is here important polio virus infection? We have polio 1, 2, 3, type 1, type 2, 3. So type 1, 2, and 3. 1 is overall most common. 2 is very highly antigenic. 3 is the one which associated the vaccine-associated paralytic polio. After vaccination, when you get polio, vaccine-associated polio is there. Anyway, polio is eradicated, but still. So, type 2 causes VAPP, absolutely wrong. That is type 3. Sabin is a live vaccine. No, it's a live vaccine. Salk is a killed vaccine. So live vaccine recommended? Of course not. You will be giving only Salk, the killed oral polio vaccine. Yeah, the killed IPV vaccine you give. Okay. So this Sabin is a oral live, so you can't give. Naked RNA virus? Yes, it comes under RNA group. Now DNA is a happy virus. It did not come in happy. So polio comes in RNA only. Okay. Again, it's coming in the picornavirus. So this is a right answer. It affects the posterior horn? No, it's not a posterior. It is usually affecting the wait a second. We have to check here. 1 second. This is coming under, okay, there's true question only. No, it's fine. Okay, fine. 1 second. There's a small change here. I'll tell you what it is. Yeah. We will stop with the naked RNA virus. Okay, 1 minute. So affect the posterior horn, it's right. Yes, this is naked is fine. Once again. Yeah, post is fine. Here, posterior horn is for sensory. It should be anterior horn. That is for muscular. So that's what you get a paralysis. Now, what about this naked kicker? In RNA virus, when you talk about naked, there's only 3 viruses, PCR. One for picorna, other C is the calci, other one is your Rio. Naked virus, naked RNA virus. Okay. So, under picorno only polio will come. So, this is basically a naked RNA virus. Right. Okay, that's a shortcut. Naked RNA shortcut is, remember, PCR. Picorna is naked, calci is naked, Kali, the fighter is naked, the guy is naked, and then Rio, the bird is naked. That's all. Okay, this one. So it's a naked one is right. Posterior one is wrong. Anterior one is for motor. Okay, that's what your paralysis. Okay, very simple. Got it. Next one. True. Yeah, nowadays Nipah virus is very important. So you should know true regarding Nipah. Excuse me, Nipah virus. It's transmitted by the Aedes. True. They said Aedes mosquito. Of course not. It is by you remember Nipah. Fur is a fruit bat. Na? Just transmitted by fruit bat and all the secretions. It could be one person to person secretion can go, mother to child it can go, right? Sexual transmission, everything is there. So basically secretion, not the mosquito. Orthomyxoviridae group? No. Nipah belongs to paramyxo. Okay. Paramyxo group. Hemorrhagic fever is statistic? No, because no, encephalitis. Encephalitis. There is already clue there. Encephalitis. So it is affecting this, not hemorrhagic fever. Wrong. RT-PCR, definitely. Any virus, the best is RT-PCR only. Okay, or serological test. So very simple question to confuse again us because the latest question Nipah virus. So be careful. Fruit bat was asked in last time. I think, yeah, last FMG also they gave a picture of fruit bat and told what it is, which disease, which virus is causing this. It's a Nipah. Of course, Ebola also can go to fruit bat, but ideally Nipah is very catastrophic. Fruit bat and all these things. Okay, very, very simple. Okay, next. Now, this is another very important question. You guys not supposed to make mistake here. A child presented with a barking cough, not catastrophic of this virus. Okay. So when it is a barking cough, whenever it's a barking cough, the only thing which comes is called croup. When you say croup is caused by which virus? It is caused by your para-influenza. And para-influenza belongs to paramyxovirus. Paramyxovirus already is a clue. Para. Okay. Now, it is causing, of course, there's a symptom in a croup. You will see stridor will be very, very catastrophic. Now, what is wrong? Croup is totally fine. And the disease croup means acute laryngotracheobronchitis. That's called croup, right? That's called croup. Paramyxoviridae, very good. Thumbprint, let's wait there. Stridor, yes, catastrophic. What about this thumbprint? No, this is for thumbprint is for your H influenza, especially epiglottitis. Okay. Here what we have here, the sign is called, X-ray sign is called steeple sign, church steeple or temple, the steeple sign. The sign will be like this, no? Cross over, steeple sign. So that's what. So here, see, you see, this is somewhat very much, it should be like this. Ideally, it should be like this. It should be like this. This is the right. This is steeple sign. This is steeple sign. For picture I put it. But if it is somewhere here, if it's epiglottitis, it should be somewhere here like this. That would be epiglottitis, which is thumbprint. It's not here. Here it's not, but I'm just writing thumbprint. Okay, remember that. Okay, that's very, very important. Steeple will go for your crow and paramyxo, and the other one, the fingerprint will go, the thumbprint will go to your epiglottitis H influenza commonly. Okay, yes. Next one. Which is one true regarding influenza virus. Yes, again, influenza. How they can miss influenza? Nobody will miss an influenza virus. It's very favorite for everyone. So influenza virus, true, they are true. You have to know that about influenza virus a little bit. If you remember, antigenic drift is responsible for major epidemics. It's a wrong statement because I always say the dangerous one is your shift. Antigenic shift. Shift means I told you to remember the shift car, our Indian car, the beautiful shift car. If you remember that shift, everything shift is going every 10-year once. This car is going genetic ressortment. Genetic ressortment. That's what it is popular worldwide pandemic. Okay, epidemic, pandemic, everywhere it's there now. Our shift car, our shift Maruti shift car is there everywhere. I gave you already clue. Every 10 year you have genetic ressortment and your pandemic. That's all. This is the answer. So, and drift is major epidemic. No, anti-drift is a mind point mutation. Nothing will cause. Shift causes everything. Okay. So it has two organs, but no, influenza virus is segmented, which has 8 segments. Two segment is basically HIV. HIV has 2 segments. So this is a wrong answer, wrong answer. Neuraminidase helps in the adherence and entry into mucosa. No, opposite. This is done by hemagglutination. Hemagglutination is the one for entrance. Neuraminidase is for the exit. The virus exit out through neuraminidase. Sialic acid receptor, it breaks and comes out. And the gram-positive cocci pneumonia is common complication. Absolutely right. in pneumonia, this is the most common. The bacterial secondary bacterial infections are very common. So that is basically due to staphylococcus or strep pneumoniae are the common causes. So that's the right answer. Rest all are wrong. It has an eighth segment, and of course it belongs to orthomyxovirus. Ortho guys have flu. Remember, right? Ortho guys working so much work, they get what? Flu. Orthomyxovirus. Yeah. Now next one. Which gene in HIV virus responsible for transcriptase, integrase, and polymerase? So for this, again, the shortcut is see. We have envelope gene. What is envelope gene does? Envelope means it's envelope, no? So this is basically for group 120 protein and group 41 protein ka synthesis it's needed. Gag gene, Lady Gaga, her age is always between 17 to 24 for this group protein. Pool gene means, remember, pool of enzymes. That's what this comes. So what are the pool of enzymes? You have pool of enzymes, transcriptase, integrase, and polymerase. So this is the right answer. Very, very simple. That's all. You got it. Neph gene, no. Throw about this Neph. Neph gene is no use for anything. So it's omitted. Okay, that's a non-structural gene. So not important. Okay. Yes. So we have come into a last question. Antibody dependent enhancement, ADE. So what is this one? This is when first time virus attack, it produces immunoglobulin, non-neutralizing immunoglobulin. This one, now second virus attacks, instead of decreasing the symptom, it increases the pathogenicity, increases the virulence, it increases the virulence. So it becomes serious, severe disease. Severe disease. So this is very characteristic of which one for our characteristic? ADE means itself, it is for ADE, D clue is there, DE is there, that is your dengue virus. Especially dengue hemorrhagic fever. So when it's dengue virus, what you're going to say? So don't forget the word exactly. Antibody dependent enhancement means dengue virus. Okay. Now what happened? If you usually group the dengue, here what happened? The dengue virus 1 attacks first time, and second time if it is dengue virus 2, instead of protection it will cause more. That's what people is having dengue hemorrhagic fever. Hemorrhagic fever. So the virus causing swine flu? No, it's not influenza. The virus causing encephalitis? No, it is not Japanese encephalitis. It causing hemorrhagic fever? Yes, that is your dengue hemorrhagic fever. Severe immunocompression, that's not HIV, not severe immunocompression. So that's wrong. So your answer is this one. That's all. Very simple. So I almost covered the controversial topics. I think to say shortly, we have covered all the controversy bacteria that you will not get confused or mixed. Okay. Rest all direct questions you have done. No, types of viruses, that's not very easy and you have done it. So this 100 question standard question. And yes, all the best once again. I know that you guys will do well. I'm waiting for know your results. Okay. I hope this session is useful. Let's see if I have time, we'll do more session. But anyway, this is more than enough. You guys will do very well. I'm very positive about it. Okay. So once again, all the best. Do well. God bless you guys.